Excuse me, can I have Crystal Ellis come down, please? Oh, okay. Are you for or against?
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Here, please stand for the Pledge of Allegiance, and there will be remarks by Councilmember Pauls, who has said you don't need to remain standing for his remarks. They're not.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good afternoon. I have a few letters that I'd like to read, and I will let you know up front some of these are imaginary. The first letter that I'd like to read it's a letter from 3 city council members who decided to take the bull by the horns and come up with and show a little bit of leadership on their part to create a ordinance that would be of value in their eyes to the city of Omaha. Then I received another letter from a couple of on the council, said, hold it. We need to make a few amendments to make this a better ordinance for the city. And the part I liked about that is my past experiences in the legislature. You normally did not just start with one idea and that was it. You worked it through to make it better. So that's what I received from that letter. Then also, I went through my pack and I saw a letter from the School Board of Omaha. And I'll just read a very short section of that. We urge the Omaha City Council in the strongest possible terms to mandate face coverings, be worn in public, and to implement the ordinance immediately. And as many of you know, they are having some issues with that. And if you read in the paper today, Millard, Westside, all of the school districts are having issues because they're trying to make this work. I sincerely believe that. And the interesting things about it, I would tell the superintendents of Millard, Westside, Elkhorn, and the other suburban school districts, be pleased that you do have some of these issues to talk about. Because in 2005, the Omaha School District wanted to take over all the suburban schools. So if you're a superintendent out of one of those schools and you're having some issues, value your job. It's a tough job. I would not personally want to have that. And then I've heard people say, well, you need to have a little research on this. I know there's all kinds of research out there, but I truly believe you need to take a local research. So the Metro Omaha Medical Society, they indicated in their letter that they are for some type of mask because in 41 states that is part of the state's culture. And then they mentioned some of the local health bodies that are for this. So then I have people say, whoa, Rich, this is government overreach. And I understand that. I don't like to be told what to do, to be honest with you. As a school administrator, I did not like to be told what to do. That's just part of the culture of those jobs of leadership. But then we received a letter from Mutual Omaha, Union Pacific, Ameritrade Holding Company, Creighton University, Valmont, Nebraska Medicine, First National Bank, Pfizer, indicating that they support this. Those are major companies in the city of Omaha. And I have one final letter, if I can read my handwriting. It says, please find a solution. So it's probably time to get started. Thank you.
An affidavit of publication is on file for the pre-council and city council meeting, and a current copy of the Open Meeting Act is posted in a white binder on the east wall of the legislative chambers.
Good afternoon, ladies and gentlemen. Welcome to this meeting of the Omaha City Council. We thank you for being with us today. As a courtesy to those in attendance and to facilitate the conduct of our business, we ask that you turn off or silence all electronic devices. If electronic devices are heard during the course of the meeting, you'll be asked to leave. Madam Clerk.
One public hearing can be held for items 6 and 7 relating to masks. Item 6, an emergency ordinance to add Article 3, Sections 12-41 through 12-51 to the Omaha Municipal Code entitled Prevention of COVID-19 to require individuals to wear facial coverings. A through C are documents and communications relating to a mask mandate. Item D is an amendment. Item E is a revised amendment. Item 7, a resolution to recommend and encourage every individual to wear a face covering over their mouth and nose.
As presenting the ordinance, the City Council introducers of the emergency ordinance have asked a few medical experts to join us today to present. Following their presentation, we will allow public hearing on this item because of the importance to the community. Ordinarily, the council does not have public hearings on emergency ordinances, but we've decided we will do that today. The first presenter is Dr. Mark Rupp of the University of Nebraska Medical Center. Welcome, Dr. Rupp.
Mr. President, members of the City Council, my name is Mark Rupp and I reside at 100th Avenue in the city of Omaha. I'm pleased to respond to your invitation to speak to you today. I'm a professor and chief of the Division of Infectious Diseases at the University of Nebraska Medical Center, and I appear before you as an expert in infectious diseases. I do not represent the University of Nebraska. I will start with my conclusion. I strongly support and most emphatically urge the City Council to institute a mask mandate for the city of Omaha. My rationale is based upon the strength of evidence indicating the effectiveness of masks and the serious nature of the COVID-19 pandemic. First, wearing a face mask protects the person wearing the mask. I'll be the first to note that masks are not completely protective, and their effectiveness depends upon the material from which the mask is constructed and how tightly the mask fits to the face. However, when properly worn, face masks are highly effective. Please turn your attention to the visual abstract from a recent publication from the CDC.
Doctor, you adjust the focus on top. Thank you.
Yep. This paper notes the experience in a salon in Missouri where two stylists worked while having symptomatic COVID-19. They exposed 139 clients. None of the clients became ill. Both of the stylists and all the clients wore a face mask. Next, please turn to the middle panel. Of this visual abstract from a recent meta-analysis published in The Lancet. This paper included information from 44 comparative studies involving over 25,000 patients. Face masks resulted in a nearly 85% reduction in the risk of transmission, from 17.4% to 3.1%. Second, wearing a face mask protects others. Figure 3 which summarizes a recently published study by scientists at Florida Atlantic University, shows that a simulated uncovered cough traveled approximately 8 feet from the source. The cough only traveled 2.5 inches from the face when a cloth face covering was in use. Furthermore, at medical centers all across the country, the acquisition of COVID-19 decreased in association with the institution of universal mask use. Supporting studies from Harvard and Duke are cited in the bibliography that accompanies this testimony. At Nebraska Medicine, we instituted a universal mask policy on March 28th and witnessed a marked decrease in COVID-19 transmission. It should be noted that masks have been mandated by the University of Nebraska on all of its campuses. Because a substantial proportion of COVID-19 transmission occurs from persons who are asymptomatic, it is critically important that all persons contribute to the common good and wear a mask. Recently, our neighbors in Kansas noted that in counties with a mask mandate, a rapid reduction in cases of COVID-19 was observed, as opposed to no change in counties where mask use was only a recommendation. Third, wearing a mask serves as a strong visual reminder that we are in the midst of a pandemic and that special precautions are indicated. Fourth, wearing a mask reminds us to avoid touching our face and thus potentially inoculating the virus to our eyes, nose, or mouth. Wearing a mask is such a small ask. It is a minor inconvenience compared to the catastrophic consequences of unrestrained COVID-19 transmission. Being required to wear a mask when in certain public situations is not a serious restriction to civil liberties. It is a small price to pay in making our community safer. Finally, I am dismayed that wearing a mask has somehow degenerated into a divisive issue that is causing anger and conflict at a time when we are in most need of compassion and unity of purpose. Wearing a mask should not be a political statement. It is a simple, effective public health intervention to prevent the spread of COVID-19. The coronavirus is completely apolitic and agnostic. It does not care if you live in a red state or a blue state. It does not pick its victims dependent upon gender, race, ethnicity, religious beliefs, or political persuasion. Wherever non-immune human beings gather in close proximity to one another, particularly if they are not wearing a mask, it will prey. In the strongest manner possible, I urge you to pass an emergency mask mandate for the city of Omaha. Thank you.
Thank you, Dr. Rupp. Our next speaker is Dr. Renuga Vivekanandan.
Thank you, council members, for having me speak today. Can you hear me? Thank you. I'm going to give you my perspective as an infectious disease physician and an epidemiologist.
We need your name and your address.
Yes, sorry. Renuga Vivekanandan, address 84th and Pacific Street.
Thank you.
I'm going to give you my perspective as an infectious disease physician, teacher, and a mom today. When the pandemic started in February, I was tasked with a team of members, how do we protect our healthcare system? I'm in a healthcare system where we have 14 hospitals. We had many healthcare workers and patients part of this hospital system. So, like Dr. Rupp just stated, we implemented universal masking policy. One of my biggest concerns was looking at the numbers coming from New York and other countries, the amount of healthcare workers that were getting infected and transmission that was happening in the healthcare setting. When we implemented universal masking in our healthcare setting, we have since then, for the past 5 to 6 months, have had a handful of cases of healthcare workers getting infected. And this is because we have universal masking in our healthcare facilities and indoor facilities. So for me, we have done an experiment right here in Omaha, Nebraska to show it works, wearing masks to prevent our respiratory droplets and helping others not get infected. Secondly, as a professor and a teacher at Creighton University, I am grateful to be able to teach our graduate students. Our university is opening soon, and over 8,000 students are going to be coming into our university setting. We're doing all we can to keep them protected by implementing universal masks and hand hygiene and physical distancing, because our goal is to keep university open and to teach our students. What I am afraid of is looking at the numbers currently, 11% positivity rate in Douglas County. If this keeps on continue to increase, I'm afraid we might end up where we were in April, where we have to go to online learning for our university students. And I think that will be very disappointing to our students. They're here to learn, be on the campus, learn with their peers. Thirdly, I want to talk to you about as a mom. I have 2 children, 4 years and 6 years old. My daughter yesterday was extremely upset because she's sad that she might not be able to see her peers. She's in a public school district. And I'm also concerned that the way our numbers are going, maybe in about 6 to 8 weeks, our numbers will be higher than where we are now, and we might have to go to online learning again. So what are the solutions? I want to kind of highlight a study that was done in Hong Kong. December to April, they mandated universal masking in public area, indoor area, and they were able to reduce public transmission to 120 per 1 million cases. At the same time, during these 4 months, other countries who did not have public mask mandate had over 2,000 cases per million. So definitely, there have been a large cohort of patients, people that the study was done. You could see the data. If you look in our backyard, Lincoln is doing a really great job with reducing their numbers. Kansas City, with their mask mandate, has been able to keep their numbers down. So I think this is emergent mandate is needed in Nebraska, in Omaha, in order for us to be able to contain our numbers. One other thing that I also want to highlight you is, as healthcare workers, we have been working at 150 to 200% of our capability since the pandemic started. Many healthcare workers are getting to the point of being burnt out. If we have another increase in cases and a second wave like we did in April or March, I'm really worried about where our healthcare workers and their capability to perform 100% will be. I'm worried they'll be burnt out. We might lose some healthcare workers in working in the healthcare setting. So how can we eliminate all this? I think by implementing a mask mandate where we could control the cases now. So in 6 to 8 weeks, our numbers will be low, and we could keep our schools open, universities open, and also our economy stable. And thank you for listening to me. And if you have any questions, please let me know.
Thank you.
Yeah.
Our next presenter is Dr. Gary Corby, Creighton University.
Council members, it's a pleasure to be here. I'm Gary Gorby. I'm an infectious disease doctor. I live at 1520 Harney Street, so I walked here for this afternoon's session. I've been an infectious disease doctor in Omaha since 1989, and so you've heard a lot of perspective from Dr. Rupp, Dr. Vibkanandan, and as the oldest infectious disease doctor here right now, I think I will try to provide some historical perspective. Historically, governments have been given the right and charge to protect the public good and the public health. And Nebraska is no different in that regard. We are told that we have to make reasonable efforts to control disease. And basically, a mask mandate is that reasonable effort. You've heard the data, you've heard the impact, and so why is it okay for us to have a mandate? In 1905, the US Supreme Court ruled on a case that was about vaccination. And Justice Harlan explained, individual liberty is not an absolute right in each person to be, in all circumstances, wholly free from restraint. Rather, every well-ordered society charged with the duty of conserving the safety of its members, the rights of the individual in respect of his liberty may at times, under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulation as the safety of the general public may demand. Now, that's not really old-fashioned because in Nebraska we actually have a TB Control Act legislation that when people do not cooperate with public health instructions, we've actually thought it's been important enough that we can use law enforcement to commit those people to treatment before they're allowed to expose other people in the public. Now, I'm not advocating something like that in the current circumstances, But it bears note that there are curative treatments for tuberculosis, yet we still feel the public health is that important. So I think mask mandate is really just a minor inconvenience compared to something like that. So we can be consistent in how we value the public health by enacting a mask ordinance today. And then just a personal anecdote. I've heard people talk about, you know, this is like seat belts or helmet laws. But if you don't do those things, you're mostly endangering yourself and you're not endangering others. Some of you might remember an infectious disease colleague of mine, Ed Horowitz, who was crossing the street on a Sunday afternoon, and a drunk driver ran a red light and killed him. Now, he shouldn't have been driving drunk, and he should have stopped because the red light was there to protect people from injury, but he didn't. He didn't intend to do that to my friend, just like people who are asymptomatic, which might be, say, 35% of the infected, don't intend to harm anybody else. But inadvertently, that can happen. And if it's, you know, your parent, your grandparent, your aunt, your uncle, your sibling, it really looks differently. So with that, I want to provide my wholehearted support to a mask ordinance. I think the city of Omaha will reap great benefits by doing that, by being able to get back to ordinary business sooner and to save a lot of lives. Thank you for your thoughts and attention.
Thank you. Our next presenter is Dr. Lindsay Northam.
Good afternoon. My name is Dr. Lindsay Northam. I live at 192nd and Maple. I'm an internal medicine physician with Methodist Physicians Clinic, and I'm the immediate past president of the Metro Omaha Medical Society. I strongly support this mask mandate. As an internist, my patient population is the most vulnerable adults that the medical community treats. I've dedicated my career to the health of the elderly, the immunocompromised, and patients with many high-risk medical conditions. This weekend, I admitted a diabetic patient with heart failure to the hospital for COVID-19. The first words from his wife upon hearing that news were, "I'll never see him again." She's probably right. This morning, I rounded on an 89-year-old woman who just spent the last month of her life fighting COVID-19 in the ICU. As I spoke with her, she told me about all the lost time she had with her family and all the additional time she's going to lose. She'll probably be in the skilled facility for another 2 to 3 months, and because the facility is currently on quarantine as workers have tested positive, she will again lose more time. At 89 years old, each of those lost days are precious. In the face of a lack of definitive treatments and vaccines, the use of masks as a protective barrier to help reduce the spread of COVID-19 is essential to protect these patients. The wearing of a mask is safe, it is simple, and it is kind. I wear my mask for you and for your family and for your loved ones, just as you wear your mask for me. I urge the City Council to do what is best for the face of and the name of public health to help minimize the spread of COVID-19. The wearing of a mask is a small price to pay for the safety of our community. I would offer if the Metro Omaha Medical Society members could give you any additional advice or be a resource as we all face this crisis together, please don't hesitate to reach out. I'll keep it simple and sweet. This isn't even a matter of just health and safety, it's a matter of public decency and being kind to each other. My brother and sister are teachers. I want them to go to work. I want them to be in the schools. I want students to be able to spend the next 6 months to a year learning like they normally should. But in order to do that, we have to stop the spread of this disease. I agree. We've discussed that students should be allowed to take their mask off a couple times during the day, just like they have recess. As a physician, I can sneak into my office and take my mask. My nurses can walk outside by themselves and take their mask off. So I would hope that we'd be able to find some sort of accommodation for the students. But the only way we're going to be able to keep them back in school is if we can keep them all safe, keep the teachers safe. I signed on for this. My colleagues signed on for this. We knew going into this career that we would be faced with horrible disease and disease prevention and disease spread. But my sister and brother didn't. They didn't sign on to be put into a room where they potentially could be risking their own lives with their own health conditions in order to keep them safe and to keep the children safe and to keep all of our family members safe. This is just the right thing to do. My mother-in-law lives in the same facility that this 89-year-old woman lives. And in just January, she was hospitalized. And we're all pretty aware that this is probably her last year. And for the past 4 months, none of her children have been able to see her because of this. And so we just ask that if we can stop the spread of this, that we'd be able to return to our normal lives and our families and be a part of normal society again. I appreciate your time. Thank you all.
Thank you. Our next presenter by written testimony is Dr. Maureen Tierney, and it will be received into the record. Our final presenter will be the Dr. Adipur.
Good afternoon, Council Member. My name is Adipur, Director of the Douglas County Health Department, address 1111 South 41st Street. Thank you for being here, and I feel really honored to be in the company of such great infectious disease doctors that we have the capacity in this community, and we all should be grateful for this. But what I would like to kind of share with you today, why do we need a mask mandate? We have widespread community transmission. Our 7-day rolling average for Douglas County is 116 cases per day in this community, 116 cases. Now, when you talk about and you listen to the media, you may often hear that they like to say to do it per capita, per million. And when we do it, that the 7-day rolling average for Douglas County is 203 cases per million per day. Let's put this in perspective. What does this really mean? The Global Center of Health Security at Nebraska Medicine, they reviewed 16 countries in the world before they opened school. And what they found is that every country had a transmission rate below 50 cases per million per day. We are at 203. The BRAMS model is also a model that comes out of Nebraska Medicine, also suggests a threshold, and there the threshold is 10 new cases per million per day. We have a long way to go with our 203 cases. Last week, we had 812 new cases. The week before, 944. So that is really a reduction, and we like to see that, but we have a far longer way to go. Let's just put it in the perspective. I looked at the General Electric has a dashboard. There's lots of information out there. Everybody looks at it slightly different again, and for me, it's interesting to look at that. But the dashboard was a wake-up call to me, and I thought maybe that this community is really not aware of what we see in regards to this disease. They look at different metro areas, and what they are looking at, how many cases have we seen in this community since the beginning of the pandemic? In Douglas County, since the beginning of the pandemic, it is 11,449 cases. Then they are looking at it per capita and comparing it to other metro areas. I just want to share with you some of the cities that have had less cases per capita than Douglas County. Seattle, Portland, San Francisco, Los Angeles, Dallas, Houston, Atlanta, Durham, Baltimore, Philadelphia, Boston, Cleveland, Detroit, Cincinnati, Chicago, and Denver. All those metro areas had less per capita cases than we had in Douglas County. That should be a wake-up call for all of us. We also talk about the positivity rate. And I want to share with you, last week the positivity rate was 9.9%. The week before it was 11%. So we are seeing a decrease. But let me put that in perspective. What do we actually expect? We hear from the experts and from WHO and CDC, actually the case counts, the positivity rate should be below 5%. we have not been below 5% since April 18. Many people can say, well, cases, it depends on what the testing is in your community and so on. That's why you may see more cases. But what nobody can argue against is hospitalization. As of yesterday, we have 118 total inpatients diagnosed with COVID in the Omaha hospitals area. That is reports from the hospitals. Put it in perspective, we had 68 patients in the hospital with COVID on July 9th, and we have seen a steady increase since then. So over the last 4 weeks, we have seen a 42% increase in hospitalization in our community. This community spread that what we are seeing now is really difficult to control. You remember April, May, we had really high counts, but they were related to big clusters in food processing plants. That is more easy to control because we know than it is around that cluster. What we are seeing today is we are seeing many small clusters, 2 to 3 people, construction companies, and so on. So it is much more difficult to actually control this. So I want to close really that we need to bring this under control. There are 3 W's that people often cite. Wash your hands, watch your distance, wear a mask. And I would add a 4th, win. We can win against this virus. We know that wearing face coverings, and you heard before the studies from the hairdressers, many other studies that are around, studies in laboratory that show very particular how particulates cannot go the distance if you wear a mask. But we also have now new case studies that show that counties that have implemented face coverings, universal face coverings, are showing a much faster decline in their cases. That's where we need to be. And we do not need to go too far. We see it in Lincoln. We see it that since implementation, there seems to be a decline in Lincoln too. As a community, I just would urge us all, let's come together, protect each other, protect this community, protect our students, and protect our local economy. When we all mask up, we all are safe. Thank you so much.
Thank you, Dr. Poor. That concludes the presentation on behalf of the introducers of this ordinance. We'll now move to the public hearing and open it at this time with proponents. We're using a sign-in system today, so if you wish to speak either as a proponent or opponent during the public hearing, you must sign in. There are sign-in sheets outside the doors that you entered the legislative chamber through. We'll begin with Debbie Smith. I'd like to thank our sign interpreters today, and we're currently having Jamie Elker. Thank you, Ms. Elker.
Good afternoon, Mr. President and council members. I may ask, can you hear me okay? With my type of hearing loss, I cannot, I don't know how to. Okay, I can do that. So with my type of hearing loss, I'm unable to project my voice to make sure I can see if everyone's understanding me. The downside is, unless you're giving me some kind of thing, is I cannot see your face expression to know, are you connected with me? Are you straining? So that puts me at a disadvantage with these types of masks. But anyway, my name is Debbie Smith. I'm at 6007 Seward Street. I am an audiologist, and I do a lot of work in early intervention with families who have children with hearing loss from birth to age 3. I also have a personal experience with hearing loss. Severe, profound hearing loss from the age of 2. I did have access to spoken language for the first 2 years of life. That did set my brain to be wired for the acquisition of the English language, which, for those who are born profound, that's not quite as possible to set that brain ready for English language input, but more of a visual language input. So identified at age 5 with profound hearing loss. I went 3 years with a hearing loss that no one knew I had. However, my speech was not improving. And so I heard language kind of muffled during that time frame. I was able to get a hearing aid at age 5. But in that time frame, in that young early years, I was already lip reading. And I watched how people talk. I watched their faces. I picked up information about the different consonants and the different vowels that make words and make sentences. I learned about how sentences are put together. Growing up, I watched my mother on the telephone. I learned how she diplomatically discussed issues with superintendents, principals, schools, because of my issue. I learned how to use my language to be able to communicate with people. So my point for being here today is to appeal to the council to include accessibility to communication access via visual means in any mask mandate that's approved today or even in the future. This accessibility is essential for all individuals who are deaf or hard of hearing. So this is something that should also be in place in businesses currently that have that mandated. We're no longer in a short-term mode. We're in a long-term mode now. As we've heard from all of the doctors who reported, we're working hard to try to get the COVID under control, but we're not looking at a short-term solution just yet. Meanwhile, we are individuals still going about our daily life the best way we can, keeping ourselves and others safe. So the important thing is understanding about communication. I think I just lost my place. But we know that the basic human need, and we communicate with language. Language can be visual, it can be spoken, it can be print. But for those with hearing loss, the visual is key. When you guys are talking, you pick up through your intonation, you know what the intent would be made. You know the earnestness, you know the passion, you know the drive. You maybe even know if they're doubtful or skeptical. You know that all by the vocal intonation. Those with hearing loss see it on the face. So the issue with that is, as I look out to you, the information on your face when you're talking really relatively will boil down to that's the life of the person that you are. So everywhere I go and I see masks everywhere, I see no life, I see no access. And I'm a human being. I love interacting with people. I love talking with them. I love being able to go shopping and just talk with the customer in the aisle. Well, what do you think about this product? Oh, I see you're buying a lot of this. Tell me about it. It's kind of a cool, interactive way. We should be that way. Now we go and there's no eye contact. People are moving in there. So it makes it hard for people with hearing loss to go in. Now that people stationed at the stores, at the entrance, you walk in and they say something. I'm sorry, I don't understand what you're saying. And then I tell them, I have a hearing loss. I stand back 6 feet. Can you lower your mask and tell me what you're saying? I get varied responses. I get no compliance. I get, okay, yeah. I get, they'll talk louder, or they start waving, or they start making up gestures for me that I don't understand because they haven't told me what that language means yet. So it's frustrating. I'm intelligent. I can do businesses on a daily basis.
Debbie?
But
we have a whole lot of people who wish to speak today on the public
Yes,
hearing,
I
and
will.
we
I'll get
normally
to my point.
allow 3 minutes per
I will.
speaker, and we've made an accommodation
5
for
minutes.
you. But we'd ask if you could wrap up pretty soon.
I will. But because this is not something you've thought about before, I want to make sure you understand what we're talking about. So, my life now is severely impacted by masks. I cannot go by myself to these places. I have to ask somebody to come with me. And going out now is a dehumanizing experience. And I hear, and I'm going to quote this one, people with typical hearing, masks are a minor inconvenience. It's been said already here. And also that quote was also said by Councilman Powell in the Omaha World Herald article over the weekend. You can go on with your life without disruption. You can have fully engaged in life, but we are not able to quite do that. So yes, masks and I are not friends, but I am asking, please, would you pass that mandate, that equal access for those who are deaf and hard of hearing? They can do clear masks. There's all kinds of clear masks. There's all kinds of face shields, all kinds of things that can be used in that setting. So that's my appeal to you today.
Thank you.
So thank you for your listening.
We'll continue the public hearing and remind presenters, either as proponents or opponents, the rules of the council require you to make your oral remarks within 3 minutes of time allotted. You may also add written remarks by handing them to the city clerk's representative seated to my right. We're using a light system. After you give your name and address, then your time begins. It's indicated by the green light. When you have 1 minute remaining, the yellow light will turn on. When the red light turns on, that signifies the end of your time, and we'd ask that you wrap up at that time so we can get everyone who wishes to speak, who's made the special effort to be here today to let us know how they feel about this ordinance, the opportunity to do so. We'd also remind people that during public hearing, there's no applause or verbal yelling or cheering and things like that. It's to maintain decorum in the chamber. Those things are not allowed. If you engage in those, you'll be ruled out of order and escorted from the chamber. Our next proponent is Andrea Skulkin, One World Community Health Center. Commissioner Jim Kavanaugh, you're on deck.
Good afternoon. Can you better now? Good afternoon, City Council. My name is Andrea Skulkin, and I am the CEO of One World Community Health Centers at 4920 South 30th Street in Omaha, Nebraska. I'm here today to beg for your affirmative vote to mandate masking in Omaha. One World cared for more than 50,000 residents from 70 zip codes last year in 13 locations throughout Omaha. Nearly 80% of our patients are racial or ethnic minorities, and 90% live at or below 200% of poverty, which for a family of 4 is about $52,000. And 51% of our patients lack health insurance. One World and our colleague health center, Charles Drew Health Center in North Omaha, are the safety net in Omaha, providing medical, dental, behavioral health, and affordable medications to everyone that walks through our doors in a respectful manner. However, over the last several months, I have seen far too many ambulances and far too many of our patients entering area hospitals, the sickest of the sick. We have been on the front lines of COVID and rapidly adjusted how we provide health care, protect the safety of our employees, staff, and thus the community. This response and rapid action came with the same compassion and our commitment to our mission to provide the highest quality health care that we can for our patients. It also came with the anguish knowing that our patients are disproportionately impacted by COVID. The crisis has magnified the racial and ethnic economic disparities that I call healthcare injustice. Whoa, I'm gonna have to go fast. Individuals that become ill are more often minority and low income and face more barriers to healthcare and education. And they are more likely to be deemed essential workers, less likely to be able to stay at home. At One World, we've seen the impact of COVID. From March to present day, we've tested thousands and experienced a 25 to 50% positive rate. Right now, our rate is at 36.6% positive, with additional positives coming to us from the additional testing site that we partner with Nebraska Medicine and Douglas County that numbers 753 positives. To us, it is more than a crisis. This is lives being lost. Our patients, as I said, don't have the luxury to stay home. They need to work to support their families, and it often takes multiple jobs and multiple people living in a household. And this is one way the disease spreads. I'll quickly wrap up, okay? Lack of masking and social distancing all over our community is an issue and spreads the disease. As employers, we face new standards, and our commitment to worker safety needs to be there, and masks are just a part of that. They are one of the most powerful weapons to slow and stop the spread of the virus, particularly when used within a community setting with good hand hygiene and distancing.
I'm sorry, your time's expired.
I'm just thanking you for your support today.
Thank you. Commissioner
Okay.
Jim Kavanaugh. And folks, if you could please honor the 3 minutes, we want to be fair to everybody, but we will not be going over again.
Thank you, Mr. Chairman, members of the City Council. I'm Jim Kavanaugh, 1819 Farnham Street. This is my son Seamus, and we are here to speak in favor of a mask policy for the City of Omaha. Since March, Douglas County has racked up 11,449 cases, including 138 fatalities due to the COVID pandemic. On July 27th, Douglas County Board of Health passed a resolution, and we endorse it, that says we urge an order for the Omaha, for the City of Omaha, and regulations for Douglas County outside the City of Omaha that requires individuals above 5 years of age to wear face coverings while indoors, unless the individuals maintain at least 6 feet in separation at all times from anyone who is not in their household. And we need to pass that now. Until there's a vaccine, there are only 3 ways that we can protect ourselves and each other from infection. Wash your hands a lot, keep your distance, and wear a mask. So we need the regulations to require masks now. I'm reminded of the mayor in Jaws who dithered about clearing the beaches despite the fact that sharks were eating people because it was tourist season. That's what's happening here. This has been going on since March. It's August. We need to act. Thank you for your leadership. And my son Seamus, who is a senior at North High School, would like to address you briefly.
Hello, like you said, I'm Seamus Kavanaugh, and OPS has just decided to go fully online for their first quarter of the school because of the spread of the COVID-19 pandemic. The only way we can ensure that the second semester doesn't follow the same, they don't have to cancel spring sports as well, is to slow the spread of the disease in the communities. And a mask mandate will help us do that. So we urge you to, on behalf of the students, we urge you to pass a mask mandate in the City of Omaha. Thank you.
Thank you. Our next proponent is Amy Carey, followed by Willie Barney.
I'm Amy Carey. I live at 2129 Ridgewood Avenue. I'm aware of the council members that openly support the mask ordinance, so I'm speaking to the rest of you, and more specifically to our governor and attorney general who put us in this position today. You all have the science and data, so I'm not going to talk about that. I'm here to remind you of the trust that's been placed in you to have the capacity to make the best choices. I'm also here to remind you of the words you used to campaign for your seats. I love Omaha. I care deeply for this community. Well, this mandate is about love and care for your city, so prove it. Geographically, we as Nebraskans sat in an advantage. As this virus has closed in on our city for the last 5 months, it offered you, our council members, city and state leaders, generous amounts of time to process the reality of what's coming, and offered you time that other cities didn't have to synthesize inarguable data and interventions against the wants and inclinations of human nature. We're all fatigued. We all wish things were different. We all want things to be the way they were. But that does not constitute pretending as if it were so. I often best speak in metaphor, so bear with me. But those who refuse to acknowledge the reality of this virus and willfully put others at risk remind me of a man whose girlfriend has broken up with him, and he just can't accept it. And he really wants things to go back to the way they were. So he continues to show up at her house like it's not totally embarrassing and inappropriate to pretend like things haven't changed. Well, the world has changed, and our community is at risk. And I'm embarrassed for anyone who stands at the door of a pre-COVID time waiting for our past to greet you and pretend like everything's normal. This thing will run its course. It's not likely to last forever, but we have an opportunity to minimize the amount of pain and unknown side effects and death in its wake. We all hear hopeful news about vaccine prospects as early as November and March. Who among you is fit to say that any one of your constituents doesn't deserve to be protected up until those timelines? Part of our citizens really want you to pass this. Part of our citizens don't. Regardless of either pool, the reality remains that you can protect the populations that need this and give our community more time before the vaccines are available. You each ask to represent your city. Don't you hold each and every death, no matter their age or previous health status, as an enormous weight? As we stand here, our elderly are cut off from their families for the last seasons of their life. Our immunocompromised and vulnerable live in precarious lives of seclusion. Meanwhile, everyday citizens look at each other with eyes of, you care, or you don't, or you're nuts. This mandate removes those barriers between us and places it on leadership, which is exactly where it should be. Though it would be prudent, we're not asking for a stay-at-home order. We're asking for the simplest and least expensive of reliable interventions. For a temporary amount of time, like a roadblock, a mask in public, until our numbers are down. I can't believe we're even debating this. I know you've all had your meetings before the meeting to make up your decision.
Expired. You may submit the remainder of your remarks in writing to the clerk. Willie Barney, followed by Patrick Rim.
People don't forget.
Good afternoon, Council. Willie Barney, 2401 Lake Street. I appreciate the opportunity that you have provided and the leadership you're providing to the city, to the county, and the state. I believe we're making this more difficult than it really needs to be. I, like everybody else, am tired of the restrictions. However, the reality is, if we have counted on UNMC as some of the leading professionals in a global perspective, and they're in support of this, CHI Health Systems, one of the largest health systems in the entire country, supports the use of masks. Our own director from health, who has done an amazing job over this time period, just came and told us that we've had a 42% increase. 42% increase. In the meantime, in Lincoln, Nebraska, in 3 weeks of having a mask mandate, has reduced their positivity rate to 5.9%. The federal government itself, if it followed its own rules, established that you should have at least 2 weeks of 5% or less positivity rate before you open schools and before you open the economy. We are sitting at 11% and most recently around 9% positivity rate. We are making this way more difficult than it really needs to be. In the last few weeks, we have worked with hundreds of organizations. We did an informal poll and I wanted to report on their behalf that 100% of those leaders that we polled are in support of your mask mandate, 100% of them. We need this, just like everyone else. We all want to get back to allowing our kids to go to school, play sports, and many other things. But unless we pull together as a city, can we pull together as a city, as a county, and a state for 4 to 6 weeks to get this thing under control so that we can move forward, so that our children can go out and do the things that they want to do at school with sports and other activities. The main piece, again, please show leadership today. This is an emergency. Let's get it under control. As a city, can we please come together at this time? This is not political. It does not have to be political. We can move this thing forward. We can move our city, our county, and our state forward, but you have to show the leadership at this time. Thank you so much for allowing us to come and testify.
Thank you. Patrick Wren, followed by Luis Jimenez.
Patrick Wren, 49th California Street in Dundee. I am for wearing a mask. Recovering Catholic. Had to go to confession often. I found that it was a very good cover for me when I was shopping around the different Catholic churches for a good confession. These priests get to know you after a while. On a more serious note, I am one of 11 children, had 7 beautiful sisters. A mother that was runner-up in the Miss Maryland contest. So I grew up with all these women, and I was wearing a mask when I was a little kid. They'd go out on these dates. Perfume would get heavy in the house, and I'm allergic to perfume, so I've been doing this for a long time, okay? I'm down to counseling twice a week over that issue with all the girls. Now, here's why I think we should wear a mask. I'm a financial planner. God bless me, I did well. I had a lot of bar and restaurants that were my clients. They've been hit hard by this COVID-19. You've decimated Dundee, where I live. You can throw a lot of blame around. The fact is that there's a lot of money that's been lost. Is that 4 minutes already?
Your green light's still on, Mr. Wren.
Okay. There's been a lot of suggestions to do the following. If people are wearing these masks when they go into a bar or restaurant, why not have a gun taking their temperature? It works, okay, and it will filter a lot of people that may not be healthy. I'm not saying it's the only solution. But I can't see a lot of people with this new law, and I'm trying to be serious for a moment, drinking a lot of beers with this thing, okay? Or eating food, and you're hurting the restaurant trade badly. That restaurant tax that goes into that pension fund for you folks, okay, has been hit hard. And your pension is way underfunded. I'll keep to the facts. You've lost your bond rating in this town, which means that when we go to surface our streets, okay, it's going to cost us one hell of a lot more money for the $200 million because of that restaurant tax. It was designed to fund that pension. Right now, it's going to run out in about 9 years. And the media won't cover that because they're afraid to go near it. Talk to Kagan.
Thank you. Your time has expired. Luis Jimenez, followed by Mark Kenny.
Luis Jimenez, 3306 Burt Street. I support the emergency ordinance. The one thing that Dr. Adipur has been telling us is that there's some non-pharmaceutical response to COVID, and that's social distancing, wearing a mask, so I trust her, and I trust that this is going to help wear a mask to reduce the contagion. I want to share the edits that I want to submit to the clerk on the emergency ordinance. These suggestions don't change the substance of the ordinance. So these are just the highlights. There's more that are in the document, where it says on page 2C, information from the World Health Organization, the CDC, Nebraska Department of Health and Human Services, the Douglas County Health Department, local public health departments throughout Nebraska, and members of the City of Omaha and Douglas County medical community indicates that citizens of the City of Omaha have been and will continue to be exposed due to community transmissions of COVID-19. I suggest striking out COVID-19 and putting pandemics. And then down on G, where it says, the director of the United States Centers of Disease Control and Prevention, CDC, the health director for the City of Omaha, doctors and infectious disease experts from the University of Nebraska Medical Center and Nebraska Medicine, as well as the Metro Omaha Medical Society, have concluded that the wearing of face coverings by every individual while in public is one of the best methods to slow and stop the spread of COVID-19. I suggest you strike out COVID-19, and so it reads, to stop the spread of respiratorily transmitted pandemics. There's other suggestions that I'll submit to the clerk. My last point being that it's important that this ordinance gets passed so this doesn't happen again, where the governor intervenes with the attorney general. This emergency ordinance will be in the books for future use. Not very confident from what happened right now.
Thank you, Mr.
Okay, thank you.
Jimenez. Mark Kenny, followed by Matthew Lemar.
Hello, my name is Mark Kenny, 4805 South 90th Street. I am just so grateful to the Douglas County Health System. One of my relatives contracted the virus early on. Because of everything they did, she's probably alive. The thing about it is her lungs will always be affected because that's the nastiness of this disease. So I trust the doctor that's giving these things. I trust her implicitly. I've got other friends that are in assisted living. They can't leave. There's a lot of talk about freedom. All these people are on lockdown. They're basically in prison, in nursing homes, assisted living centers. They've been that way since March. I don't know if any of you have done 6 months in a county jail, but that's what they're doing right now. And that's not fair that we keep dragging this out. We shouldn't, this can keep this thing from dragging out so all these people aren't basically imprisoned in their own homes. That to me would be something we could do to alleviate, give somebody else the freedom they deserve. That's about all I got to say. Thanks.
Thank you. Matthew, followed by Gabrielle Rima.
My name is Matthew Lamar, 4827 Pierce Street here in Omaha. A mask mandate just makes sense. This is not, or rather should not, be a partisan issue. Omaha is the only city of the 100 largest cities in the country to not have a mask mandate. Both Republican and Democratic-controlled states and cities have acknowledged the simple fact that requiring masks saves lives. I thank the many doctors who spoke about the health benefits of a mask mandate, but as I am not a health expert or someone with extensive public health experience, I would like to speak briefly about the message our lack of action on the issue of masking sends to our city. As a recent high school graduate, I, with many of my peers, had to make a decision about where to continue our education in college. Now, Omaha and Nebraska have wonderful colleges and universities, and I appreciate and thank these institutions for their initiative in requiring masks for their students. However, I have found myself in recent weeks anxiously awaiting my departure for college out of state. When I leave for college in 1 week, I know that I will be moving to a city that values my health and the health of all of its citizens through a mask mandate. Today, Omaha can take that step and join all 99 other of the 100 largest cities in America in finally taking action to protect all citizens through this mask mandate. Thank you.
Thank you, and good luck to you in college. Ms. Rima, followed by Paul Cruz.
Good afternoon. My name is Gabrielle Rima. I reside at 2808 North 68th Street. I come here today without a political agenda because public health should not be a matter of politics or party. I am not a doctor or a scientist, so it's not my job to decide what's best for public health. But it's also not the job of politicians. Doctors, scientists, and health experts across the world are saying that wearing a mask is one of the best ways to slow the spread of this pandemic. Who are we to think we know any better than these doctors who have studied medicine for years? I support the mask mandate. Thank you.
Thank you. Paul Cruz, followed by Daniel Espeleta.
Good afternoon, members of this council. My name is Paul Cruz. I'm a student at the Creighton University and I'm part of Creighton Men's Soccer. First of all, I want to say I'm not a medical expert. In fact, I'm a business student at the business school. However, I live in the city since 3 years and I deeply care about this community. And I do feel obligated to share my experiences about COVID-19 and how it has affected me and my friends and my entire environment. I do appreciate seeing a lot of young faces here in this room today. And I know that the mutual consent of all of us is that we are invisible to this disease. But I'm here to tell all of you we're not. It was mid of June. It was 3 a.m. in the morning, and one of my best friends, in fact my roommate, was standing in my dorm frame. He was drowned in sweat. He was trying to catch his breath. I was all night with him that night because I was afraid that he would not wake up the next morning because he was not able to breathe. The next day, our team doctor called us and told us that he was scheduled for a COVID-19 test the next day. 2 days later, he got tested positive. He was a 22-year-old sports athlete, fit as you can be. We're not invisible to it. I talked to a lot of my peers, especially to the people who are against the mandate of masks. And I tell you, I do respect your opinion that you think that wearing masks.
Mr. Cruz, you're supposed to address us with your remarks.
Sorry. And I do know that you have maybe the consent that you feel that you get restricted of one of your fundamental rights, your individual freedom to decide on whether or not to wear masks and your personal health. However, I also want to remind you on one of the foundations what this country has made so incredible, awesome, and why people look up to it. And that is why that all the people in this country, in this nation, in this community has pulled at the same page when it has to overcome obstacles like this pandemic. Me, as Christian, or being Christian and having faith, not only myself, in my family and my community, I feel obligated to do everything that is in my power, not only to keep myself safe, my friends safe, but also my neighbors safe, to love my neighbors, to love my community, help them out in every single way we can. I'm not a health expert, but I know that at Creighton we have health experts who have dedicated their entire lives to the things they do and what they've studied. That's why I can only appeal. If there's one thing everyone in this room takes out of my 3 minutes today, let's stop being selfish. Let's start caring about for everyone in our community, for our neighbors, for the old man down the street, and pull together on one page and make this mandate happen. Thank you.
Thank you. Daniel, followed by Bryce Shirley.
Good afternoon, council members. My name is Daniel Espeleta. I come on behalf of Creighton University to you as part of the men's soccer program. One of the things that we pride ourselves in at Creighton University is that we form men and women for and with others. And this means taking care of our community. And I'm no health expert, but there are many people who have devoted their lives to studying this matter, and they say that the spread of this disease can be greatly lessened if we take some minor precautions. And I think this is not a matter of a political matter. I think it's a matter of social responsibility, and doing our part to protect others around us. I personally couldn't live with myself because we have a lot of coaching staff with families with young children and who are in contact with their older members of the family. And I personally could not live with myself if I was directly responsible for making themselves exposed to the disease and leading to a detriment in their health or those of their relatives. So I think this matter is not a choice to me. It's something that I think is part of our social contract as citizens that we need to attend to, and we need to attend to it immediately. Thank you.
Thank you. Bryce, followed by David Quimby.
Hello, members of the council. Bryce Shirley of Creighton University, 2500 California Plaza. I'm here representing Creighton Cross Country. I believe student athletes give a unique perspective because we reap some of the greatest inconveniences of wearing a mask. Believe me, a 10K clipping off 5-minute miles is not easy. However, we realize the effectiveness of the mask and how much it significantly reduces COVID-19, and we're willing to do whatever it takes to protect our city. I believe we need a mass paradigm shift about what the wearing of masks means. And with everything in life, I try to ask this one simple question: what would Jesus do? And I believe in this time he would tell us, do not be afraid and love thy neighbor. Now, may I just say that this is the quintessential time to show our brothers and sisters in Christ that we love one another by wearing these masks. We all ultimately want the same thing to resume normally. We want to watch Husker football. We want to watch Paul and Denny save and score goals. You guys don't want to watch cross country, and I don't blame you. But we all have the same goal, and the sooner we can mandate mask wearing, the sooner we can make that happen. Thank you.
Thank you. David, followed by Paul Faravari.
Council, thank you for having me. I'm David Quimby. I live in Papillion, actually. I thought I was supposed to be at the beginning, so I will change my comments for the time reasons. I am an infectious diseases doc working here in Omaha for 14 years. I'm not going to go into studies because people can find, if you search hard enough, a study for whatever they want. Honestly, it doesn't even really matter to me what other cities are doing or what other states are doing. We need to do what's actually right. Earlier on in the pandemic, other cities had a complete shutdown. Omaha and Nebraska did not. We weathered that, not badly, and perhaps with less economic damage than other parts of the country. However, there is evidence that things are getting worse. Masking will help decrease transmission. It is not a panacea cure-all. There will still be transmission, but there will be less, and so we can have a more normal life. People claim that it is a infringement on personal liberties. In, I believe, 2008, there was the Nebraska Indoor Clean Air Act, or Smoking Act, passed, which prohibited indoor smoking in businesses in Nebraska. This was to preserve the health of others who chose not to smoke. To me, this is not any different from that. It is a small curtail on your own personal behavior for the benefit of society as a whole. So I would strongly encourage you all to pass the mandate. Thank you.
Thank you, Doctor. Lisa Wheelock, followed by Hannah Weibel.
Good afternoon. I'm Dr. Lisa Wheelock. I reside at 19464 Walnut Circle. As a pediatric physician and active community member, I am speaking to encourage you to support the mask ordinance. While initially the efficacy of masks and minimizing the spread of COVID-19 was unclear, that ambiguity has resolved. Mask wearing reduces the spread of COVID-19 and is recommended by the medical community including the director of the Douglas County Health Department, Addie Poor, and our world-renowned infectious disease physicians at the University of Nebraska Medical Center. This is an unprecedented pandemic that requires individualized, unprecedented response. Mask wearing is not a political issue or an attempt to restrict citizens' rights and liberties. It is a temporary response to a global public health emergency which has not yet been successfully mitigated. While some believe mandating masks may be counterproductive and potentially a catalyst to resistance, I believe that overwhelmingly the citizens of Omaha are compassionate people who are willing to put aside their personal comforts to protect their children, grandchildren, teachers, relatives, friends, and those suffering from poor health and debilitation. As a daughter missing her ill parents who are confined to their home, a parent watching with concern as her only child starts a hybrid school year, a physician wanting to protect her patients, and a community member wanting to return to normalcy, I implore you to mandate masks in the city of Omaha. Thank you for the opportunity to speak and for your consideration of a mask mandate.
Thank you, Doctor. And we had a couple sheets of paper stick together. So actually, Paul Faravari, if you're still here, come on up. And then we'll get to Hannah Weibel. Sorry about that, Paul.
Thank you. My name is Paul Faravari. I live at 8605 Meadows Parkway. I'm a nurse aide with Madonna Rehabilitation Hospitals. My view is not theirs. But when the pandemic started, there was and my patients were asking me about what is coronavirus going to do with them. The best thing that I could tell them before I referred them to the doctors and let them know that that was a question on their mind was, right now, we don't know what we don't know. And something that fills me with dread right now is the upcoming flu season and how that's going to impact testing, how it can impact how people are recovering from coronavirus and what can spread. But going back to my experiences at Madonna Rehabilitation Hospital, personally, I've never seen my dad cry, ever. And when we get a new admission, a new patient at Madonna, the very first question that I ask them before they see all the doctors, dietitians, physical therapists is, so when was the last time you've been home? And it shocked me to hear that a lot of the times it could range about a couple weeks because of a fracture, or for more serious cases because of congestive heart failure, TBIs, anywhere from 6 months to 3 years I've heard, with really, really high medical expenses. And it's been rough because especially with keeping people from having to see their families for safety reasons to prevent the spread, I have seen a lot of people's mothers, fathers just break down in tears because of the condition and how it has impacted them, limited them. And when my doctors are meeting with them as they are getting stronger and stronger, they have a lot to manage, having been separated from society so long. Their medicines, the improvements they have to make at home, and their appointments coming forward. When they get home, I want them to stay home. Without an emergency mask mandate, I am afraid that unintentionally, accidentally, some of my patients that work so hard will end up back in the hospital system after months, maybe years of working hard. They mean a lot to me, and I want to see them succeed and have their hopes and dreams filled. That's all I have, and thank you all so much.
Thank you. Hannah Weibel, followed by Terry Jackson Muller.
Hello, my name is Hannah Weibel, and I live at 3022 Paddock Road here in Omaha. I am a constituent of Councilmember Paul's, and I am in support of a mask mandate in Omaha because of my son, Ezekiel. Ezekiel is a 10-year-old, and he has had illness-induced asthma since the time that he was a toddler. A basic virus that makes most of us feel a little sick usually ends up landing Ezekiel in his doctor's office. A common cold has often turned into prescribed steroids, breathing treatments, and long nights with difficulty breathing for Zeke. When COVID first came on the scene, I was immediately afraid for my son. If a common cold trips his asthma into overdrive, what would COVID do? Zeke goes to school in the West Side District, and for the past several months, we have religiously watched the COVID numbers in Omaha. If the numbers drastically went down to a level deemed safe by public health experts, we would feel comfortable sending Zeke back to school. Instead, to our horror, we have seen the exact opposite happen. Cases have increased and increased and increased, and unfortunately, Ezekiel will not be going back to school until the COVID cases decrease to the level that our public health experts have deemed is safe. And he desperately wants to go back. So I am asking all of you today to please vote for a mask mandate for this city. My little boy and so many other kiddos who have health complications are the ones who are the most at risk. We need Omaha to be as safe as possible, and I strongly believe that a mask mandate will help us to get there. We will not defeat COVID through an individualistic mindset. It will take all of us collectively join together to put an end to this. Thank you.
Thank you. Terry Jackson Muller, followed by Richard Webb. Remind everyone while we're waiting, if you wish to speak on this agenda item or the next, you must sign in outside the doors of the chamber.
Good afternoon. My name is Terry Jackson Miller, 8236 Clay Street. I am here as a proponent for the mask mandate. I am a member of Salem Baptist Church, and though our facility isn't open right now, our pastor and we worship via social media, but every week he consistently reminds us diligently to wear our mask and be mindful of social distancing. And if we do our part along with everyone else, perhaps soon we will be able to go back into our churches. I am also a professor at the University of Nebraska at Omaha, and school will be starting on the 24th. And though UNO has made its mandate in reference to wearing your mask, all students don't want to take classes online. So there will be classes on the campus. And I feel that your leadership will help only enhance the university's mandate for that. And finally, I am a mother and a grandmother. And last week, my son and granddaughter had to be tested for the virus. Not because they did anything wrong without a mask, but my son was in his office with his mask, and he coaches football. And one of his players came in to talk with him, and 2 days later received a call that the player had tested positive for the virus. So then my son and my granddaughter had to take the test, but thank God they were negative. Thank you.
Thank you. Our last speaker who signed in as a proponent is Mohammed Jamal.
Hello, Richard Webb, 9th and Avenue P in Carter Lake, Iowa. I am coming for you today thanking you for the opportunity to speak and be a proponent of the mask mandate. I think like Willie Barney said, it's very simple. You were one of our last resources to mandate this mask. Our leaders in our community have not moved this forward, and we've seen the repercussions from them not moving this mask mandate forward. When we think about all of the kids in our community who will not have the experience of being in school, I'm a father of 4. My freshman son will not have the opportunity to experience his freshman year coming in as a freshman, will not be able to play sports. One of the hardest decisions for myself was before it was mandated to not have fall sports, was to pull my son out of something he loved. And he still hates me to today because of that. But I have a duty as a father to make sure my son and my family stay safe. My wife is a 5-time breast cancer survivor, going through it the 6th time right now. So these circumstances in our community, whenever we're seeing a lot of individuals who are not wearing the mask because they're not mandated to wearing the mask, we're hurting our community. We're hurting our people. We care for each other. I don't wear a mask to protect myself. I wear a mask to protect the person across from me. And I think we need to move that forward. I think we do need to mandate this mask so that we can get back to life. So we can get back to the sports. So we can get back to spending time with our families. So we can get back to our regular economic impact that we want to have from football and all the other attractions in downtown. But I live, like I said, in Carter Lake, and I take 10th Street a lot. And this last weekend was heartbreaking. They had a basketball competition that was at the CHI Center. And when I came out and I rolled down 10th Street, it had to be 200 to 300 individuals outside, all together, gathered with no mask on. And yes, people said there was mask mandates right when you go inside. But the challenge is if you're 200-300 people and you're outside with no masks, all huddled up together, and then you go inside, you're touching things, that's continuously spreading it. So yes, the mask mandate is not the end all be all, but it is a step. As the doctors have said, any steps we can take to progress forward and get away from so much of a high positivity rate will be a benefit to our community. So like I would say, it's important. You're one of the last steps to be able to help us because other steps have failed. Take it serious. Let's pass this. Thank you.
Thank you, Mr. Webb. Mr. Mohammed?
Oh, thank you.
Good afternoon. My name is Mohammed. I'm talking on behalf of the East African Community Association of Nebraska.
And your address, please?
Yeah. Is 49 on Cumming Street. So I'm supporting for this mandatory for public because this will save more life and more people and will stop spreading the COVID-19. So on behalf of the people I'm talking about, they come as refugees still here. They are minority group. So this will be more beneficial for these people if they mandate it. The reason I'm saying is the reason we grow for environment, people eat together, hang each other. So when this pandemic came to Omaha, still our community, they don't believe it. They just come and hang out. They talking a lot. So because it's a culture where people raise 100 years, people greet each other. So I'm supporting this public mandatory for this will reduce money, people, and save life. Thanks so much for doing a great job, and I hope you will vote today for that. Thank you.
Thank you. Before we begin the opponents, there are several who have not properly filled out the form. If you wish to speak, you're going to need to complete the form. Courtney, Wiki, Heidi, Stephanie, I can't tell what this one is, and Alexandra. They just gave partial names, no addresses. So I will not be calling on these individuals unless the forms are filled out properly or you fill out new forms. Our first opponent is David Bagley.
I did fill out a form.
David Bagley. Ma'am, you're out of order. You're out of order, ma'am.
Clerk, could I have my easel there?
We have a couple individuals here. You ready, Mr. Bagley?
Yes, good afternoon. My name is David Bagley, 4611 South 96th Street. For the week ending May 2nd, 2020, Douglas County had a 24% positive test rate. We've heard that now it is down to 10%. So it's been reduced by half. So my question is, if this is such a crisis, why didn't the City Council President introduce the ordinance in April instead of August? I got before you the chart from Sweden, and what this chart illustrates is what is known as FAR's law. We didn't hear any of the doctors talk about that. It is an abrupt end to a virus outbreak. Efforts to manage virus outbreaks only delays the downslope. Sweden never had a total lockdown and didn't have any mask mandate. And I would suggest to you that if the United States would have not locked everything down and not had a mask mandate, this thing would be over. We've heard from a number of doctors today. Well, there's some doctors on the other side. There are two sides to this story. There are medical experts on both sides. Sweden's top epidemiologist is Anders Tegnell. He said on August 3rd in the Daily Wire, "We see no point in wearing masks." There's also a new study just out of Sweden, which shows that the refusal to lock down saved the economy without sacrificing lives. Sweden is on the way to herd immunity due to robust T-cell responses. I won't get into the T-cell business. On August 1st, 2020, in the Daily Mail, a spokesman by the name of Cohen Barons for the Netherlands National Institute of Public Health said, face masks in public places are not necessary based upon current evidence. There is no benefit, and there may even be a negative impact. There's another professor from the Holland. He said he's a professor of infectious diseases. We've had some infectious disease doctors here today. Masks should not be seen as a magic bullet. Dr. Jeffrey Duchin of Seattle says masks don't block virus particles. So how is this going to be enforced? Is the city council going to deputize every Karen in Omaha, or pull police officers from their regular duties and have them do this? In summary, the mask ordinance is just meaningless virtue signaling by some Democrats in an effort to scare the daylights out of the public and keep the climate of fear going into the November election. I heard Dr. Mark Rep said, yeah, the mask is a symbol. Yeah, it's a symbol of fear and confusion. The only thing we know for certain is that this panic is going to end on November 3rd. Total lockdowns don't work, masks don't work, virus gonna virus. That's my opinion on this matter. Thank you.
Thank you, Mr. Bagley. Good to see you again. Mr. Storr, Larry Storr, followed by Julie Anderson.
Larry Storr, 5015 Lafayette Avenue, 68132. I'm against this ordinance or resolution, whatever the hell it is. And I was last week, and I told you why. First of all, it's unconstitutional. We have a U.S. Constitution. It's unconstitutional in the state of Nebraska. That Constitution says you will make no special law. It doesn't give you the right, because you're mayor or councilman, to run down to Lincoln or have them come down here and consult with each other to pass an emergency resolution. A national emergency is maybe something different, but that's up to Congress. That's up to a president. It doesn't apply to you people. So second of all, under the Open Meetings Act, which I don't think you mentioned today, the rules have to be reasonable. Now, I would expect that once again, since you've let maybe 20-some proponents come before you allow any opponents, and obviously there are a few, come to the microphone, that's maybe an unreasonable rule. You've never wanted to talk about that. Now, move on. Omaha World on August 8th reported on the original resolution. I was here for the original resolution, and I don't remember. I couldn't find my copy, so please present it for the public. The original resolution did not spell out any amendments, but it implied that every one of us here, including any child 5 and older, had to be required to wear a mask and maintain
the council, Mr. Storr.
Had to do that. Now, if I'm wrong, I'm wrong. But I think I heard Jim Kavanaugh say that this morning. He held up one, and I think I heard him say that this afternoon. Now, unfortunately, I think he had to maybe come as a proponent instead of an opponent, because the proponents get to talk twice. That is, if you follow the rules. We've had this discussion before, too. You people have a chance to read all these.
Mr. Storr,
there is a presentation thing that says they get 10 minutes.
And if you
they get 10 minutes
to address
each.
Others, you will be declared out of order.
And then they get to come back. No, I'm not out of order.
Your time has expired.
There are two separate things here. This is a presentation. You also have a resolution. Thank you.
Julie Anderson. Julie Anderson.
Fear versus reason. Oh yeah, sorry. I'm Julie Anderson. I live on 16648 Cheyenne Road. Fear. 2 boys playing in a field. They look up to the top of the hill, see a van, watch 4 guys going into a house, and a few minutes later, 3 guys come out. They run as fast as they can to home, slam the door, so scared they tell their mother. The voice of reason. The mother says, "Do you think maybe one of the guys lives there?" I'm horrified watching people who riot, loot, burn down buildings, and city councils giving into them, cutting police departments, taking the rest of the citizens' rights away. I'm a citizen. I feel like we, the people, gave the government an inch, and slowly here in Omaha, our city council is ready to take a mile. When the country knew nothing about the virus, fear, shut down the schools, just a couple weeks to clean, no church, don't get any elective procedures, 15 days to slow the spread so that we don't overwhelm the hospitals. Done. You can go to Walmart, Hy-Vee, Target, Lowe's, and Home Depot. Wait 30 days and we'll reassess. You shut down basketball, baseball, proms, graduations, confirmations. We all went along with it in order to get our lives back. We can start to reopen. Don't go to church, though. Don't let your kids go to school or let them see their friends. Now you want healthy people to wear masks. Until when? Flu season? No. Then it will be prolonged just because it might be COVID. More fear. I'm done going along. It's time to let people decide for themselves what is best for them and their families. Nebraska has never been out of control. Not since closing, not since opening, not since riots. With or without masks, we would be in the same spot. Let's try to open schools. What? After restaurants, bars, swimming pools, grocery stores, Lowe's, and daycares have been open for months? I own 2 daycares, one in Omaha and one in La Vista. The schools have been open since day one, never shut down, not one day. No masks required, not one case. In the last 14 days, cases have been going down without the mandate. The Constitution was not written to restrain citizens. It was to restrain government. At some point, there has to be an end to this. This is a virus. The flu is a virus. Shingles are a virus. Half the things we take our children to the doctor for is a virus. We are 5 months in. One thing that has been consistent is that you're unlikely to be infected walking by someone. You have to be up and close for 10 to 15 minutes. I think people understand to stand back while speaking. We are supposed to be in phase 4. You have to let people get back to their lives. My friend had a heart transplant 16 years ago. She finally has her immune system strong and refuses to compromise it by wearing a mask. She said, if this is what is going to kill her, she is going to die by living life without fear. Yesterday, the news started reporting kids contracting the virus. Perfect timing, just in time for school. Now, in order for the schools to reopen, kids have to wear masks 4 to 8 hours a day. Athletes have to wear masks during practice and games, even though we all know that kids don't transmit the virus as much. You say it's to protect others just in case you have the virus. Tell me this, if masks work so well, why are people dying in hospitals alone? Why can't people visit their loved ones in nursing homes? Why are the elderly left to their own loneliness?
Ma'am, your
I am a
time has
mother.
expired.
I will be the voice of reason. We have time to flatten the fear.
Bob Anderson.
Sorry, I have to interrupt my wife. Not prudent. I have some PowerPoint slides. I'll actually copy these and hand them out if that's easier.
Thank you.
How's that? Good. Good afternoon. My name is Bob Anderson. I'm a veteran and a small business owner. I want to thank many of the people that spoke here earlier because they're a great straight man for what I came to talk about. My first point is looking at the numbers. As everybody knows, you can make numbers mean anything, right? But for whatever you're trying to figure out, you have to determine which data points you need to gather. Many times, like you heard earlier, you talk about positivity rates, you talk about tests administered, negatives, and everything else. Those are things used by the WHO and the CDC and all the really smart doctors. What I would submit to you is that if you really want to look at what the risk is to the community, and I think that's really what this is all about, is what is the risk to the city of Omaha and its residents, right? You really need to look at the hospital admission rate and look at the deaths. Pulling the numbers off the Douglas County site, you can see that of the deaths, all of which are tragic, there's only 137. Population being 478,000 in Omaha. That means the mortality rate is a fraction of 1%, 0.03 of 1%. If you look at the hospitalization rate, again, 718 That's from last weekend, so the numbers are up a couple. What it translates to a hospitalization rate of 0.15, again of 1%. If you look at the infections, same thing. Our infection across the whole population is less than 2%. And the discussion today is about having an emergency mandate of things that have affected us to the degree of less than 2%. I submit that doesn't really qualify as an emergency. Look at the bottom risk to the population is extremely low. If you look at the mortality, when we had the greatest amount of deaths, that was in May and June. And actually July is half of what June was. My second point is about the emergency ordinance determination. And looking at the different ordinances, there is already one. If you look at Chapter 12, Section 12-24, that already dictates that the health department head, she's the one that actually determines the course of action for epidemics, specifically talks about for epidemics. She has the responsibility. So this ordinance would be in direct conflict with that. She already has the authorities to take these actions. The second ordinance, if you look at Chapter 12, Section 12.26, interference will be prohibited. And if you read it, it says, no person shall molest, hinder, interfere with the health department director or their assistants in accomplishing their tasks. So putting this ordinance in place means you're now hindering and changing what Dr. Poor has already put in place. And lastly, when you look at the emergency ordinance, what the requirement is, you have to state for the record what the actual emergency is. I went through all the different submissions you had. I submitted a letter to the clerk that explains why all those are either opinion or they are not a justifiable reason for emergency. And conclusion, there is no emergency. Hospitalization and death rates are a small fraction of 1%. The infection rate is less than 2%. The emergency ordinance is in conflict with existing ordinances or is in violation of a different one. Evidence of emergency does not exist. The facts prove contrary to them. Again, I submitted in a letter to the clerk. Personal responsibility is the key to this resolution, not a mass mandate. Thank you for your time.
Richard first, followed by Barbara first, or you can both speak at the same time if you want, or you can go one after the other, whatever your choice is.
Thank you, council members, for having me here today. I am Barbara First, 5014 North 145th Street. And what I'd like to say today, I like the idea of mask resolution that the mayor put out, but I am against a mandate. I think we all have a right to decide for ourselves. And how are you going to enforce this mandate? Again, I think that the people that will be hurt most are young children. They'll be the ones that are mandated to do it. And I think they need to have more choices than online learning or going to school with a mask. Thank you.
Richard First, 5014 North 145th Street. Now you understand why we can't both speak at the same time. But Barb and I are both 75 years old, so I guess we're in a risky age, so on. But, you know, we were raised by people that were coming back from World War II, and we've been through lots of emergencies, true emergencies in this country, and seen how people respond to it. And it's kind of like, you know, it used to be the if you walk into the bank with a mask on, they'd be calling the cops. But now I guess if you go in without a mask, you're going to be calling the cops. And I don't understand how that's going to be, you know, effective. And you've had trouble, you know, keeping people from rioting and burning and tearing down and everything else with the police force you have. And now it seems like an extra added burden. And you know, the masks can actually increase the rates of infection too. And taking care of the masks and all the rules, I printed off all the rules about all the things that have to be done to keep a mask actually working. And you know, I try to be a compliant guy. I'm not trying to be troublesome. And we, you know, here we are spending, we have a lot of space between us. And
you have your 6 feet too.
And I respect that you're wearing your mask, but it really seems kind of silly. And I have a lot of respect for the young lady who was up here talking about the difficulties with her being hearing impaired and not being able to see faces. It makes a big difference. We're humans, and this is how we interact. And texting doesn't always work, and this mask thing is not a good thing. And I don't think we need a mandate. Real leadership would be an invitation to let's make America great again. It's not some kind of a put down or a challenge or anything else. It's like, come on, let's just get the truth out. If people know the truth, we'll do the right thing and we'll beat this thing. But putting out a mandate is kind of difficult to say that you're really leading. Then it's just making a rule because you can, and maybe it makes you feel important. But I also politically think a lot of this is like things roll downhill that are kind of smelly sometimes, and it's kind of landed at your desk because a lot of other people don't seem to want to act on it.
Thank you. Allie French.
Good afternoon. My name is Allie French at 4213 North 172nd Street. We've had many great points made, so I'm just going to go ahead and read what I have written here. The only authority under which this council has grounds to implement any mandate is during a threat of an epidemic, and we do not have sufficient proof of such a threat. Even if there was, you still do not hold unlimited powers to infringe upon inalienable rights, such as to breathe fresh air, speak freely, and participate in public. We are not under threat of epidemic. We are under a government trying to replicate the threat of an epidemic through mass testing that has already been deemed irrelevant by the CDC. There is no proof of threat of epidemic aside from this irrelevant data to justify the use of the legal grounds to implement a mask mandate. At this point in time, if this council were to vote an emergency mask mandate, you would be overstepping your limit of legal standing. The mandate is not feasibly enforced. There are no guidelines for proper wear or effective material, and certainly no one to enforce such a thing. This mandate is still not a law. Any individual that does not agree for medical reasons, religious beliefs, or should go against their creed is exempt from the requirements. These people are protected under the Omaha Charter Code, Section 13-84, Ordinance Number 39262, which requires the accommodation for individuals and protects them from discrimination in a place of public accommodation as defined under Code Section 13-83. No matter how others feel about this, we do not mandate healthy people or the general public over the fears of others. If there are people that are scared of the public, they must find alternative routes, not strip the rights of their neighbor. It is the government's job to protect our rights, not govern our health or everyday lives. I know you underestimate us. I know you think we are the weak minority, and you couldn't be more wrong. We are mothers, fathers, and true Americans. We are informed, we know our rights, and we will take this to the top. We will bring this before the Supreme Court, and you each will be subject to civil suit for squandering our rights as protected in the U.S. Constitution, Nebraska Constitution, and Omaha Charter. Our numbers grow every single day. Every day, the citizens of this city are growing more tired and less submissive to the agenda this council is pushing. If this threat were emergent, as you claim, people, including all of us, wouldn't need convincing. Why do you feel the need to convince perfectly healthy people that they're asymptomatic carriers if this pandemic is real? Real pandemics don't need fake infection numbers, fraudulent tests, fake death certificates, and 24-hour news propaganda. People aren't keeling over in their homes. People who choose not to wear a mask are not becoming sick or dying. Thank you.
Thank you. Tanya Cloyd. Is this Gracie? Okay. Yes, absolutely. Make sure you lower the microphone so we can, we need your names and addresses.
Are you okay? Can I grab a chair maybe she could stand on, or just, no?
Here we go. Gracie, come around to the side so we can see you. The chair might be a little dangerous.
She'll stand on this. Is that
Yeah,
okay?
she can come in front.
Oh, that's okay. Yeah?
All right.
You good?
Well,
All right. Can you say hi?
Hi, my name is Gracie Cloyd, and I am 6 years old. I am a daughter of the King who is not moved by the world, no matter how narrow the path may become. I am learning to live by convictions and principles. I am totally against bullying. I want you to know that every time I go shopping with my mom, she prays with me in the car before we enter the store. She asks God for courage and wisdom and protection over me, not from the virus, but from the people who might be mean to us or treat us different. For respectfully choosing to physically distance instead of wearing a mask. Stop this bullying, please. Thank you.
Red shirt on the aisle. Red shirt on the aisle. Go ahead.
Okay. Hi, my name is Tanya Cloyd. The address is Inglewood Drive. I'm a homeschool mom of 3 and a tutor at Regina Chaley Academy. I have a couple points I'd like to make on this page, but I do need to address Councilman Ben Gray for a moment. Sir, with all due respect, I watched a live stream of the Douglas County Board of Health meeting on July 27th, and I'm extremely disappointed in you. You acknowledged to the... Oh, I'm sorry. Please don't take my time. You acknowledge to the opponents of the mask mandate that you do believe in alternatives to addressing the immune system, that you know the vitamins mentioned have a huge benefit, and that you are even taking them yourself every day. But then you brought up Black Lives Matter, which, let me say, I do not support the organization, but I absolutely do value Black lives, which I'll get to in a second. But then you mentioned that since you make it a point to take these vitamins every day yourself, you also know how much they cost. You then said you have a number of people in your district that don't have the ability to purchase them and therefore even think about anything that relates to their immune system at all. You ended pretty sternly by saying, if things were level, then I could see your point to a certain extent, but it's not level. Therefore, you made a decision to vote in favor of the mask mandate. There is a saying, who is silent is seen to consent where he can and must speak. I am here today because I can and must speak for the greater good of my fellow Nebraskans in your district. For you to declare that you know vitamins work so much that you take them yourself daily, but then decide we'll just slap a mask over everyone's face in the city because your constituents in your district can't afford them is a total cop-out. Meaning, you're avoiding doing something that you ought to do. Not only are you an elected official, but you are appointed to the Douglas County Board of Health. I'm calling on you to use that platform to make a real difference now. You have a huge opportunity to help right now to actually make things level when it comes to the true health and wellness, but instead you're just using the masks to literally mask the problem that needs to be addressed. It's like people at the top are stacked against the whole community to keep them in a state of ignorance to all of this. It's time to expand our thinking instead of narrowing it by responding in fear. We want to empower people with knowledge and equip them with immune system support. We want to see them succeed and do well and not just be told to cover their face with this false sense of security and wait for the savior vaccine unicorn. Especially when 12 of those in the running right now are being made with aborted fetal DNA. Yes, wake up Christians, this is intrinsically evil. So instead of spending billions of dollars on a mass vaccination campaign that's months out and probably won't even work, we should instead be coming up with creative ideas and working to get funding towards things like vitamin pantries that people could use and have access to here and now to strengthen their immune system to better their chances of beating this thing that already has like a 99% survival rate. So even if you pass this ordinance, I will not comply. As Father Koenig of Rochester, New York said, to violate the conscience of a person by overriding their refusal of a procedure is violence against the body and the soul. It is the most basic harm. It contradicts underlying all legitimate public health. It abandons the duty to care for the person rather than to become their master.
Thank you. Your time has expired. Thomas
Can I use the
Kochka.
extra minute from my daughter, please?
No.
Would
your
anybody
time
be
has
able to give me their
expired.
time?
You can, there's no yielding of time. You may submit your written marks to the clerk. Thomas Kochka.
Thank you, council members, for being able to hear me. My name is Thomas Kochka. I live at 4214 North 92nd Avenue. Amy Melton represents my district. I am retired. I'm also a veteran, so I have fought for the rights of everyone here, both for those who are for a mask and for those who are against the mask. I myself am against the mask. From what I've heard so far, it seems like the impetus behind having a mask is to lower the number of cases. The lockdown didn't do that. Nobody has said that the mask will guarantee that we will not have any more new cases. It will lower it, as the lockdown did lower it, but it will not lower it down to the point where it's gone. The virus is here to stay. What wasn't highlighted during the discussions from the doctors and those for and even to against, except for one, was that herd immunity seems to be the one thing that does help combat the virus, that will end the virus. But for herd immunity to work, that means somebody has to get sick. Do I want to get sick? No. Do I want anybody here to get sick? No. But I don't want to live in fear of a virus that has a very, very small percentage chance of making me sicker than a dog, or maybe not making me sick at all. But I know that there are not vaccines, but there's medicine currently available that is helping people to overcome that. So the question becomes is, why do we need a mask? A lot of the large stores in town already require that. A lot of the corporations are requiring it. A lot of places of work are requiring it. The only thing a mask, to my way of thinking, is going to do is going to add an extra layer of concern and fear to me that somebody's going to report me, or somebody's going to say, hey, you're not wearing your mask properly, here's a $100 ticket, which amounts to court costs and stuff a lot bit more than that. And so if half the city is already under a quote-unquote semi-mandate to wear a mask, what more will this resolution do? Thank you.
Thank you. Matt Ship.
Name is Matt Ship, 12805 Jackson Street, Omaha, Nebraska, 68154. I want to thank you for providing a time of all of us bringing our opinions. I hope that you have listened intently, and although I'm not as good as some of the people that have been here, I do have a passion about it. And I would like you to understand that passion as best as possible. I'm not here to try and impugn. I'm not here to diminish the health of people. I want you to know that I'm compassionate towards those who are at high risk. And we do not dismiss that. And I understand that there have been professionals that have given their opinion. But I'd like to say, first of all, that there's this idea out there that by not wearing a mask, we're behaving out of love for our neighbor. And I believe that to be a lie. I believe that we want to live together and that each individual has a choice that they need to make to protect themselves. I'd like to see that choice protected. I think the protection of the rights of the individual is what prevents mob rule in a society. I think that the idea of suggesting that because we're not wearing a mask only adds to the hysteria that surrounds the issue. Here's what I want. I want people to feel like they have the freedom to live their life the best way they know how, without the interruption of someone else's opinion around them. That's what I want for everyone. And if I know that someone is susceptible to being sick, I'm going to stay away from them. But to require me to always know that is impossible. And that those who are at high risk, I ask and I beg you to protect yourself. We need to live our lives. We need to move on. There's always going to be a virus. There's always going to be a sickness. Thank you for your time.
Thank you. Ben Tappan? Tapper? Allison Dotzler, you're on deck.
Ben Tapper, 148th Center. My name is Dr. Tapper. I am in private practice in Omaha, Nebraska. I don't wear a mask. I see over 200 patients a week. I come in close proximity with every patient that I come across. Why haven't I contracted this so-called disease? Americans make up 5% of the world population, but yet we take in 65 to 70% of the world's pharmaceutical drugs. We are one of 2 countries that allows pharmaceutical advertisements on the television. But yet 80% of Americans are suffering with a chronic disease associated with poor lifestyle choices. 700,000 people will die of heart disease this year alone.
Doctor, please bring yourself in order.
600,000 people will die of cancer. 300,000 people will die of obesity this year. When is enough enough? If this is truly about health, then mandate healthy living, exercise, good food choices, chiropractic, outlaw tobacco and cigarettes, processed sugars. I believe it was Thomas Jefferson who stated, if people let the government decide what foods they eat and what medicines they take, their bodies will soon be in a sorry state as those souls who live under tyranny. You see, God made your body self-healing, self-regulating. If you give the body what it needs, it can be healthy. It is like the wilted plant that sits under the sun. An allopathic model to that is to shield the sun, to protect that plant against the sun, cut off its leaves, medicate or vaccinate that plant. But an epigenetic approach, a wellness approach, is to give that plant water, and it can be well. You see, your body is no different. We must eat well, move well, think well, and we can be well. In other words, your level of health is the genetic expression of your lifestyle choices. And I know full well that your body's ability to heal itself, to overcome disease and circumstances like corona, is far greater than anyone has ever permitted you to believe. Benjamin Rush, a signer of the Declaration of Independence, stated, unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others. That time is now. These masks have absolutely nothing to do with health, but everything to do with the complying with a false flag, tyrannical agenda. If we sacrifice our precious freedoms for temporary security, we will lose both. If you can't comprehend that statement, if you are blind to this agenda, then I am sorry. You have the eyesight of an eagle, but the vision of a clam.
Thank you. Allison? Yeah, you don't want to forget your phone. Last call for Allison Dotzler.
Hi, my name is Allison, and my address is 5320 North 25th Street, and I don't believe that it's the government's job to take care of my health. According to what the Bible says, the government's job is to establish justice and punish the evildoer. and to protect the fundamental God-given rights and liberties of the people. Loving your neighbor requires us to base our actions off of reality. Adding fear that isn't rooted in truth is the most unloving thing I could do. If my child comes to me at night and says a monster is under his bed, I comfort him by saying there is no monster, not by falsely affirming his fears and saying that there is one. There is risk in everything we do in life. Being safe is an illusion. It's the individual's responsibility to assess the risk and do what is best for themselves. Justice and truth always coincide with reality and facts, not emotions or pseudoscience. It became political, this whole mask issue became political when the government took up the endeavor to force people to wear one through legislation. I will not comply with this should it pass. I will stand firm on my convictions, as will, I believe, many of my fellow citizens.
Thank you. Gwendolyn Leitzen or Leitzen?
Hi guys, my name is Gwendolyn Leitzen. I live around 144th and Maple, and I'm here today to remind you of 3 things. Number 1, under the authority of the Home Charter, Section 2.13, you do not have the authority to do this emergency ordinance, okay? The COVID-19 epidemic is not an emergency situation. The City Council used invalid, irrelevant, and wrong sources to support this. The only remedy is transparent and valid data. It was January 31st, 2020, that the Secretary of Health and Human Services declared a public health emergency. You have had 6 months to prepare a properly researched ordinance. We do not need to use an emergency procedure today. The incubation period for COVID-19 is 2.2 to 11.5 days. So this is not an immediate effect under this ordinance, okay? It'll take at least 2 weeks. An immediate effect would be shutting the doors of an establishment so they had to stop selling stuff. Putting a mask mandate out is not an immediate effect. All of the research provided online to the public with the council's agenda failed to say that masks are proven to stop the rate of infection of SARS-CoV. Every single one of those studies, that was an actual study, was about testing a mask. Let me say that again. Every single one that was actually about testing mask use in the community said there is no direct evidence and more research is needed. The other 2 sources out of the 7 that you posted were meant to intimidate and confuse the public with erroneous information, which is, frankly, an insult to the voters and the citizens. The correct question before the council is, will masks, when used incorrectly, give better or worse protection from COVID-19 infection than doing nothing at all? Let me say that one more time. Will masks, when used incorrectly, give better or worse protection from COVID-19 infection than doing nothing at all? All of the research provided online to the public with the council's agenda said that masks only work with complete compliance and that the community is not capable of fully complying. You realize that to have a properly fitted medical device, all the men in Omaha will have to shave off their beards. Casual observations of mask use in the community shows that the majority of people touch their masks, they pull their masks off their noses, and they reuse dirty masks. And my exception to that casual observation is the lovely doctors over here. I have not seen any of them do this wrong. Listen, we want open data. You owe us the real statistics. We know that the count of cases is an invalid basis for this decision.
Thank
Not
you.
all.
Your time has expired.
Thank you.
Lauren Kuzi. Brenda Banks, you're next.
Hello, I'm Lauren Kuzi. I just moved back to Omaha, so.
You're at 1702 Nicholas, right?
Yeah. And I'm against this. I'm happy to see there's no fear here today. The mask wearers and non-mask wearers. I took a bioethics class at UNL. I got an A. It's one of the few classes I got an A in, but it taught us to evaluate situations using if this, then that theory. If you impose this mandate, then what happens? Will the benefits outweigh the detriments? To me, there's no proof about any benefit to masks. I just came from Lincoln, and it's not improving after 3 weeks. 35 LPS staff are infected and quarantined right now. The county health director said she wants to extend it. Has any cities reported 0 positive outcomes? No. Enough to reopen? No. Now the detriments. I haven't heard any benefits to a mask mandate. I haven't heard testimony from any family doctors or surgeons, just directors and rich businessmen. This really concerns me that you all haven't done research about the dangers of wearing masks too long or not properly. I have a mental condition that doesn't allow me to wear a mask. Lincoln turned me down dozens of times. I'd go in the store and they say, you can't shop here. I say, well, I can't wear a mask, and they kick me out there. And there's no attorneys that are gonna help me out with that. And I don't believe it's real. I don't believe COVID is real. Because no surgeons are speaking up saying you can't wear a mask longer than an hour. I bet a surgeon will tell you they won't wear a mask longer than an hour. Writing fines. Do the police want to chase people down? Writing tickets? I'll take it to trial. If I get a ticket, you want to pay all that amount? And then I'm going to sit it in jail. You want to pay it? I'm not going to pay $100. I'll sit it out in jail. I'll cost you $2,000. I can't afford it. There's going to be snitches out all over town, people not wearing masks. They're going to report to the cops. They'll be mad if you don't send the police over to get them. I've seen it. I just saw it all in Lincoln. It's scary. I came here and it felt good going to a restaurant. It felt so free after you live through a mask mandate. Scott Frost wants to play football. They line up O-line against D-line this far apart. They're not concerned about masks. COVID death rates are under 1%. Ebola is 50% death rate. This ain't about death.
Your time's expired. Thank you. Brenda Banks, followed by Crystal Ellis.
I'm Brenda. I'll not make comments today.
Thank you. Crystal Ellis. You're always welcome to submit written remarks too, ma'am, if you wish.
Hi, Crystal Ellis, 159th and Pacific. I didn't prepare for this at all, but I just been jotting down notes, and so I'll just quickly go over like bullet points instead of all these crazy metaphors that I keep hearing. When we started, Paul's talked about all the corporations that are participating in the mandated masks. So we already know, obviously, it's all about big corporations, big pharma, and let's not forget administrators. What is at the top of all of this is administrators in hospitals, in universities, and every single organization that this top-down model is stressing. And I hear it parroted everywhere I go. Parroted, parroted, parroted. No real data. We submitted over 50 peer-reviewed studies that say that masks actually can be worse. The droplets, the big droplets, are getting stuck in your cloth masks, and then they break apart and they spew out even further into smaller droplets, an actual aerosol, so they stay in the air longer. Therefore, sterile environments inside of a hospital. We are not in a sterile environment right now. At the grocery store, we're not in a sterile environment either. I'm a caregiver to immune-compromised family members. Strokes, diabetes, heart disease.
idiopathic immune disorders like Evans syndrome because they misdiagnosed my son 3 times at all these great hospitals, right, that we have here. Misdiagnosed from children's to med center to wherever. So they slapped him with the idiopathic Evans syndrome. And you know what? He's been doing fine now after we stopped the blood transfusions and all of the kind of testing medicines that were new. You wouldn't believe what some of these medicines and things are made out of. I don't understand why you want everybody to wear a mask. Listen to this woman's story. We have to see her faces. Ben, you used to be my favorite on this whole council 10 years ago. I don't know what's happened to all of you, but this is just not the way we prevent a virus. Do any of you know how many viruses are in your body? Doctors, do you know how many viruses you have?
Address your remarks to the council.
Dr. Poor back there, do you? Do any of you know how many viruses you have? 380 trillion with a T. We have 380 trillion viruses inside us right now. We can't live without them. How do we not know that COVID already existed? We do actually know we've had 4 strains of COVID inside of us.
Your time has expired.
So what makes this one any different?
Your
I think
time
we're
has
asking the
expired,
wrong
ma'am.
questions.
Kathleen Kauth.
My name is Kathleen Kauth, and I am at 178th and Y. I'm a mediator and a conflict coach. I work with people to resolve problems, and what I see a mandate, a forced issue doing, is causing significant conflict among people, among individuals, at the stores, at their churches, out on the street. What a mandate will do is give people the presumed right to confront others. I choose not to wear a mask, mostly because every time I have, I've started to black out. I don't feel it's safe for me to walk around a store thinking that I'm going to fall down. I've explained things to Walmart and Costco where I shop. They've been very good about it, but it's very, very embarrassing to say, hey, I have something medical, I don't think I can wear a mask. While they've been good about it, I have lots of people who look at me in the stores, and I get the looks and the whispers, and I'm waiting for someone to approach me and start a conflict. Now, I have no problem having discussions with people. I'm pretty open and I'm good at talking, but there will come a time when someone is going to get agitated. Not everybody is going to handle these conflicts the same way. What we're doing is giving people the right to attack other people and encouraging vigilantism. And I'd like to ask, how exactly will this be mandated? Will the police force be called every time someone is not wearing a mask? The other thing is, if someone has one of the exemptions, whether it's medical, whether it's religious, how will you identify that person? What sort of protocols are you putting in place so that that person is not harassed? Are you going to make them wear a badge? Are you going to give them an ID? Is there something that they need to download or get approval from their doctors? How is that being thought through? I've seen a lot of very laser-like focus on this whole COVID issue on just the virus. I have not seen a lot of focus on the effects of what we are doing in response to this virus. Whether it's the social isolation that we've called and all the trauma from that, whether it's delayed health care, or whether now it's we're forcing people into situations where they may experience conflict. I thank you for letting me speak.
Thank you. Paula Williams, followed by Daniel Patterson.
Well, these are way nicer than my school days. Hello, my name is Paula Williams and I live on 12th Street.
According to the CDC, as of yesterday, August 10th, the coronavirus has a survival rate of 97%. That's with 5,023,649 cases, 161,842 deaths. This statistic is already overinflated because, according to the CDC's own statements, these deaths are attributed to coronavirus whether there has been a laboratory test or not. It can be attributed to coronavirus merely by meeting some clinical symptomatic criteria, such as fever, chills, cough, or difficulty breathing. Because of this farcical pandemic, because what other 3% death rate has triggered any of the restrictions, limitations, civil liberty infringements, and state surveillance and control tactics, we now have seen the wealth of billionaires soar. We see the poor already marginalized living in substandard housing because we don't deem them worthy for resources such as code inspectors, further marginalized within this categorical abuse of power in the face of a 97% life rate. According to the City Council's medical and scientific literature evaluating the effectiveness of face masks in preventing the spread of COVID-19, the article in there from Health Affairs stated, quote, "There appears to be a strong case for the effectiveness of widespread use of face masks in reducing the spread of COVID-19. However, there is no direct evidence thus far on the magnitude of such effects, especially at the population level." Back on February 2019, the U.S. Surgeon General Dr. Adams tweeted, "Seriously, people, stop buying masks. They are not effective in preventing general public from catching #coronavirus, but if healthcare providers can't get them to care for our sick patients, it puts them and our communities at risk." Dr. Adams was stating that masking healthy individuals does nothing. This is true. Implementing a mask mandate would further harm healthy individuals and further harm those already in the depths of crisis. Families have lost their jobs, their income, their means of surviving. The stress and toll this is taking will not show itself right away, for we are incredibly resilient creatures. But chronic stress does create dis-ease. If we are looking out for the people of Omaha to truly keep them healthy and well, it is to understand that a virus with a self-reported 97% success rate is nothing to be frightened of and need not hinder our ability to live freely and well. Those that have died are a loss. No longer having the ones we love dearly near us is painful. But are we going to shut out the world forever and for everyone when we begin to live out our corporeal existence? The surest way to die is to be born, a cycle we are all a part of. Are we going to stop living because there is a 97% chance of rate that we could live?
Your time's expired. Thank you.
Thank you.
Daniel Patterson. Robert Ireland, you're next.
Hello, my name is Daniel Patterson. I live at 206 South 19th Street. I am opposed to the mask mandate. I have a hard time seeing the difference between the mandate and the status quo that we have currently with the recommendation of face masks, what it's going to do for the public. I think it's an undue burden on police officers that are already dealing with spikes in violent crime, as other cities across the country are also dealing with at this time. We say the data and the science and the public health experts point to the effectiveness of masks, but I would also like to point out that they can point in the ineffectiveness of masks as well. The data, the example was brought up that Kansas counties that have implemented a mask mandate have seen a decrease in cases versus those that have not enforced that mask mandate. However, the Sentinel, a newspaper publication in Kansas City, Missouri, found that the chart used to promote this was found to be erroneous. The cases for mandate counties were based on an access that had a range of 15 to 25, while without masks were based on a secondary access on the right with a scale of 4 to 14. When compared on the same axis, there appears to be little difference in between those counties that had masks and those that did not. UNMC sent an email about the importance of wearing masks, but admitted in their email that certain materials are not as effective as other materials. None of them 100% capable of stopping the coronavirus, and others varying in their ability to slow it. The science, we're being given masks where the boxes say this doesn't protect against viral or bacterial infections, and thus seems to be ineffective. And I have found other research from the Journal of Physics of Fluids that also reiterate the fact that certain materials are ineffective at slowing coronavirus. It depends on what the material is made out of. And the public health experts, we have some that advocate for the mask, but we also have some public health experts that came together in Washington, D.C., saying that hydroxychloroquine was an effective way to fight the coronavirus. I'm not a health expert, and I assume there should be some testing done there, but I believe that should be examined and that should be pursued. So, in conclusion, I think there is considerable doubt to the effectiveness of the masks in slowing the virus, and I believe the status quo is enough for what we're seeking to do. Thank you.
We still have a number of people who have not filled out the form correctly, so I'll read your names again to give you the opportunity to do so. Otherwise, you will not be called to speak. Samantha, Nicole, Lynn, A. Cowell, Denise, Arnold's okay. Reagan, Simons, and Andrea, Andrew. Okay, Mr. Ireland, welcome.
Thank you, Council. My name is Robert Ireland, and I live off 144th and Harrison area. Thank you for your time. Considering we're 2.5 hours into hearing both sides of this debate, I respect those who are for wearing a mask. I value their opinion, though I don't agree with it. And that is the benefit that we have here in our country, in our city. We can have a discussion, we can have the opportunity to hear both sides of it and come to a logical decision as to what should be done. There are lots of evidences for it. There are a lot of evidences for against it. There are doctors out there, for example, Dr. Russell Blaylock is a nationally recognized board-certified neurosurgeon, health practitioner, author, and lecturer. He gives out monthly reports as to where things are at. If you have not heard of him, and if our physicians and medical expertise have not heard, I would highly suggest looking into what Dr. Blaylock has to say about just wearing a mask in general, let alone the whole COVID-19 issue. As for me, my family, we have chosen not to wear a mask, more so from the standpoint, I believe it's an infringement on not just one, but multiple of our Bill of Rights, our freedoms. To be mandated to do something totally goes against everything that we as an American stand for and believe in. To be dictated and told that we have to do something outside of what is in the Constitution, that being paying taxes, and you can look at that. The mask is not something that is covered, that is not mandated that we have to do, and to come back and sit there and say that it is required, that we are told that we have to do something regardless of the individual's beliefs, stance, goes against everything that we as an Americans stand for and believe in, have fought for. My family, my wife's family, our children of our fathers who fought, who defended our rights and our Constitution, and to be forced to do something I really believe goes against all of that. I understand that there's science behind it. I understand there's evidence that would point to its effectiveness, that's fine. There's effectiveness for those that are ill. It's never been done for somebody that is a healthy person to require them to mandate a mask or to dictate to them what they can and cannot do. I believe goes against everything that stands in our Constitution, going from the First Amendment all the way and including the Ninth Amendment, which would encompass all of that together. I would highly encourage you guys to take that into consideration.
Thank you.
And thank you for your
has
time.
expired. Daniel Branscombe.
How are y'all today? My name is Daniel Branson. I live at 11416 Corby Plaza. I'm new to the area, but I'm not new to this country. Served it for 5.5 years. We have the right as free Americans to choose. Just like you, the doctors, we all have the right to choose. If you want to wear a mask, I'm cool with it. Fine with it, that's your choice. The thing is you're saying that we need to wear a mask because it's going to prevent the spread of COVID. Based on what? What mask? Are you certifying the masks? So if I get sick, do I get to come and sue you for getting sick? Because you certified this mask. You said that a mask would work. It would stop the spread of COVID. So if it doesn't stop it, so what do we do then? Who do we hold accountable? Do we come back hold you accountable? Are you going to hold yourselves accountable? This country's built on people leaving tyranny and coming here for freedom. This is not freedom. This is the government stepping over the American rights. A lot of men and women have died to preserve those, and I think that's not being stated here. I think that everybody needs to consider each person's own individual right to choose, first and foremost. But I also need people to understand that if you're going to mandate something like this, then you need to mandate a mask. A face covering, a little cloth that you buy from the dollar store, you cannot tell me that's going to stop the spread of COVID. Okay, I've seen girls at waitresses wearing rhinestone masks that you can see straight through. Okay, that's not going to stop anything. So what are you actually saying? Are you saying that we need to wear a mask that's a certain mask, or just a mask, just a face covering? Because then that opposes a whole nother problem. What about, my biggest concern in this country would be more about child trafficking. You start covering up all these children's faces, okay? You put a group of children, brown-headed kids, and they're easy to take. I mean, they're already easy to take as it is without masks. You can't even control that. You start putting masks on everybody, what do you do then? What about thieves, people that are breaking the law? You cover their face. You give them the ability to hide their face. How are you going to go and prosecute them for something if you can't even see what they did? What's the point of surveillance cameras anymore? But all those things need to be considered before you do this. It's not just about a mask, not just about we live around viruses all the time. Flu season comes. I don't see y'all mandating a mask for flu. Okay, I don't see a mandate for there was no mandate for the swine flu. But this one virus is so detrimental that you're going to mandate a mask for everybody? You're going to tell, when do you come into homes? Where does your reach stop? Are you going to come into my home and start telling me that I can't have a beer? You're going to come into my home and tell me I can't eat bad food? Diabetes is rising out of the...
Thank you. Your time has expired. Kelly Elliott. Nicole Lynn Williams, you're next.
Hello, thank you for having me here this afternoon. My name is Kelly Elliott. I excuse me, I live at 4428 North 78th Avenue. Do have some notes here. I would like to begin by saying that I am a proud Catholic mother of 12 children on earth, including 5 more, hopefully, in the beatific vision of God. This also gives me a perspective that maybe has not been covered yet today. And regardless of today's outcome, I'm personally calling on every member of the City Council, the County Health Board, Mayor Stothert, Dr. Poor, Chief Schmader, Sheriff Dunning, Governor Ricketts, and every community leader to unequivocally denounce all forms of aggression, violence, hateful rhetoric, and any other form of violence perpetrated upon those who exercise their right to refuse a mask. The disturbing lack of condemnation thus far has emboldened people to persecute, injure, and insult with impunity. I believe on July 9th, this council unanimously voted to make intimidation and hate speech a second prosecutable offense when combined with physical crime. That concerns me a great deal. I have given the last almost 30 years of my life to the care of individuals who are mentally handicapped or disabled. I have been advocating for those people in a healthcare setting. I have had to use PPE, and I'm concerned that most people do not understand completely how to use PPE effectively and will actually cause more of a spread than what they're actually containing. Have you ever had someone hold you down and cover your nose and mouth while they sexually assault you? This also concerns me deeply. According to the FBI, only 20 to 35% of people actually have the courage to report those crimes. I did not have that courage. The thought of putting a mask on for those people, if I go back to 2010 to 2018, the only years that I could find that information, there are over 7,159 people who did report that in Nebraska. Considering that might only be about a third of those people, what are the implications for them with this? It's terrifying. I'm concerned. I do appreciate that there have been some recent comments by Ms. Melton and I believe Mr. I'm not sure which one of you it was, but you made comments that there will be exemptions placed, and I am hoping that they are more inclusive than what we have seen so far. I'm concerned, will I have to carry papers to prove something? I would really feel like this council has more to consider when they're thinking about doing these things. Oh, I'm sorry.
Thank you. Your time has expired. Nicole Lynn Williams. And according to the rules of the council, any accommodation for hearing impaired or other disabilities under the ADA are to be made in advance of the meeting, so you'll be confined to 3 minutes.
I'm sorry, what did you say? I cannot understand you.
Your presentation is limited to 3 minutes, ma'am.
Okay. So just to let the record know, I feel that is a disadvantage because
Your name and address.
well, the sign language interpreter is not able to verbatim every word that is spoken, so that is a disadvantage, and that's a violation of the ADA. So my name is Nicole Williams of South Omaha and North Omaha, and just to let you know, sovereign means one who is above the rulership and control of another. So,
Ma'am, you're out of order.
I am not out of order.
You're out of order. You had said you're out of order.
She didn't give her name.
That doesn't mean anything. I still have the right to speak what I'm saying. So, you guys swore the oath to support and defend the if you're, excuse me, you do not have any right to touch me.
I am telling you,
I have
you
the
have to
right
leave
to
or you'll be
speak
arrested.
freely.
You'll be arrested.
I have the right to speak freely.
He's said you're
I am
out
not.
of order. Let's go.
do please do not touch me and do not touch my stuff.
You want to go to jail?
You know what? I have the right to speak on this because I'm a sovereign being, and no, I am not out of order. The only thing you can speak on is saying that I'm out of order. That does not mean that I am not. You cannot put me in jail for this. You cannot. I need to get my stuff.
Samantha Leo.
Please let me know who wants to say my speech because we're putting them all on notice right now. Every single one of you are on notice. You are violating our unalienable rights.
Thank you. You're always welcome to submit your written remarks.
7th Street. I speak for many of us when I say that we are not okay with losing our personal liberties.
And you're at 5025 South 107th?
Yes.
Thank you.
With losing our personal liberties because of lies and fear. The masks do not stop the spread of any virus, and especially the way that they're worn by most individuals. The higher positivity rates do not mean higher death rates. I don't think a lot of people understand that. The mandate, it sounds like a law, it feels like a law, but it's not a law. So I just want to cover a few of our rights as U.S. citizens. The Nebraska Statute 20-134 in summary states that you may not directly or indirectly refuse, withhold, deny accommodations, facilities, services, or segregate any person on the basis of race, creed, color, sex, religion, etc. So essentially, if you're refusing a person's services due to a person's personal held beliefs, it's a direct violation of the statute. Under the United States Code, Title 18, Section 241, titled Conspiracy Against Rights, if two or more persons conspire to If two or more persons conspire to oppress, threaten, or intimidate someone in their free exercise or enjoyment of any right or privilege secured to him by the U.S. Constitution or laws, they shall be fined up to $10,000 or imprisoned up to 10 years. So if death results from somebody wearing a mask because they're suffocating or something wrong, technically, under that law, I feel like you can be put away for life. Moving on, under the U.S. Code, Title 18, Section 242, deprivation of rights under color of law. For those that don't know, color of law is when those of legal authority operate in violation of the law. This code states that whoever, under color of any law, statute, regulation, willfully deprives a person of rights or privileges that are secured or protected by the U.S. Constitution or laws shall be fined not more than $1,000 or imprisoned not more than 1 year. If bodily injury results, shall be fined or imprisoned not more than 10 years. And if death results, can be imprisoned for life. So coming back to those making the decision, how confident are you in the mask decision, in the mask mandate? If it's safe, if it's truly effective, and for those who want to enforce it, how confident are you? I just want you to understand that we are the people, we are mad, we are informed, we do not comply with a mask mandate, and until to those willing to give away their rights until they wake up, we're willing to stand here and fight for their rights as well. Thank you.
Thank you. Angel Covell, or Covell, followed by Regan or Regan Simons.
Hello, I'm Angel Covell. I live on Potter Road.
Address, please.
1106 Potter Road.
And that's in Bellevue?
Yes.
Thank you.
We all want the same thing, to protect ourselves and others in this debate. Protecting our health, our liberties, and our livelihoods are at the top of our list. Wearing a mask should be a choice. With that being said, with studies being shown how ineffective and possibly even more of a contaminant they can be, we need to decide for ourselves whether we're able to wear one, whether we want to wear one. To be an asymptomatic carrier, you have to be infectious, which is capable of creating an infection in someone else. A positive COVID-19 test result can happen from viral debris from a past illness. It does not mean that you are currently infectious or any risk to the public. I would like to urge you all to look at the slippery slope of mandating masks and what it means in the future. How long will the mandate last? What will it lead to? This virus isn't going away. We need to be more focused on our immune systems, eating healthy, exercising, getting proper sleep. Thank you.
Thank you. Regan Simons, followed by Denise Arnold.
My name is Reagan Simons. I'm 180th and Harrison in Omaha. I'm in Rich's district.
172?
Yep.
72?
I'm here to stand in the gap for my kids and the citizens of Omaha against an ordinance that seeks to harm them. Let us pray. Come, Holy Spirit, fill this room. Walk with us who are attempting to protect our children. Shut the mouths of lions. Do what you are famous for. Many on the council know this is wrong. Give them the wisdom to know your will and the courage to see it through. Amen. I have good news. Okay, everybody, it's been intense. I have good news. This just in, the White House put the state of Nebraska into the red zone due to rising numbers of COVID, but Nebraska Governor Pete Ricketts says the White House is using bad data, counting the same positive multiple times. Nebraska's positivity rate reached 28% during the state's peak in April and May, but the 7-day average positivity rate has not surpassed 10% since the beginning of June and is currently 7.9%. I believe someone asked for a 5-point-something%. We're pretty close. As it stands now, this ordinance, based on bad data, seeks to criminalize those in the vulnerable population who cannot or should not wear a mask due to mental, physical, or religious reasons. People cannot even afford vitamins, as stated by Mr. Gray. They will now be hit with a fine if they fall into any of those categories. People are complying with the mandate. Walmart yesterday, I asked the people enforcing that. They said they're about 90% of people are actually wearing masks. I saw 50 people go in and out, all wearing masks. Dollar Tree, a lady did a survey, 97 out of 100 wearing masks. People are already complying. The Nebraska Constitution states that all persons are by nature free and independent and have certain inherent and inalienable rights. Among these are life, liberty, and the pursuit of happiness. What is liberty? The state of being free within a society from oppressive restrictions imposed by authority on one's way of life, behavior, or political views. You are attempting to deprive me of my rights under color of law and are also committing an act of domestic terrorism by attempting to intimidate or coerce me to muzzle my 5- and 7-year-old sons. Abraham Lincoln said, "No law can give me the right to do what is wrong." Whenever there is a risk, there should be a choice. Here are the risks. According to the World Health Organization, the wide use of masks by healthy people in the community setting is not supported by current evidence and carries certain uncertainties and critical risks. Dr. Poor is not a medical doctor. She's a PhD doctor. When asked about numerous studies that have shown masks reduce oxygen levels at the last meeting, she is blissfully unaware of the dangers and had never even considered those studies. I would advise, so she is not qualified to advise you on the matter. I would advise the council not to vote on this today. A yes vote would add your name to a tort lawsuit, which you would be personally sued by at least 30 to 50 of us who have already signed on and have legal counsel to do so. I know that Brinker and Amy have stated they have concerns and they are not for the mandate, but they feel pressured to sign on to something like this. I would urge you to look into what this could mean for you legally and personally.
Expired.
Thank you very much.
Thank you. Denise Arnold, followed by Lori Warner. Last call for Denise. Okay, Lori Warner.
Hi, my name is Lori Warner. I'm a hairdresser.
Your address?
2329 South 7th.
Thank you.
I'm really confused about all this. When we were off for 6 weeks, I watched this daily. Everything's up, down, changing. I'm trying to comply, but I get more upset the more this goes on. I also want to know, why are certain doctors being told they can't prescribe a drug that works? I don't get that. Governors have told people, I don't know if it comes from the pharmaceuticals or whomever it comes from, I don't get it. I have a lot of questions. I think people should look into it. I do not trust Dr. Fauci. His wife, look her up. All this stuff is all on the internet. And the main thing I want to say is I'm so furious because we're worried about COVID. Do you realize how many kids are trafficked? Does anybody know? 500,000 have been saved in 3 years. We got a real bad problem with that. I think it's a more relevant issue than a virus with a 99% cure rate. That's all I got to say.
Thank you. Rick Jones. Rick? Okay. Chelsea Wilhelm.
Good afternoon, Council. Thank you for this time. My name is Chelsea Wilhelm, and I live down in Millard at 168th and Q.
Is your address 16566 Jefferson?
Yes.
Thank you.
I wrote a letter to my councilman, but I would like to share it with all of you as well. As far as the mask mandate, obviously I am here against it. We are all individual citizens and should be free to choose to wear a mask or not. The science behind whether the masks work or not is not the question as much as whether the government has the authority to take a citizen's autonomy to make their own health decisions. As a diverse community, we have many people with many different backgrounds, and as some have alluded to today, we have victims of kidnapping, victims of rape, and those kind of situations. Those are not medical situations that they can hand you a doctor's note and say, I will be traumatized if I have to wear a face covering. It's re-victimization at its worst to expect them to do so to every single Walmart greeter or Costco worker, so that they have to justify whether or not they have on a face mask. Other considerations would be we have people with they're on the autism spectrum that have already trouble with interpersonal communications, and just being able to see somebody smile or frown is a huge indicator to them as to whether or not they understand what's happening in this discussion, and taking that tool away from them is unfair to those individuals that are just trying to cope and live in this already very easy to offend world. I guess my final plea to you would also be considering the human trafficking portion. Omaha sits right here on I-80, and it is a major network for, it has a major network that comes in and out for human trafficking. And when you make everyone faceless by wearing masks, it becomes a lot harder to say, police officer, I believe that the individual you're looking for was wearing the Spider-Man mask. That's not a valid way to identify somebody for who you think just took a child from a gas station. And as far as the mask mandate is concerned, we do see so many people that are trying to comply. Trust us as Omahans, trust us as adults. Please don't make us gag our children to send them to school. Please don't make us have them put on those unnecessary face coverings if they're otherwise healthy children, to make it harder for them to just go out in public and be around other kids and those kind of things. I appreciate everybody that has spoken today in their comments, and I appreciate this time. Thank you.
Thank you. Denise Arnold? Stephanie Dorothy?
Yes, my name is Stephanie Dorothy. I'm from Elkhorn on 20550 Flavin Street.
Thank you.
I think the first thing that I want to echo is if you guys pass this mandate, are we going to see like a bunch of biohazard containment trash cans all over the city? Because I worked in the medical field. I know you use a mask once, you put it in biocontainment bags, right? But I see them blowing all over the city everywhere. It's pretty sanitary, I'd say, or not. I also have not worn a mask since day one of recommending them. I do have a medical exemption. I don't like to tell people what it is, but today I will. I have PTSD. I was raped as a child. I was raped as an adult. When I was debating this on Facebook with friends, mind you, friends, and I explained to them my situation, that having something over my mouth causes trauma. You know what their response to me was? Figure it out and bleeping wear the mask. So bullying is real, okay? We're not making this stuff up. And it's traumatizing to constantly have to say, I have a medical condition, and getting sass and backtalk from people in the stores and scoffs and whatever. I try to get in and out of the stores as fast as I can because my anxiety and PTSD just flares up real quick. And I also want to bring up the fact that Boys Town has a hotline, a suicide hotline. They have seen a 300% increase on their suicide hotline. Now, I wonder what that's from. Oh, maybe because people are losing their jobs or being bullied like me, or maybe they've been sexually assaulted by somebody. A 300% increase, guys. Let that sink in just a little bit. And as far as the medical hospitals being overwhelmed. You know what? Go to a mental hospital. I've been there a couple times, and I've been turned away a couple times because they were at capacity. We're seeing all this stuff, and we're going to see suicides go above COVID deaths. Mark my word. Thank you.
Thank you. Courtney DeMarie, or Demarie? Courtney? Britt Alexandra, you're next.
Hello, my name is Courtney Demery, and I'm at 1408 Hyatt Street. And I would like...
Is that in Carter Lake?
Yes.
Thank you.
I would like to thank you for your time and hearing our voices, for we are the people. I have served our great nation for 8 years, which included a deployment to Iraq from 2006 to 2007. When 9/11 happened, I was a senior in high school. I was a senior in high school, and I still remember the pain and shock and disbelief of what we were going through at that time. So I knew that I wanted to protect our country from any threats that may arise and to assure we maintain our freedoms. I'm here today because you are trying to take certain freedoms away. The freedom to breathe fresh air, the freedom for our bodies to obtain the proper amount of oxygen we need to function, the freedom for one to walk comfortably in our own skin while out in public. While our Constitution protects us, or at least it's supposed to, from discrimination against color, religion, sex, handicap, familial status, or national origin of the victim covered under the Color of Law, Section 242 of Title 18. However, the opposite is happening. With these mandates, I have friends being harassed by customers and management due to their inability to wear a mask from having PTSD, which occurred from a sexual assault. I have witnessed individuals wishing others to get sick and die to a mother and her children because they were not wearing a mask. I am asthmatic and claustrophobic and told to just wear the dang mask. I'm a stay-at-home mom with 4 kids and a husband who works out of town. And due to these mandates and the mindset it's giving our citizens, I'm nervous to take my kids out in public, but not because of a virus, but because of I don't want them exposed to such hatred from so many people. We are not pushing for better nutrition. And why are we not pushing for better nutrition instead of a false sense of security from a homemade cloth mask? Washington University just released an article stating the importance of boosting our immune system in order to fight off COVID. I'm sad to say that I'm starting to not recognize this country I love so much, and I pray you hear our voices. Thank you.
Thank you. Heidi Kane. Oh, hi, Britt. Sorry about that.
You're okay. Okay, let me get this.
We need your name
Okay,
and address,
yes.
Britt.
I'm Britt Alexandra on 8717 Glenview Drive.
Thank you.
Okay, so raise your hand if you've ever felt discriminated
And
against.
Glenview, is that La Vista?
Yes.
Thanks.
Okay, raise your hand if you've been discriminated. Raise your hand if you've felt divided. Raise your hand if you've ever been bullied. Okay, raise your hand if you've ever felt fear due to somebody else. You know what's even more scary than this pandemic? It's being discriminated, being divided, and being bullied, and being fed fear. Now that's scary. But where is this fear coming from? It's coming from you. It's coming from the mainstream media, and it's coming from fake news. That's what's happening. Okay, joke time to calm it down. What do you get when you get a 5'2" girl and her 2 children walking into a store alone? Harassed. That was me. Then what do you get when a 6 foot, 250-pound man walks her out alone, verbally attacked? That was me. I then asked the man, if he only came to help me, to harass me. This is a true story in Omaha. So fear, you install it. There's false numbers being put out. Why? To install the fear that is coming. Vaccines. There is a 99.6, as someone had shared now, 97% survival rate. There should be a choice to mask and a choice not to mask. But here you are now trying to pass a mandate and then hand out fines for not wearing them. I personally cannot wear them because I have a health condition. Okay, I see shirts and signs that say, we are better together. We're in this together, but really, are we? To the gentleman back here that left because he has better things to do than listen. Yes, what would Jesus do? He tells us not to live in fear, right? So, and to this gentleman over here, talking about TB, according to the WHO, 1.5 million people died in 2018. Where was our mask mandate then?
Direct your remarks to the council.
Sorry. An estimated 10 million people fell ill. 5.7 were men, 3.2 were women, and 1 million were children. I'm just wondering where the mask talk was and where the shutdowns were. Maybe because it wasn't on the news. And when you think you have a vaccine ready to go, think again. I'm sure as you all know, 13.1 on every insert. It states, this vaccine has not been evaluated for carcinogenic or mutagenic potential or impairment or fertility. Let's talk about that. Listen, we all know it's not a health problem when you see all sorts of different masks being worn.
Thanks, Britt. Your time
It's about
expired.
compliance. And this is not my new normal.
Heidi Kane.
My name is Heidi Kane, and address 5907 Pacific Street in Omaha, Nebraska.
Thank you.
I am a biofeedback specialist accredited through the Board of Advanced Natural Health Sciences. I'm going to speak a moment on the science behind masks, but I do want to say I have personally been affected by COVID-19 as my husband has had it, and I'm also a sexual assault survivor, and wearing a mask does have a PTSD effect. So clearly, most people are being bombarded with mainstream media propaganda that seeks to convince that masks are necessary to prevent the spread of COVID-19. With that being said, it's entirely understandable that you would want to mandate masks because you believe that masks will save lives. While this outwardly seems like such an easy task and we should just comply in order to protect others and ourselves, it's not that simple. According to the World Health Organization's June 5th, 2020 guidance on face mask use, there is no direct evidence that universal masking of healthy people is an effective intervention against respiratory illnesses. A policy review paper published in the CDC's Journal of Emerging Infectious Diseases found that masks did not protect against influenza and other viruses in non-healthcare settings. This is also clearly stated on the surgical mask box as well. SARS-CoV-2 is a beta coronavirus which measures between 0.06 to 0.14 microns. This is about half the size of most viruses, which tend to measure between 0.02 microns to 0.3 microns. Virus-laden saliva or respiratory droplets expelled when talking or coughing measure between 5 and 10 microns, and it is these droplets that surgical masks and respirators can block. For example, the N95 mask can filter particles as small as 0.3 microns, so they may prevent a majority of respiratory droplets from escaping, but they cannot, however, block aerosol viruses that are in the air itself, as noted in the WHO's guidance memo. The risks of mask wearing include health effects associated with poor air quality, reduced oxygen intake, increased CO2 levels, increased heart rate, self-contamination caused by the manipulation of the mask by contaminated hands, facial lesions, irritant dermatitis or worsening acne, and a false sense of security that may reduce adherence to other preventative measures such as hand hygiene. In addition, reused masks can spread disease if not washed, not to mention the PTSD and mental effects that go along with this. In conclusion, most objections to mask wearing requirements are not to the masks themselves, but to the mandate, as well-documented consequences such as oxygen deprivation, which should give anybody pause when considering a legal requirement of wearing masks in public. It is entirely irresponsible and unethical for governments to mandate such a practice on anybody. Thank you.
Thank you. We had one proponent whose sign-in sheet was mixed in with the opponent. So Jen Bauer, are you still here and wish to speak? Thank you for your patience, and I apologize on behalf of the clerk's office for the mix-up on.
No, it was actually quite interesting to sit.
So name and address, please.
Jen Bauer, 5501 Leavenworth Street, 68106. I'm here today to support the proposed mask mandate. I am the president of Exarban Elmwood Park Neighborhood Association, but I can't speak on their behalf because I can't meet with them. It's one of the largest neighborhood associations in the city, and we can't meet because my residents are vulnerable and elderly. As Chris knows, the candidate forum in September is coming up, and I can't hold that for my neighbors and provide any useful information to them. I'm not comfortable being here today. I'm kind of like Councilman Pauls. I don't really want anybody to tell me what to do. But I also always wear shoes, shirt, and everything else when I go into a gas station. And I view this thing on my face as a health department mandate. The littlest thing that I can do to help my community. It's become as common as keys, wallet, glasses when I walk out of the house. And for those of you whose constituents have told them that they don't want the mandate, it's not affecting them, this virus isn't near me, I'd like to remind you that we are a city of great diversity. There's no invisible boundary keeping the virus out of certain areas. We should be looking at the big picture as one community headed towards the single-minded goal of dropping numbers, getting kids back into school, and fully reopening. I don't go anywhere because I don't have anywhere to go. There's no office for me anymore. There's nowhere to go. And so while it pains me to ask you this, I would ask you to vote in favor of this mandate for me, for my neighbors, for the doctors who clearly support this, and for the students who want to go home, because I refuse to accept this as my new normal. This is the current situation that we need to take care of. Thank you.
Thank you. The public hearing is closed. Councilmember Festerson, you're recognized.
Thank you, Mr. President. I do want to thank everyone that was here today and for staying with us for so long, for your testimony.
There were a number of people who were told a number of times that the forms had not been completed properly by refusing to provide your correct addresses. You were given opportunities to complete those. At this point, you can submit your remarks in writing.
My name was never brought up on that list.
This is not correct. There's no address in city. And if any more remarks, and you'll be deemed out of order, and you'll be escorted from the chamber. Councilmember Festerson.
Thank you, Mr. President. I do want to thank those who stayed with us all day today and testified both in favor and against this ordinance in the public hearing. As you might imagine, we've had heavy volume on this both today and previously, with phone calls and emails and certainly testimony here today. I did also want to recognize all the cute kids that are here today. They did a great job after 3 hours of being well-behaved and well-spoken and did a nice job, and we appreciate having them here today too. I want to thank our medical providers that are here today for all they're doing for our community during this time of pandemic. And lastly, I want to thank my co-sponsors of the agenda, of the ordinance, Councilmember Jerem and Councilmember Gray. So, as a co-sponsor, I'm obviously in favor of this ordinance. It is a simple and practical thing we can all be doing to get our kids back to school safely and to continue our economic recovery. We are literally the only major city in the country without one. In Lincoln, who I've been talking to over the last week, it has cut their positivity rate, and it is flattening their curve. and I appreciate their assistance in our thoughts here and how this ordinance has been shaped and drafted. It is a measured approach. It focuses on indoor spaces where social distancing is not possible and where wearing face coverings is most effective. And it does have a number of common sense exemptions for those under 5, those with medical conditions, those that are communicating with the hard of hearing, for those that are exercising, and in enclosed workspaces. I also believe it's a reasonable enforcement mechanism. What has been proposed is a $100 fine, which is consistent with designated health measures we've all been under for several months now. Most city ordinances actually fall back on a $500 fine and the potential for 6 months in jail, but we didn't want to have that. That's not the point here today. And in fact, there is an amendment that may alter that even to an even smaller amount, which I'd be willing to consider, because the most important thing that this does is that it creates an expectation and a common standard for us all to follow. For all the businesses that have contacted me about this, most have been in favor. In fact, a large majority have been in favor because that's what they want. They just want a common standard that we can all follow. What has been proposed is also a 60-day time frame, but there is discussion about a 30-day time frame that I'm open to. I frankly think urgency is more important than duration right now, with our schools all trying to reopen as we speak, the number of cases on their uprise. I personally don't think this is going to be over in 30 days, but I'm willing to consider that mechanism. And there is an ordinance, another ordinance on this agenda that mirrors what we're talking about here today that could extend that time frame through our regular process if necessary. So I've talked with Councilman Harding about an amendment that I think he will propose and may want to discuss here in a minute. And I'm willing to consider that because I think and hope we can have unanimous support here today. I think it is an important message that we all are in this together. And so I'll yield the floor here in a second to him and to others that have their lights on. The last thing I'll say for now is that there is a mechanism in here that requires, should this go into effect today, and if it does, it happens immediately, for an entity or a business to have a simple posting of the ordinance to notify folks that this has happened and of the details of the ordinance. The one requirement of them is to post something in their place of business that notifies that. We have prepared something in case this does get approved today that could be as simple as visiting the City of Omaha's website, do point and click and print and paste on their front door. That would get that accomplished for everyone to be in compliance as soon as possible. So I wanted to note that for the record too. Thank you, Mr. President.
Thank you, Councilmember Festerson. Councilmember Harding, you're recognized.
Thank you, Mr. President. I thought Councilmember Melton's light was on next.
She turned her light off,
Okay.
and
Oh.
yours was next in the queue.
Oh, thank you. All right, I am socially distanced, so I'm gonna take this off while I am speaking. I too want to thank all those that have taken the time to come down here and email and phone and text their thoughts about this issue. It's interesting. I think over the course of the weekend, I probably had some 2,500 or so emails alone on this issue. So I know it's an important issue to the community, and we listen to what you say. We take that into consideration, and we also continue to encourage or ask you to continue to encourage you to do so. And I apologize I haven't been able to respond to each and every one of those, but do want you to know that I do read all those. I do look at the emails and the texts and the phone calls, and I was able to respond to many, but not all, so I do apologize for that. I also want to thank those, as I researched this, to those people and organizations that were helpful in giving me information, including Dr. Lowe, Dr. Bales, and Dr. Linder in the medical fields, but also for those not in the medical fields, and just personal opinions of many. Those are all very important to me and have helped me kind of guide me through this procedure as well. So I know that the issue of masks and the potential effect to diminish the spread of COVID is really only part of this overreaching issue. Many people brought up some of the associated results or associated aspects of the virus, and that includes mental issues, delayed access to health care, kids getting back to school, people getting back to work, going to our places of worship, being able to hug our loved ones. These are all associated with what we're talking about today. So let me focus on schools for a minute and emphasize the importance of returning. I think without question, education and learning is taking a beating because of this. Our kids were out of school for the last 3 or 4 months of the last school year. They were out of school and out of activities during the summer, and now we're going back into the fall and what should be the reopening of school, and knowing that some have already made the decision to go to completely remote learning. Others have various levels of remote learning and not being at school every day. So in many cases, here again are the side effects of that. In many cases, we have kids who sometimes their only meals are coming at school, or sometimes, in some cases, they get clothing at school. But certainly the socialization aspect that they're missing out on, and the environment that when they're at school, the environment and that socialization and interaction is all an important part of learning, and we need to get back to that. The other one final thing about schools is nutrition. A lot of these kids, as I think I said earlier, but I'll say it again, is that this is the only place they might get a healthy meal. So we've got to get back to the opportunity of making sure our kids have the opportunity to live out their potential. So these are important pieces of lives and what we're focusing on for our city and the country's future. So here we are considering an emergency ordinance for the mandatory wearing of masks in certain situations. I'll publicly say, as I've been saying all along, that my preference, and I get beat up for this, but I'll say it again, my preference would be that we could accomplish this goal of wearing a mask without a mandate. And I do catch flack for that statement, but maybe it's just the optimistic me, the optimistic outlook that I have that puts me in that position. But I understand that's not a reality at this point either. When the emergency ordinance was introduced, there were 4 people who were proposing, or I think 3 people originally proposing the emergency ordinance, and I know there was a 4th that was in support of it, which makes that, as alluded to earlier, that there is another ordinance that would go through, if you will, the normal process for approval, which would mean the first reading is today, the second reading would be next Tuesday, the 18th, and then the final reading would be the 25th, and then the ordinance would become effective 15 days after the date that it was passed. So essentially, we have about a 36-day window from now that ordinance, which had 4 people that were supportive of it, and then a 5th mentioned last week that they were in support of it too, therefore making it veto-proof. So as much as I am against a mandatory mandate, as stated, I understand the reality of what we have here today. And so with the assistance of Councilmember Melton, working on amendments to address this issue and to make it something that was more realistic, maybe more nimble As I've said many times before, this is the clunkiest way to go about doing what is being attempted here. I'll be a little critical here at the risk of offending some. But if this was as important as it is, that being a mandatory mask, the opportunity was there a week ago last Friday to do so. The person in that authority had the ability to implement a face mask mandate. So since then, now we're on our 12th day, or we'll be entering our 12th day, that order could have been in place. And if it was so important then, at the decision of that office, then in my estimation, then it should have been put in place. Regardless of the threat of lawsuit, it should have been put in place. But here we sit 12 days later, and I believe someone else mentioned today that it kind of seems to have trickled down to us, which it has. And that's where I get back to the clunkiness of this ordinance. Because what we do by ordinance can only be undone by ordinance if it isn't directly stated in the ordinance what the sunset is. And in this case, it was stated to be October 12th. Far too long for me. And far too long for, again, I'll go back to, if that order had been in place, it would have been able to be amended. It would have been able to be responded to. It would have been more nimble to work with. But by asking it to be done by ordinance, we now have to do it in this clunky fashion. So I go back to the proposal and the number of people supportive of it, and where we got to, where Councilmember Melton and I got to a point where it was obviously inevitable that a face mandate was coming, whether that be 36 days from now or today. So taking advantage of the situation, we took it as an opportunity to say, how can we amend this so that it can be something that would limit the time from October 12th to a more reasonable period. And I believe when it was proposed as from the health director originally, that it would be for 3 or 4 weeks, that a 30-day time period seemed to be a pretty reasonable amount of time rather than 2 months. So that was one of the amendments that we worked on. The other one was, we found this ordinance to be very restrictive in the sense that it was, if you were in an environment, in a building that's generally open to the public, and really what we were concentrating on at the time was the schools and the kids, because as I started out with the kids and how important that was, is that if they were properly socially distanced within the school, that they could have their masks off. The original form of this ordinance didn't contemplate that, or didn't account for that, or make it available. So that was another one that we attempted to, or that we'll have here on the amendment that's being proposed. And additionally, that also related to business environments too. And as, again, has been stated, most retailers, most businesses already have something in place. But what we wanted to do was to make sure that it was clear what the opportunity was, that if you did provide, if you were socially distanced 6 feet, so if you were in an open office environment, for example, and you were 6 feet from your coworker, you were not required to wear a mask. So I hope this clarifies some of the maybe misconceptions that might be out there as to the, I will agree, it is onerous in my estimation, but what we're trying to do is make clear what the rules are and explain that maybe it's not as it seems on the surface. So again, if you're in that open office environment and you're socially distanced and you're working at your desk, you don't have to have the mask on. So then go back to the schools. We wanted to make sure that another part of this amendment is that if some of the schools who have done this, or some of the businesses, that if you have a barrier in less than 6 feet of distance, you can also be there without a mask. I'll use, I believe it's St. Wenceslaus has gone to the extreme of building plexiglass partitions that they can put on a table so that 4 kids can sit around a table and have conversations and see each other without a mask. So that's another thing that we have asked for in this amendment. The other is, as was alluded to, the reduction in the, because I should actually let Councilmember Melton speak on this one because it was hers and hers alone, but the fine is been diminished to $25 rather than $100. Again, this is in the amendment. So I go back to, this is not the ideal way to address the situation, but that's it. And I'm not here to avoid responsibility or take up the action. And it is in front of us, so that's exactly what I intend to do. It was what I was elected to do. And I also want to state too that for all those who have asked any of us, why hasn't this been done before? You have to remember too, and as I think someone else brought up, is that this is really the first opportunity, or the first opportunity we've had to consider this action. So I think by the amendment that is being proposed, we are trying to make it as nimble and as responsive as it can be, given the restrictions or the clunkiness of the ordinance. I want to bring up a final note before I yield, but it's interesting. I wrote this down earlier this morning too, and I wrote compliance and compassion. And I want to thank the brave testimony that people had when they came up and talked about their personal experiences of why they would be hard pressed to be able to wear a face mask. And I'm sorry for your stories, and I applaud you for being brave and getting up and telling those stories, because I know that was hard. And I want the people of Omaha to know too, is that if someone is not wearing a mask, I don't think you're not the one to determine whether or not they have to be wearing a mask. They have a reason that they're not wearing a mask. And I liken this to, if sometimes when you see someone pull into a handicapped parking stall and they've got the placard and they get out and they walk in to the store or the business, you don't go up and ask them what their disability is, do you? And you shouldn't do the same thing in this case. If someone's not wearing a mask, they have a legitimate reason that they're not wearing the mask. And I know we're all in this together, so I ask Omahans, assuming this is passed, be sensible, be respectful. If there's someone that doesn't have a mask on, don't bully them. They have a legitimate reason, whether that be medical, mental. That's not your position to decide. I might have some comments later, but at this point, I'll stop with my comments there.
Thank you, Councilmember Harding. Councilmember Melton, you're recognized.
Thank you.
There's a couple second delay, so I'm told.
Thank you, Councilman Harding. I know that we have spent a lot of time working on a number of these amendments. I want to appreciate your help in that. I appreciate the other council members. I know we caught President Jerem kind of off guard at the last minute at the end of the week last week, and you kind of dropped everything to have a conversation with us, and I do appreciate that. You know, there are times, like I said, you can't always get what you want. That's something that I've had to learn. I know I always say, you know, if you really want something, just fight real hard for it, and then you'll get it. Well, you know, there are times where it doesn't matter how much you fight, you've lost. And so then what do? You kind of look at what you got and say, well, how can I maybe make this better? That's sometimes the position that you're in. I don't do things and I don't make votes so that people can.
That's our sound system.
Yeah, that's.
This is the best technology that we could get, folks.
Yeah. A lot.
Okay.
Okay. So, anyway, I don't make votes so that I can get a whole bunch of kudos when I actually didn't accomplish anything. A no vote today wouldn't stop this from passing. Therefore, I do appreciate the other council members and Councilman Harding for working on how can we make this better. And the most important thing is to allow social distancing, to take your mask off when there's social distancing. It is so important to me with all of our children going back to school, and the Millard Public Schools have policies in place for our kids to be able to have mask breaks where they can socially distance. And I had somebody email me and say, well, if you just raised your children right, they wouldn't need a mask break because you just tell them it's for the greater good of society. Well, I must not have raised my 13-year-old right, because he really does need mask breaks and he does care about other people. You know, he hasn't worn a mask. In fact, he's been inside playing more video games than I would really like to allow, or have never allowed before, since March. We did get out. He did play baseball. He's played golf. We have gotten out, but the sports are over now. He needs to get back to school. Really needs to get back to school. So he's going to go to school. The school requires masks. I really want him to be able to have a break, because I don't know that he's going to learn very well if he has to wear that mask all the time and gets a 15-minute break for lunch, because, by the way, that's about what they get at lunchtime. They can go outside. That'd be great. He's in junior high. They don't really engage in recess anymore. I'm hoping that they may incorporate more of those for the kids in junior high getting outside, but they don't get to go down the slides anymore for 20 minutes in the morning and 20 minutes in the afternoon. So that really, really was that important to me. So for all of you here that I know I've emailed with many of you, I think I've answered over 400 emails, and I have a lot more, so I'm really sorry if I didn't get to your email. But I tried to answer each and every one, no matter which side you were on. But I'm telling you, I am not going to just vote no so that I can be patted on the back, and if somebody wants to file a tort suit, file the tort suit, because it means that much to me for my kids that they get a mask break, and they're not going to get it without an amendment to this ordinance. So we're all going to disagree on our freedoms and whether or not the government should be doing this or not doing this. I agree. I don't think it should be a mandate. I completely agree with Governor Ricketts. But what Governor Ricketts has said over and over is, people, wear your masks. People, the masks help. They keep your spit from going so far when you accidentally spit when you talk. I'm guilty of that. So the governor says, wear your mask, but I believe that the people in Nebraska are good, that they're good, responsible people, and they don't have to be mandated. They'll do it voluntarily. They'll do it voluntarily, not mandated, just voluntary. They'll put it on. Just put it on for a couple hours today. There are a number of people, though, that can't. And as a former domestic violence prosecutor for Douglas County, there are a number of victims won't be able to wear a mask. And you know what? We can overcome that. If you see somebody without a mask, assume they have a good reason, because all the people in Nebraska, I believe, are good people. But if you don't, put the mask on. We don't know. I'll be honest with you. There are doctors that say they work, and there are doctors that say they don't. I am a lawyer, so I really don't have any business making any medical suggestions. But I would also think that a little common sense would think that at least it would keep my particles, I don't know what best word to say over here, my particles from maybe infecting Brinker over there. So at least we're far enough apart, and I'm really sorry. I'm trying not to look towards you, but common sense would tell you that if I'm going to err on the side of judgment, I'll err on the side of the mask will probably help. So I voluntarily wear one, and I have been voluntarily wearing one. I don't want the government to mandate it because I'll voluntarily do it because it's the right thing to do. There's some exceptions we've made. The $100 fine also came with, and I can't remember if it's $48 or $49 in court costs. I haven't paid any kind of tickets lately, but it's somewhere around $48 or $49 in court costs. So with the $100 fine, you also have to pay court costs. If we amend this to a $25 fine, there won't be any court costs. I did have a lot of people email me who were for the mask mandate. Multiple people said they compared it to a seatbelt. So I didn't arbitrarily come up with the $25 seatbelt or with the $25 fine. I looked up what a seatbelt fine was. I actually had to look it up. I didn't know because I voluntarily actually wear my seatbelt. Doesn't need to be mandated either. But it was a $25 fine. So there's no jail. No one's going to jail for not wearing a mask. I really do wish that people would just wear the mask temporarily. We're asking for 30 days. This was going to October 12th. I decided that I didn't want it to go that long. If the masks work, then we should see a difference. And if we're gonna see a difference, I'd rather see it in the first 30 days than wait and do it in the second 30 days and have the schools delay opening even longer. When we started working on these amendments, one of the things that actually, one of the biggest things that got Brinker and I discussing it was we were told that OPS would not open without the mandate. We were rather shocked to see that they were going remote on Friday. So one of the things is I want to make sure that no other schools do that. I want to keep our kids going to school. I want to make sure they have mask breaks. $25 fine is really basically as small as we can go, and it shows up as an ordinance violation, not a misdemeanor. So this won't violate anybody's probation or diversion. So nobody will go to jail for not wearing a mask. But again, those are my reasons. And I do understand everybody here, right to my core, right to my principle. But I'm not going to let my principle and a meaningless no. I'm not going to have the kids suffer or churchgoers. You can go to church and be socially distanced. Go to church, be socially distanced. You don't have to wear a mask. Under the current ordinance, you do. So I get it. There's a lot of you not happy right now. But would you rather have my no vote and have a mask mandate where you got to wear it all the time? Or would you rather have these amendments? Because that's the position that I'm in. So with that, if I guess there are other people, but I won't make any motions, but I would move at some point to pass. I don't know what number we're at. D. It's 6D. Wait.
E.
E.
There's an E now.
Oh, it's E. So the E, and let me explain just for those of you, the other thing that was added to this, I'm not sure who to thank for this one. It might be our chief of staff. But I appreciated this addition, and both Brinker and I approved it. We're asking Dr. Poor, who has agreed, and we're asking her to come down. She's going to give weekly briefings while this is in place for the 4 weeks. It's just 4 weeks. And Dr. Poor is going to come down and give weekly briefings to this council, I assume at 2 o'clock on Tuesday. Doesn't say that here, but I'm hoping that would be the case so that it can be covered and the people from the public that are here can hear it. But that is an addition to our ordinance that we will get weekly briefings from Dr. Poor. So with that, I'm going to move 6E, which is the ordinance that include all of the amendments.
Have you concluded your remarks?
I have concluded. Thank you, Mr. President. I appreciate it.
Thank you, Councilmember Melton. Councilmember Pauls, you're recognized.
Thank you, Mr. President. I'll try to make this brief, to the point. I've had 2 lives. Before I was on the city council, I was in the state legislature, and before that I was a school principal. But what I'm going to tell you today, I don't know if you realize the amount of discussion that we have had today, this happens seldom, because most of the information comes from from the mayor to us. This originated on the city council. So it's been enjoyable because this does remind me of the days in the legislature where we work on issues and we add amendments and we make it work. That part. Now I'm going to talk about the part that I spent 30-some years as a school principal. I hope you picked up on that earlier. My goal is simply to help get the children back in the schools. I understand online learning, that's good, but it's not the same as when you have that child and that teacher face to face. And I believe all of the superintendents around here are really going to try to make that work. But this mandate may help them in their own schools. I am counting on the teachers and the administrators to be creative enough to make it work. This, I believe, will add to that, give them that ability to do it. I think you'd be amazed all the unique things that happen in the school. That's why you need that teacher touch. And I know some schools, they have to go by online because of the certain situations. But if we do not do something and we do not get this in a box, more schools are going to be going online for longer periods of time. So I truly believe that that's one of the reasons why I believe this needs to pass with the amendments. Thank you.
Thank you, Councilmember Pauls. Councilmember Vice President Palermo.
Thank you, Mr. President. And this is the way I'm going to vote today. See that pause? It's not that easy. It's not just a yes or no. And I'm not going to be as eloquent as my colleagues who did very well with what they had to say. I'm going to be a little more direct. And if I back up a couple weeks, we here at the city were handed a budget. And that budget was going to take some work because we were going to depend on some outside money to actually make that budget work. Because see, what we normally do here at the city is we do city work. Your police, your fire, make sure your roads are passable, mow your parks, maybe work on opening your libraries for next year, getting your swimming pools open. I could go on and on and on about what we do on a normal daily basis here on the city council. So when I say I'm going to be a little more direct, I'm going to ask you, why are we here? Why is the city council making this decision? Some people have got close to it, but they don't want to say. Douglas County deals with health in the county. There's also a board of health that we have somebody assigned to, and there's other members as well. And they took a vote a few weeks ago. It was unanimous on what they were going to advise to do moving forward. And with all due respect to the Douglas County Health Director, because I've never met a person that said anything negative to her, I was extremely disappointed by that choice. Because what happened was I had to put my budget book aside, and now I had to take on other people's duties that aren't ours on the city council, but they are now. Because you're right, it is a little clunky because this isn't our daily norm. This isn't what we normally do. But unfortunately, this is what we're doing now. And just to kind of go along with what we heard from both sides, I think it's important to get this out there. It was just a matter of 5 or 6 months ago when we were watching news stories of cruise ships that were docking and quarantining, or they were in quarantine. And then they were chartering planes and they were bringing them to Omaha. And everybody was so happy. Look at us, man, Omaha, we are the best. If you're going to be sick, this is where you're going to want to be. I think they were bunkered out at Ashland. Our hospitals, which are world-renowned, were taking care of them. And everybody was so impressed, and they couldn't pat these infectious disease experts, who we have here with us, on the back anymore. But then we come here today, and we're going to second-guess their opinion on what we should do as a community to open back up. It doesn't make sense to me. You can't have it both ways. You're going to have the doctors who you believe in all the time because of what we have here with UNMC and everybody else that's here. But there's one thing also on the council that's tough for us is we all represent a different district. We have different zip codes within our districts. And it kind of is an easy vote for me because the district I represent that has some of the highest zip codes of positive cases. Now, that could be the job. That's not the person, right? These are the jobs that hardworking people in District 4 work, and maybe the conditions aren't the best, but this is why the numbers are high. It has nothing to do with the person. You could take another person and another zip code and put them in here, and the numbers would be just as high. So for me, in the area I represent, it's a little different than others. And you'll say, well, what did you do? Well, Commissioner Boyle, Ben Salazar in the community, Beto Gonzalez in the community, myself, we give out 65,000 masks. This is months ago. I didn't tell anybody you had to wear them. I said, hey, I think this will help. Here's a mask. Give it to everybody you know to help us get back to where we all want to be. 65,000 masks. Very rarely, until recently, do we have anybody even report on that. Again, we didn't tell anybody you had to wear a mask. We just asked if you wanted one. We're going to try to supply one. This is the hot spot. Let's try to make this work. Because keep in mind, like I mentioned earlier, on the city council, police and fire, that's our job. We have police and firefighters who have tested positive. And then they can't show up when needed when you call them for your help. So that's part of our job as well, right? To maintain the public safety that everybody, when they first get elected, will tell you is number one. They do. So, I mean, I could go on and on. I know people have touched on it. I want to thank everybody for being here. I also want to reiterate what you heard about the emails. When you get so many, even the ones that have to do with a stop sign that maybe needs to be fixed, it gets mixed in there. So some I responded to, some I haven't. But a lot of those emails that I received that were against the mask also had mentioned numerous emails had mentioned, don't you believe in the Constitution? And what about our rights as Americans? So I know there was a few people who came up who were actually veterans, or maybe they're still here, maybe not. I myself know the Constitution well. I served active duty, and many of you don't know that, and maybe people listen and don't know that. So for 2 months in boot camp, I went over the Constitution religiously. So when you send somebody an email and say, don't you believe in the Constitution? You should probably do a little research first. Because one of them things I signed up to do was to go away, where I never touched American soil for 2 years. Fighting for those rights of what we are here for today. I'd never seen the mask in the Constitution. I still haven't found it. I know you can give it to me 100 different ways that says this is what it means. Well, you could do the same thing with stats, how you say they're going down or going up. It's not in there. Trust me, I know. I served my country. So we're going to agree to disagree on that part. Again, the frontline healthcare workers, we sit here for a few hours, and bear with me because that Monster energy drink I had at noon is well wore off by now. But we've only had these masks on for a number of hours here. These frontline workers that are told to wear them because that's part of their procedure at their job, they have to wear them all day long. Do they want to wear them? Probably not. Do I want to wear this mask? No, I don't. But I am, because I know it's a piece of the puzzle. There's nobody up here that's going to say this mask is going to solve all the problems we have. No, it's not. It's a piece of the puzzle to lowering the numbers, just like washing your hands and just like social distancing. And I know some of my colleagues that signed on and they brought this forward, and I did support it, but I wasn't a part of it. And I watched over the last couple weeks, again, as we had to put the budget to the side. And I noticed more and more people wearing a mask. And there's a comfort that comes over you when you walk into a store and a lot of people have a mask on. And I thought that at one point we would not have to make this decision. Again, that wasn't made from a different body that should have. That people were just going to go about this themselves and we wouldn't be here. But just yesterday, I walked into a gas station. I was the only one with the mask on. It was the reality that if you don't put something in place for people's health, safety, and well-being, then we can't get over this hump of where we all want to be. So, I mean, with that being said, I know also, like I said, with the safety thing, I'm sure many of you, like me, in my family, I have the extremes, right? I'm kind of the middle on everything. My brother still doesn't believe this is true. He will never wear a mask. I don't care what we pass today. He will probably text me after this vote and say, I'm not wearing it, I don't care. But my sister, on the other hand, hasn't left her house in 6 months. I think she's trying to be like the last sole survivor. So we have these extremes. Now, I love them both the same. If one of them was here, I would say I love them more, but they're not. They're probably both listening. So I love them both the same. And this is how it should be in the community. However this vote goes today, there shouldn't be this sneer or this bullying or whatever it is. You should wear the mask when you're supposed to. And that's hopefully the way it goes, because I have kids that want to participate in stuff. I have small business owners who are suffering. I have a lot of friends and family that I haven't seen in a while. So we need to get back on track. And if this small little bit that you tell me can be a part of that puzzle, then that's the way I'm going to go. Thank you, Mr. President.
Thank you, Mr. Palermo. Councilman Gray, you are recognized.
Thank you, Mr. President. I'm going to leave my mask on so that I have an interpreter next to me that I want to respect, and my colleague next to her I want to respect, and I don't want to get in Paul's way because he makes too many important decisions for us. So I'm going to keep my mask on. But I felt like I probably ought to say something since my name came up a couple of times. Let me say, first of all, that I'm sort of perplexed sometimes because I sit and I listen to people talk about this pandemic. Let's don't call it an epidemic or anything. Let's call it what it is, a pandemic. It is worldwide. It is a virus that has mutated into something else, and many of our medical individuals are looking at it and trying to figure out what it's going to do next, but many of us, including our professionals, still don't know because this virus is so new. Let me say also that here's my fear and my concern, which is why I have been supportive of this the whole time. We have a serious nursing shortage. And if we run the risk of overcrowding our medical facilities, we're going to be in serious trouble. And if we have people that leave the profession, then we're really going to be in dire straits. So I'm afraid that if we don't do this, our healthcare workers are going to look at us and say, well, you all don't care, so we obviously have to make a decision on our own. I don't want that to be the case. I've sat in here and I've listened to people talk about, we are the people. Well, they're the people too. All of us are the people. What we need to do is decide among ourselves what we need to do to move this thing forward in a logical way. Food was mentioned. I don't talk about it like Councilmember Palermo doesn't talk about it, but every week, at least once a week, if not twice, I'm going to Walmart or some of the other stores to provide food for the housing authority towers. And because many of those people are afraid to come out because of this pandemic. And when you're buying food for people, especially those, and I don't know if you all have seen TV or looked at the lines of people that are waiting to pick up a box of food, anything to fill their stomachs. They're not thinking about vitamins. They don't care about vitamins. They care about getting to the next meal. And when you live in a certain society with certain privileges, you don't recognize the other people who have less privileges and have to rely more on what we can do collectively to help them because they are on the down and out for whatever reason. So I do that, and Councilmember Palermo, I'm a Vietnam veteran, as you know, and I had to read the Constitution and the UCMJ and learn both of them back to back in 9 weeks. So I understand the Constitution as well, but my concern is for, first of all, individuals who are on the front lines who need to know that we care about them, who need to know that we're going to support them, who need to know that we're going to back them no matter what. The food thing is an erroneous argument to me because we don't live on the same level playing field in my district, in Councilmember Palermo's district, and others. What I'm afraid of, really, is if we don't slow the spread and bend the curve, and we have to close again, a couple of our districts are going to be devastated. Devastated. So I'm not in a position where I'm going to run the risk of devastation in my district. I'm not going to run the risk of telling our healthcare professionals and our other frontline workers that we don't care enough about them to support this. However it got here, we need to support this. Thank you, Mr. President.
Thank you, Councilmember Gray. I've been waiting and listening all day, and to me, there is no more compelling responsibility that we hold in our offices than to safeguard and take measures to protect and hold in the utmost importance the public health, safety, and welfare of our community. There is nothing else that we do in our positions that comes near to approaching the awesome responsibility of those tasks. If in the one moment in a century we are faced with a public health emergency in our city, I couldn't imagine what it was like to know the science, the data, the experts all compelled me to act in a certain way and to have refused to make it and made a choice to pass, to not act. I couldn't imagine what it would be like to look at myself in the mirror for the remainder of the days that I have, knowing people were going to get sick and die because there was a measure I could do to reduce that risk, that everyone in expert positions and the science and the data told me I needed to do, and I failed to act. I don't want to have that on my conscience. There's a public health emergency, folks. And is this ordinance as amended what the experts tell us would be best to do at this time to minimize the risks? No. But is it so important that we get an ordinance of some kind in effect to begin the process of requiring masks, rather than wait another 36 days because of the position we've placed ourselves, or been placed in, excuse me, to me, is too long of a gap of failing to do anything. And so when you have a requirement to get 6 votes, you have to be open to other people's ideas as what they're willing to tolerate to move this measure forward. And you have to compromise in this near term to get this ordinance passed. So for those of you in my district who, of the hundreds and hundreds of emails that have been coming in, who overwhelmingly in my district, District 3, downtown, midtown, from where we're sitting now in the river out to by Bergen Mercy Hospital and just south of Methodist and Children's. There's University Hospital, there's CHI Health, Bergen Mercy. Just on the boundary, there's Children's and Methodist and Brinker Harding's district. I have so many scientists and healthcare workers that live in my district that, and their families, they're overwhelmingly in support of a stronger ordinance. I tell them, do you want nothing or do you want something? Because the person we entrusted to make this decision was pressured into not doing it and said she wasn't going to do it. So here we are, considering a measure that we know, and the scientists tell us, won't be as effective as the other ordinance proposal that's moving along. But if we don't pass this one today, and if we don't speak as one voice, as a council, then our community faces more time without measures that we know will help reduce this risk. And so that's how I look at it. And that's how I feel about why I'm compelled to act. And I don't want to look myself in the mirror and have to explain to someone else whose family member got this horrible disease, why didn't you do something, Chris? Why did you not act? Thank you. We have a motion and a second on Amendment 6E. Roll call.
Palermo. Yes. Festerson. Yes. Gray. Yes. Harding. Yes. Melton. Yes. Pauls. Yes. Mr. President.
Yes.
Motion passed 7-0.
Roll call.
Palermo.
Yes.
Festerson. Yes. Gray.
Yes.
Harding. Yes. Melton.
Yes.
Pauls.
Yes.
Mr. President.
Yes.
Item 6 is approved as amended, 7-0.
What's the pleasure of the council on item 7?
Move to approve.
Roll call.
Palermo.
No.
Festerson. No. Gray.
No.
Harding.
Yes.
Melton.
Yes.
Pauls. Mr. President.
No.
Motion fails 3-4. Item 8, a resolution to approve the preliminary.
Madam, before you call that up, I'd like to thank everyone who came on the last 2 items today, particularly those who sacrificed much of your personal and professional time to be here. It was an engaged debate, and on behalf of the council, thank you very much. Item 8, please.
Item 8, a resolution to approve the preliminary plat for Highlander East located southwest and southeast of 29th and Burdette Streets. Planning Board and Planning Department recommend approval.
The public hearing on item 8 begins at this time. Are there any proponents? While we're waiting for those on item 8, for those who are arriving for the budget public hearing at 6:30, we are still on the regular council agenda from 2 o'clock. It'll be a while before we get through it. We're anticipating we'll be taking a 10 to 15-minute break when we conclude this portion of the agenda. Public hearing is closed on item 8. Roll call.
Palermo.
Yes.
Festerson.
Yes.
Gray.
Yes.
Harding.
Yes.
Melton.
Yes.
Pauls.
Yes.
Mr. President.
Yes.
Item 8 is approved 7-0. Items 9 and 10 can be considered together for Fountain Ridge East, located at 192nd and Burke Street. Planning Board and Planning Department recommend approval. Item 9, an ordinance to rezone this property from AG District and DR District to DR District. Item 10 is an ordinance to approve a major amendment to the mixed-use district development agreement.
The public hearing on item 9 and 10 begins at this time. Are there any proponents? Are there any opponents? The Public hearing is closed. Set, a roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Items 9 and 10 are approved 7-0. Item 11, a resolution to approve the preliminary plat for smelter plant replat 2 with a waiver to section 53-4D lot frontage located northwest of I-480 at the Missouri River. Planning Board and Planning Department recommend approval.
The public hearing on item 11 begins at this time. Are there any proponents?
Good evening, Chris Koenig, HDR, on behalf of the proponent. Thank you.
Are there any other proponents? Are there any opponents? The public hearing is closed. Roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Item 11 is approved 7-0. Item 12, to consider a liquor license addition application to add an outdoor area to Little Polonia Bar's Class C liquor license located at 3804 Q Street. A is communication from the Planning Department regarding permits. B is communications in opposition. Number 12.
The public hearing on item number 12 begins at this time. Are there any proponents? Are there any opponents? The public hearing is closed. Roll call. Oh, do we have a speaker? I saw a hand. Okay. Roll call.
You have time to lay it over if you wanted to.
Okay, there's been a motion, a second. There's further discussion. Council Member Vice President Palermo, you're recognized.
Thank you, Mr. President. Thank you, Mr. President. This is in my area, and I know this area pretty well, and there was some opposition, so I was hoping that the owner or those who are requesting this would be here for a couple of questions. I was told that we could lay it over with no problem, but I know there's already a motion, so I'd like to do that just to get everything ironed out.
The applicant's here.
Oh, we have the applicant here. Please come to the microphone, man. Provide your name and address.
She's been here the whole time.
Council Member Palermo has questions.
Karen Gunya, 4819 Glasgow Avenue.
In what city?
And I'm here to,
What's in what community do you live, ma'am? Where is Glasgow Avenue?
it's Bellevue.
Thank you.
Thank you, Mr. President. So, ma'am, thank you for being with us for many, many hours on this liquor license. But I just wanted to ask, because I did receive a letter in opposition asking where you were going to put this outdoor area and a little bit about it.
What it is, we have probably a 42 by 42 area on the west, north area of the building.
Okay, so it's in between the two buildings, is that correct?
Place?
Is it in between the two buildings?
Yes.
Your establishment and the business
Correct.
next door? Okay, and there's some other comments, but, and how long have you had this business, ma'am?
A what?
How long have you had this business here?
50 years.
How many?
50.
Motion to approve. Oh, sorry, Ben, you already had the motion.
We already have a motion in a second, yes.
Yes, and ma'am, just for the record, are you Karen Gunya?
Yes, I am.
Thank you. Gunia?
Correct.
Thank you. Roll call.
Palermo.
Yes.
Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Item 12 is approved 7-0. Item 13, to consider a liquor license addition application.
Thank you.
To add an outdoor area to Spring Inn Bars Class C liquor license located at 2703 South 10th Street. Planning, or A is communication from the Planning Department regarding permits.
The public hearing on item 13 begins at this time. Are there any proponents, which includes the applicant? City Council rules require the applicant to be present at the meeting.
We do.
Roll call. 1 week?
One.
Yes.
Okay. Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Motion passed 7-0. Item 14, an application to consider a Class M liquor license for Infinity located at 2615 South 120th Street. Ace Communication, opposition.
Public hearing is resumed on item 14 from our last meeting. Are there any proponents? Is the applicant here? Let me, first of all, are there any proponents or opponents? Public hearing is closed. We have a motion and a second to recommend denial. Roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Motion passed 7-0. Consent agenda. Any member of the City Council may cause any item placed on the consent agenda to be removed. Items removed from the consent agenda shall be taken up by the City Council immediately following the consent agenda in the order in which they were removed, unless otherwise provided by the City Council Rules of Order.
The public hearing on agenda item 15 was held on July 28, 2020. Roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Motion passed 7-0.
The public hearings on agenda items 16 through 49 are today. If you wish to address the City Council regarding these items, please come to the microphone, indicate the agenda item number you wish to address, identify yourself by your name, address, who you represent, if you are a proponent or opponent, and provide your testimony. Anyone wishing to testify on these items on the agenda? The public hearing is closed. Roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Motion passed 7-0. Item 50, an ordinance approving the contract with Clean Harbors Environmental Services, Inc. in the amount of $339,070 for household hazardous waste transportation and disposal to be collected at Under the Sink.
The public hearing on item 50 begins at this time. Are there any proponents or opponents wishing to be heard on this item? The public hearing is closed.
Item 51, an ordinance levying a special tax assessment for condemned buildings or structures on certain lots, group number 2019-01.
The public hearing on item 51 begins at this time. Are there any proponents or opponents wishing to be heard? The public hearing is closed.
Item 52, an ordinance approving a tax increment financing redevelopment agreement to implement the Meridian at 72nd and West Center tax increment financing redevelopment project plan located at 2808 South 72nd Street in an amount up to $5,876,535.
The public hearing on item 52 begins at this time. Mr. Seaton, I assume from Planning Department you're here to answer any questions?
That is correct, sir.
Thank you. Are there any other proponents or opponents wishing to be heard on this item? The public hearing is closed.
One public hearing can be held for items 53 and 54. Item 53 is an ordinance to approve an agreement with Elkhorn Public Schools to provide one associate school resource officer and a marked police cruiser from August 15th, 2020 to the close of the 2020-2021 school year. Item 54 is an ordinance to approve an agreement with Millard Public Schools to provide up to 4 associate school resource officers, 1 canine associate school resource officer, and marked police cruisers from August 14th, 2020 to the close of the 2020-2021 school year.
Public hearing on items 53 and 54 begin at this time. Are there any proponents?
Hi, Lieutenant Charles Ott, the Omaha Police Department, 505 South 15th Street. I'm here for any questions.
Thank you. Are there any other proponents? Are there any opponents? Public hearing is closed.
I didn't know.
We have a light. Vice President Palermo, you're recognized.
Thank you, Mr. President. Lieutenant Ott,
Yes, sir.
first, thank you for waiting us out for 4 hours. We know that when SROs, and this one's an SRO, but a little different, come up, sometimes we get feedback on how they're not important. And what I'd like to hear from you is in your words, what's the benefits of an SRO?
In my opinion, the benefit is of SRO in the city of Omaha, not just the city of Omaha, but nationwide in major cities such as Omaha. SROs are very important. Omaha is not unlike a lot of major cities with violent crime being, a lot of it's gang related, and I feel that having the officers in the schools, that serves as a deterrent because those gang ties, we have gang members going to schools. Those gang ties do not get severed when they go into the school building. And I feel that's very important. And also, benefit of having SROs in the schools is a deterrent for the school shooters, that God forbid we ever have that happen in the city of Omaha. We've spent extra time, put the SROs through extra training in regards to those. So obviously school violence, both those two scenarios are something that's very important to me to be prepared for and prevent. But the day-to-day activities that school resource officers do, just building bonds with the students every day, and the bonds that they make with these students, a lot of them, once they get to know their school resource officer, we get a lot of intel on different things that have gone on, and things that, from minor things to all the way up to some major crimes. And I would hate to see that bond and that, that we're able to get from the officers, be, limited. Just their mere presence in the schools helps to, as NASRO calls it, bridge the gap between the students and the police department. And one thing that we have done, starting with Deputy Chief Gonzalez, the Safe to Tell hotline that's been started last year, the anonymous reporting tip line that students, anybody can contact via either online, an app, or a telephone, but most of the kids are using the apps. The officers have been, they got some extra training on threat assessment, and they've been trained on the existence of this hotline. And this is something that they can take to the school, make sure the kids are aware of this tip line. And that tip line is ran through the Boys Town Crisis Hotline. They're the experts. They're the most well-trained to handle this type of, a lot of the largest segment of those calls have been like suicidal or mental health type calls. And just their presence, I feel we've really tried to push that on so that the kids are aware of it and make that, a resource for the kids. And once the Boys Town call takers take that, that helps with getting them the resources that they need. I could go on. There's been numerous stories. I've seen a story, not locally, of what's happened. There's been two that I saw in particular with protests, and the school resource officers, like in Omaha, were sent out to work on street duty, and how there were some students who saw their officers out working the protests and the kind of bond that they had. And like I said, there were some really good stories there. We had locally here, it's been a few years, but we actually had a school resource officer that was asked to be in a former student's wedding. So I think what the officers bring to the students and bring to the school, bring in resources, referrals for the proper, whatever it is that the student could be facing, referrals for staff, resources and referrals, I think are very important.
Thank you, Lieutenant. I,
Sure.
again, appreciate you waiting 4 hours, and I really appreciate the definition of
Sure.
what you're here presenting on today. Thank you. Thank you, Mr. President.
Thank you, Vice President Palermo. Councilmember Pauls,
Yes,
you're
sir.
recognized.
Yes, I just have, how many officers do we have in the middle schools?
In the middle schools,
Right.
For all the districts?
All the districts, yes.
All the districts, I believe we have 12 for OPS, 9 are part-time, and I'm including some of the alternative schools that I don't necessarily, wouldn't necessarily classify as middle schools. but 9, and those are part-time. 3 middle schools have full-time officers with OPS. Millard, we have 5 covering 4 and a K-9 officer, so 5 total, covering 6 schools. Elkhorn, we have 1, which is a part-time, and Westside, we have 1 that's a full-time.
Okay, so most of them in the middle school are retired officers?
That's correct, yes, sir.
Okay, in the high school, how many do you have, because those are regular
Yes.
officers in the high school?
Yes, in high schools, it's all full-time, full-time on-duty officers. 7 with OPS, 3 with Millard, 1 with Elkhorn at Elkhorn High School, because South and North haven't been annexed yet, and West Side.
And all these officers are paid by the public schools?
When they are working in their capacity as a school resource officer at the schools, their salary is paid for by the school districts.
Okay, thank you.
Yes, sir.
Thank you. Madam Clerk.
Non-action items, items 55 through 72, do not require public hearing or city council consideration at this meeting, but will be placed on a future agenda for public hearing and or vote. The reasons for non-action is noted after the item on the agenda, as well as the date the item is expected to appear on agenda for consideration.
At this time, the council having been in session since 2 p.m. without a break, we will be taking a 15-minute recess before we begin the public hearing on the Omaha City budget. Without objection, so ordered.
No, we don't.
don't know for Chris. I had some people ask me if they could take their mask off when they speak, which I said was fine.
Yeah.
But we might want to make sure that nobody sits in that very front row. I did tell the one gentleman, because they may not be 6 feet
Yeah.
away.
Okay.
I didn't.
All right. Ladies and gentlemen, we will be calling our meeting back to order momentarily. As a courtesy to those attending wishing to speak, we are going to, for distancing purposes, keep the first row empty. That'll allow a speaker to temporarily remove their mask should they wish to while they speak. So if we have anybody in the front row, we'd ask that you move back, please. Also, just kind of a reminder of the rules of decorum for the council and the procedures for tonight. There's no opponents and proponents tonight. We're just going to call speakers one after another, whether you're in favor or opposed or have ideas on changing the budget. The plan of the council will be to continue until everyone who's signed in has an opportunity to speak. Speaking of the sign-in, if you wish to speak about the agenda at this public hearing, the sign-in sheet process is required. You are required to complete the form properly. If you do not do so, then we will call your name and give you the opportunity to fix your sign-in sheet. Otherwise, you won't be allowed to speak. When you're called up, you have to give your name and address. The good news is your time that we're giving you is 3 minutes, does not begin until you give your name and address. There's a green light when your time begins, a yellow light when you have 1 minute remaining, and a red light when your time expires. That time limit will be strictly enforced tonight so that we give the best opportunity for everyone who has come to speak. There's no applauding and jeering and clapping and other distractions allowed in the meeting. If you engage in those activities, you'll be declared out of order and escorted from the chamber. So we ask you that no matter how passionate you are about an item or how a speaker compels your inner self to want to do something to express your support, the rules of this public hearing do not allow that. We thank you for coming tonight. I believe it's now time to resume the meeting. And Madam Clerk, if that is the case, I'd ask that you call roll call.
Palermo. Here. Festerson. Here. Gray. Here. Harding. Here. Melton. Here. Pauls. Here. Mr. President.
Here.
And I will just note, too, that an affidavit of publication is on file for this public hearing, and a current copy of the Open Meeting Act is posted on the east wall of the legislative chambers.
Good evening, ladies and gentlemen. Welcome to this public hearing of the 2021 proposed City of Omaha budget. I'm pleased to see so many of you here willing to provide your input. Tonight's public hearing is conducted in accordance with the requirements of the city charter and state law. To make tonight's proceedings as efficient as possible, we will follow the procedures that I discussed a moment ago that have worked so well in the past. I will ask the city clerk, Eliza Butler, to describe the procedures for tonight's hearing.
Thank you. This public hearing is for the 2021 city budget and CIP. Before you enter the chamber, you are asked to sign in. The council president will call you to the podium in that order. We ask that you keep your comments limited to the budget and that you speak for no more than 3 minutes. The light at the podium will turn yellow when you have 30 seconds remaining in your time. Please summarize your comments at that point. When the light turns red, your time has expired. If you have written out your presentation, please consider stating your name and address and submitting the presentation for council members to review later. Your written comments will then be part of the official record. Council members and other city officials are here to listen to your comments. They will not respond or debate the issues tonight. Council members welcome your calls and emails if you wish to discuss issues in greater detail. I will also note the Finance Director's budget presentation is located next to the agendas on the table where you signed up to speak. It's also available on the Finance website.
After this public hearing, the budget review process continues. Council members will consider your input as we continue to review the recommended budget. We are scheduled to vote on the budget at our regular council meeting on Tuesday, August 18 at 2 p.m. right here in this chamber. Again, we ask you all to be considerate in following the rules of decorum and allowing your fellow citizens their exclusive time to speak uninterrupted. We understand that some of you may have views different from those who are speaking. We ask that everyone be respectful of all speakers. In addition, I ask that everyone turn off or silence your cell phones at this time. Any electronic devices making noises throughout this meeting may cause you to be removed from the chamber. Well, I'll move to the first speaker. Again, if you wish to speak at tonight's public hearing on the budget, there are sign-in sheets. Major Adam Moore.
Major Adam Moore, 10755 Birch Street here in Omaha. Mr. President and council members, I thank you for the opportunity to be able to address you tonight specifically in support of the 21 budget as proposed specifically in the area of community service. The Salvation Army has partnered now for 2 years with the City of Omaha and several community partners with a program that we've termed Way to Work. The focus of this program is to help individuals who are finding themselves in challenging times to reintroduce to the workforce. A few of the testimonies that we've had in the last few weeks is that one individual was living in their car. Through the process of Way to Work, they were able to be disciplined, have time to show up, work on a resume, and is currently working with the Veterans Administration. We have another individual through the same program who has been able to land a full-time job with U.S. Postal Service, in addition to finding permanent housing. In another community story that we have, an engagement as an individual was living in one of our local shelters. One of our ministry partners with the Salvation Army was able to create lasting change in their lives now for over a year. We have been committed to this program, as I said, over the last 2 years. This next year, 21, looks as promising as ever. Through the pandemic, the Salvation Army has been active in this program with a few adjustments, but we have recently doubled our program participants. They, again, are in partnership of having some real-life work experience, as well as building their resumes. We're currently partnering with having these individuals work with the city at the Levi Carter Park, where they're engaged with park cleanup efforts and similar endeavors. Over the last 2 years, they've done some work with the Park and Recreation Department at several different locations. Our proposal to you tonight is to support, again, specifically the community service budget and continue to partner in mission and ministry, not only with the Salvation Army, but with others who are putting individuals in our community who find themselves marginalized on a pathway to hope. Again, we're grateful for the opportunity to be able to speak to you this evening and again support the community service section of the 21 budget.
Thank you. Shannon Snow, followed by Johanna Jones.
I'm Shannon Snow, 1711 South 33rd Street. I'm the executive director of the Omaha Municipal Land Bank, and I'm a little short.
That will slide to the, you can move it to the side too. There you go, Shannon.
So I can see you guys. I am here to support the community service fund in the budget this year. The Omaha Municipal Land Bank has been a grateful recipient of these funds in the past. I'm happy to report to you that since our establishment, we have put 176 properties back onto the tax rolls, adding tax revenue that is beneficial for the entire city of Omaha. We participated in 48 houses that have also been built as part of redevelopment plans in partnership with the land bank. Currently, we have 337 properties listed for sale. This is impressive, especially when you think about the foreclosure process. We've really only been around for 5 years. So getting through that and showing numbers, I feel is a great accomplishment for us. I've been with the land bank for 5 months, and it has been a busy 5 months. If you think about what happened at March 30th, what was going on. But we have been preparing for the future by revisiting our strategic plan, and I'm happy to report that that will be adopted within the next couple of months. We're reviewing it at our public meeting in August. That plan is really going to set the stage for continued impact in the city of Omaha and really allow us to think strategically about how we're investing our funds for community revitalization going forward. I also think it's important to mention that we are an economic recovery organization, and the work that we do now is really going to set the stage for any economic impacts due to the COVID-19 crisis. So with that, I am here to support the budget, specifically the Community Service Fund. Thank you.
Thank you. Johanna Jones, you're next, followed by Doug Kagan.
My name is Johanna Jones. I'm here on behalf of the Women's Center for Advancement.
And your address?
3801 Harney Street.
Thank you.
The Women's Center for Advancement provides victim services to individuals who have experienced or are experiencing domestic violence, sexual assault, stalking, or human trafficking. And the WCA has received community service funds for the past several years from the City of Omaha. With those funds, we run the crisis hotline for the city for victims of domestic and sexual violence. This hotline runs 24/7, and every year we're seeing over 10,000 calls to this line. I wanted to come today to thank you for your continued support, and thank you for your support for the survivors that we serve. Thanks.
Thank you. Doug Kagan, followed by Liam Krakemeyer.
Good evening. Doug Kagan, 416 South 130th Street, representing Nebraska Taxpayers for Freedom. Our group generally supports the mayor's budget. The physical layout, for these reasons, the first physical layout gives an excellent explanation of the various city funds. The property tax rate will not increase. To save dollars, the mayor reacted expeditiously and eliminated part-time positions through furloughs, closed libraries temporarily, and canceled summer jobs in city departments. In addition, a hiring and spending freeze reduced department budgets by $5 million, canceled summer camps and neighborhood grants, eliminated callback overtime in the fire department, and reduced police overtime. These actions totaled $22.7 million in spending reductions. The city will save $100,000 annually in fire department IT upgrades. Purchasing computers directly from the vendor will avoid property tax payments. Much needed street rehabilitation from the $200 million bond issue. Additions to police department equipment will enhance public safety. Bonded general debt rises only slightly. The city Moody's and Standard & Poor's bond ratings still strong. Retirement, health, medical insurance, and pension costs would drop. However, although Mayor Stother diligently cut expenses in several areas of the budget, it may not rest on a solid foundation. The financial stability of this budget rests on the thin promise of CARES Act dollars helping to fund unanticipated expenses caused by COVID-19. The city incurred more than $75+ million in unplanned, unbudgeted expenses to respond to this pandemic. As of today, there is no guarantee that state or county stimulus funds will fill this looming deficit. Therefore, we suggest several budget cuts among the many more we have compiled in our issue paper. Negotiate employee contracts to end longevity pay and specialty pay. Decrease overtime costs, which are still increasing. Worker compensation costs scheduled to rise by 11%. Make interlocal agreements for this expense with adjacent jurisdictions and accelerate the wellness program. Utilize interlocal agreements for purchasing services, supplies, and equipment at lesser cost. Require the Human Rights Department to concentrate only on department duties and end outside activities. and initiatives. Eliminate some of the community service programs. Place bid forms and other forms online so that bidders, etc., can ascertain that they are accurately filling in the spaces for required information and not utilizing employee time for corrections. Suspend recycling at the end of its current contract and continue research into locating a new age incinerator in Omaha, saving annual landfill costs now set at about $4 million. Thank you.
Thank you. We would remind people that the council passed an emergency ordinance requiring people to wear masks. We're allowing speakers to temporarily remove their mask while they're speaking since they're social distance. If you're present and not wearing a mask, we ask you to put one on. If you do not have one, the clerk informs me there are masks available by where you signed in tonight. We'd ask that you please avail yourself of a mask. Yes. Oh, and yes, Councilmember Harding points out if you have a medical reason for not wearing a mask, then you are not required under the ordinance. Thank you. Mr. Krackemeyer, and you are next, followed by Julie Schrader.
Perfect, thank you. My name is Liam Krackemeyer. I live at 3743 Woods Avenue, Lincoln, Nebraska. And I would just like to thank you for the opportunity to speak in front of you tonight. I have spoken in front of the Lincoln City Council as well, and I stand here tonight as a proponent of this budget. I think it is very well put together, and I have read over what the mayor has proposed and plans to do with the police funding, and I think it is well within line of a growing city as what we are also seeing in Lincoln. And I just think it is a very good budget, and with what she plans to do with the units and the body cameras and other assorted items is, I think, just very good on her part. She understands safety and community safety, and I love how she has put that first and foremost in this budget, and I ask you to not amend anything within that. And so I just think it is important that as cities grow, that they keep community safety of its own citizens at the forefront. Thank you.
Thank you. We would remind people that there's no applause or that sort of thing allowed in the chamber, so snapping your fingers is a form of that. If you do that again, you'll be ruled out of order and escorted from the chamber. Julie Schrader. Anthony Connor, you're on deck.
Hello, my name is Julie Schrader. Again, I think some of you guys can see me. Sorry. And I am the president and founder of Rejuvenating Women. The address that I share is my home address versus the home of the house that we manage, Rejuvenating Women, because of the women that we serve. We keep that private. So you can write down mine as 4372 South 152nd Circle, Omaha. The last couple of years we've been blessed to receive some funding out of the yearly budget because of some of the women that we serve are trafficked. Actually, all the women we serve are trafficked, sex trafficked, labor trafficked, but the majority of women that we come in contact with and assist are all sex trafficked. And we have them coming. We actually have one there now from another state. We have two more from the city, in which our jails referred to us because these women were arrested for things that they were forced to do while being trafficked. So the home that we have is very important, especially in Omaha with the increase in sex trafficking. We hear about it all the time. Things are coming out. Things are being made more public. And I even think survivors now have more bravery to come out and say that they may have been trafficked when maybe they never shared that before. It's important that we have a home like this in our city so that we can help these individuals that are coming out of sex trafficking so they have some place to be. We have a short-term program now as well as long-term. We do a mentorship program and a virtual case consultation as well because of COVID. So we're able to serve more women. Thank you very much.
Thank you. Mr. Connor, as you work your way down, we're going to see if we can remove the monitor so we can see everybody. Thank you. Just as long as no one's going to get hurt. I think that'll work better. Wait, Mr. Connor, until he resets you'll be allowed to introduce yourself with your name and address, and then he'll start your time. Thank you. Proceed.
You ready? All right. Good evening. My name is Sergeant Anthony O'Connor. I'm president of the Omaha Police Officers Association. My address is 13445 Crier Avenue. I'm here today to speak in support of the mayor's budget, specifically the police department's budget. I know many people wish to be heard today, so I'll keep my comments short. In my 20 years as an Omaha police officer, I've been part of a department and a culture that is constantly striving to improve and to better meet the public safety needs of our city. In many respects, our department has been a model for the nation. We've made tremendous strides towards diversity, community relations, and our methods of policing. In fact, I stand here today as the first Black president of the Omaha Police Officers Association, representing the 900 sworn officers that serve every corner of the city. We have maintained our national accreditation through Independent Commission of Accreditation for Law Enforcement Agencies, considered the gold standard in public safety, for nearly 2 decades now. Not long ago, the Obama administration recognized our department for our reputation and our service and our work in the community. What that means to you is that our officers are committed to the city and the work we do every day to reduce crime and to build relationships and trust with our citizens. We are a force for good. We are Omaha. I am asking this council to remember that we are not Minneapolis, New York City, Seattle, Portland, or Atlanta. Our law enforcement community has rebuked the actions that led to a terrible tragedy 400 miles from here and the national conversation we find ourselves in today. But we simply cannot make decisions for Omaha based on the loudest voice in the room. The recent protests and violence and media coverage that followed dropped the morale in our department to an all-time low. I urge this council not to follow the careless and reactionary decisions of a few major cities around the country who cut the police budgets for a political victory. The ramifications to public safety will be immense. Already this year, the New York Police Department has experienced a 411% increase in retirements from June 29th to July 6th compared to the same period last year. Omaha is not immune to this trend. Our department has seen several officers retire earlier than expected, and several more leave the department outright before being pension eligible. If this council votes to cut our budget, our ability to attract and retain professional and capable officers will be dramatically reduced. Your decision comes at a time where the city has experienced a recent uptick in violent crime, but recall, in 2019 saw our lowest numbers in homicides in 50 years. I credit the mayor for her leadership, and Chief Schmatter deserves a lot of credit for creating expectations and managing the department. But it is our sworn officers who do the work every day, and taking resources away from these men and women at this time would be a mistake. I implore you to keep our budget intact so we can do the work we've shown we're capable of. And I'm available for any questions.
Thank you. Paul Fileman, you're next, followed by Tyler Henningsen.
My name is Paul Fileman, F as in Frank, E-I-L-M-A-N-N, 5152 Jones Street. I'll wait till you get the handouts. Ask for your patience a little bit. I'm a retired mental health therapist. I've been retired a couple years, been looking at ways to support the community. And one of the things that I'm aware of right now is the acute crisis in the community because of the COVID situation, the poverty and so forth. This is an amazing program that's nationally known, and I wanted to just go through it real quickly with you because I think it could be something that could be done and paid for here in Omaha without using Omaha funds. I mean, it's really an interesting concept. It's called Crisis Assistance Helping Out on the Streets. It's out of Eugene, Oregon. Basically, it provides a mobile mental health unit, several units that go out with an EMT and a licensed mental health or a mental health intervention specialist. They go out on calls 24 hours a day. They coordinate with the police department. Whenever the police department feels that they would be appropriate, they send them out on those calls. The first couple pages kind of go through the features of the program. This program has been running in Eugene, Oregon for 30 years. It is amazing. The Denver Police Department are collaborating with a program very similar to this. And on page 3, you can see the savings to the police department. At the bottom, it shows the costs that are saved by diverting some of the calls to the police department. Instead of the police department having to handle the calls, the average savings in 2017 was $12 million to that police department. And mental health services were provided. And then you can do all kinds of things, which is dealing with mental illness. I worked in mental health for 25 years. Schizophrenia, depression, suicide attempts, child abuse, all these things are stuff that mental health professionals and support network can be provided through this system. The last thing I will show you on the last page is this now is in federal legislation. This program is built into, it's on the last page. There's a bill in front of Congress right now to fund cities and states to do this program. And it shows how the money is developed. It's used by Medicaid funds. And it shows on page 6, $25 million in planning grants to states to build this kind of a program. 95% matching funds to cover it, using Medicaid funds to provide a safety net for mental health, substance abuse, and so forth. This is all part of a federal bill that Omaha could use and take pressure off the police and provide a much more comprehensive safety net for the community and mental health and collaboration with all the organizations that are already doing the work. So I just wanted to pass this along and just let you know that it's out there and something that could be looked at with, I think the Med Center is starting a new mental health program. The police already do some of this work with Lutheran Social Services.
Thank you.
Thank you.
Tyler Henningsen, followed by Hannah Amrolahi.
Tyler J.W. Henningsen, 1301 Jones Street. I'm up here today to speak in support of the $161 million appropriation to the Omaha Police Department. Not only do they serve as a model of service and justice to our community, but they have among the lowest rates of use of force among all major cities in the U.S. I'd like to kind of go over a little bit, a couple statistics of what OPD does and why they need these resources. In 2018, there were 251,390 911 calls to OPD. There were 40,621 traffic stops in 2018. Yet there was only one suspect shot and killed by Omaha police officers in 2019. Our police officers have kept our community safe. They have been demonstrated a great amount of restraint. And I think the only thing to do would not only be to fund the police fully, but to decry all calls for any defunding of the police in the city of Omaha. Thank you.
Thank you. Hannah Amrolahi, followed by Derek Oden.
All right, my name is Hannah Amrolahi, and my address is 2131 South 61st Avenue. All right, first I would like to thank you all for your time and listening to us today, and I would like to recognize my representative, President Jerem, for supporting the mask mandate, putting that forward. I think that that is critical to getting kids back in schools and public health. In my response today, I'd like to address some of the things I heard. I think you're going to hear two key arguments about the 1% going to the police. One is going to be they're doing a great job. And I think if they're doing a great job, then why do they need more money? Two, they're going to say, you know, that there is some kind of danger or necessity for this money, and I think that we've seen that that's not the case. So you can say we're not Minneapolis, we're not San Francisco, we're not Chicago. Why do we spend the same amount of our percentage of our city budget on the police as those cities? I don't think we're a crime-ridden city in that way. I don't think that we need to allocate all of those resources, and especially we don't need to increase them. To say that this community is reacting to a disaster that happened 400 miles away is true, but it ignores the fact that we are reacting to a disaster that happened a mile away when James Scurlock was killed by a white supremacist. And that happened in our community. That's just one of many Omaha people that we have lost, members of our community, right? So I think that we need to consider those people when we think about who the community is responding to. I think that the 1% definitely is not necessary for the Omaha Police Department to continue to do the work that they do and to win back the trust of the community that they seem to feel they have lost. If they earned it, they can continue to show that through their actions. Thank you very much.
Thank you. Derek Oden, followed by Peter Owens.
Yeah, my name is Derek Oden, 15233 Nina Street, Douglas County Republican Party, and Nebraska Young Republicans. So I just wanted to come here today with my fellow citizens just to echo what a lot of them have already said, to encourage you all to vote for the mayor's 2021 budget, particularly funding the police with that 1% increase. And before I begin with just a couple of statistics I'd like to present, just would like to give kudos to Chief Schmaderer, Mayor Stothert, all of you, as well as OPOA President Tony Connor for their leadership. In the last 6 years, we've become some parts of our cities being one of the most violent in America to now being one of the best police departments in the nation, and the credit goes to them. The statistics don't lie. Of the 41,745 traffic stops in 2019, 2 of them resulted in a racial profiling complaint, and 0 of them were sustained after investigation. Of many of the reforms people are calling for, many of them are already in place. For instance, mandatory body cams, anti-bias training. So again, goes back to the leadership that we have here in Omaha, already being on the forefront, being progressive, if you will, in their sort of policing. And the last thing I would like to say is just the fact that we have to remember that police officers are human. They are sons, they are daughters, they are fathers, they are mothers. And we have to remember that they are people too. They have feelings, they have lives. They also want to go home every single night. So let's not demonize them. And let's please protect them, support them, and pass this budget. Thank you.
Thank you. Peter Owens, followed by Nina Head.
Hi, I'm Peter Owens with the Omaha Young Republicans. I live at 12904 Morrison Drive, Omaha, Nebraska. And I just wanted to speak today on a similar topic as a lot of the other speakers. First, I want to commend Mayor Stothert for putting together such a great budget. Budgeting during COVID is one of the toughest things that an Omaha mayor has ever had to lead us through, and she and the city council has done a great job, so I commend you all for that. Specifically on the topic of the police, according to an ABC poll, over 60% of Americans are against defunding the police. The Omaha Police Department, as the other speakers have said, is one of the best police departments in the nation. A lot of the reforms that people are calling for in other cities have already been done here because of the proactive work of our mayor and of past mayors. We already have a community relations board. We already have body cameras that are on every officer. And in order to have programs like that, in order to have the social workers that respond with Omaha police officers that go into tough situations, we don't need less funding for the police department. We need adequate funding that's going to make sure our city is safe and well protected. The speaker before Derek said that, oh, why are we spending the same percentage of our budget as a bigger city like Chicago? Well, hate to break it to you, but that's how percentages work. We have a much smaller budget than a city like Chicago. Therefore, we spend a lot less money on our police than a similar city like Chicago. If we're comparing percentages, I think it's just about right that we're spending a small amount of our budget on police. It's similar to other cities. That would tell me that we're in line with other cities, very Democrat cities. We're in line with what they're spending, and so I see no reason to defund the police. People in Omaha want good schools, safe streets, and a better economic future. Without public order and without a good, strong police department, we'll never get there. So I encourage you to vote in favor of the police funding and in favor of the mayor's budget. Thank you.
Thank you. Nina Head, followed by Vitaly Onachuk, or Onachuk. Sorry, Vitaly, if I mispronounced your name.
Hello, I'm Nina Head, and my address is 5004 North 192nd Avenue Circle. You can tell that was named by a man. I'm an Omaha citizen. I ditto everything Peter just said. I want to say that I cannot imagine defunding our Omaha police. I think they've done an awesome job. I cannot imagine us turning it into a Portland, Chicago, Seattle, all the violence, riot, destruction. I can't imagine calling the police and having a policeman and a psychologist or a shrink come with them. I want 2 policemen, well armed and trained, coming to my house. I can't imagine the police, our city turning into a police department or a city where people are rioting and turning businesses and homes and everything into shambles. I can't imagine that the other people in this room would go for that either. I recognize that our police chief over here, he has told us all the things about the wonderful accolades our police department has gotten, and even from our former president. And I want to recognize that and reaffirm all that we've heard. And so I really want to tell you we support the police, we support the mayor, we support everything they've done, and I hope you will support that bill. Thank you.
Thank you, Vitaly. It's your turn, followed by Virgil Patlin, and then Mark Bonkowitz.
Vitaly Onishuk, 5403 North 110th Plaza. I'd like to support everything.
Please direct your remarks to the council.
I'd like to support everything Anthony Connor said, Derek Oden, and Peter Owens. I totally agree with them, and sharing my story, I immigrated from Ukraine in back then, but I lived in the Seattle area in 2012, from 2010 to 2012, and I'm glad I moved out from there. Turns out, I would like everyone to encourage in support of the police budget, because also as a small business owner, I think every business owner needs a protection when the situation is in danger. We know what's going on right now in Chicago, in Seattle area, where police officer, chief police resigned. And do you guys think that the crime rate will go down with that? I don't think so. And to keep our communities and businesses safe, to perform a good economy, I think we need to support the budget for 2021. That's it.
Thank you. Virgil Patlin, followed by Mark Bonkowitz, and then Stephanie Olson.
Thank you for having me. Thank you for the work you do. I wanted to talk about a couple things.
Name and
Virgil
address.
Patlin, 3305 East Street,
Thank you.
South Omaha. That's where life begins. So anyway, I want to talk to you about a couple things. I kind of am opposed to some of the things going to South Omaha. I feel Victory Boxing Club should get a lot more money than what they're getting. The PACE program should get a lot more money. I know I don't want to divide the communities, but we in South Omaha have needs also. We work with a lot of children. We do it for free. And a lot of our people, our volunteers, are not paid. So like I said, Victory Boxing Club, if possible, and I know it's tough, they should get more money this year. They are having some problems. PACE is working with a lot of kids. They should get more money. I see it in the budget. It's progressive, and we appreciate that. But if you can go back and give them Victory a little more money, that'd be great and appreciate it. The other thing I like to talk about, you know, this thing with the police budget, I strongly support it if they should get more. The training that I went through when I was there was second to none. I went through diversity training when I was there. I believe with the whole time I was on the department, I got one complaint, and that's because He said I smacked his butt, but I don't remember doing that, so I wouldn't. But anyways, a few years ago in my neighborhood, I was sitting on the porch with my grandson, and all of a sudden I heard 2 or 3 gunshots come from the bottom of the hill. And then I heard someone yell in Spanish, "He shot Angel, he just shot Angel." Next thing I know, I grabbed my grandkids and I brought them up to the porch. And as I was doing that, a man ran right across my front yard, and I could say, "Oh my gosh, there's something wrong with this guy." His eyes were that big. And as I ran my grandkids into the house, I told my wife, "Hey, there's something happened. He just shot somebody." Well, I jumped into my truck, and all I wanted to do was keep an eye on the guy for the police, because sometimes it takes a while for them to show up. You know, I was there. What I didn't know is that he went next door, and there was a young man from El Salvador washing his car, and he shot that poor kid in the neck. So that's 2 shootings in a matter of minutes. Well, the neighbor came and got my wife and told her in Spanish, "He just shot my son. My wife, who's not used to this kind of thing, goes over and the kid split and blood out of his neck. So she tries to save him. Little did I know, as I jumped in my truck to find the guy, he had gone down to the corner, and on this day, a young man volunteered to mow some guy's grass. He went up and killed him. That's 3 shootings right there in a matter of 2 minutes or so. 2 dead, and the other shooting occurred when he first left the house. So that's 4 shootings in my neighborhood in less than 10 minutes. And my wife trying to save some guy's life with blood squirting all over. So I don't know what all this hype is about social workers. I love social workers. I work with them.
Your time's expired, and even though you have a compelling story, we have to stick to
Okay,
the
that's
time.
fine. I support the police and the budget. Thank you.
Mr. Bonkowitz, it's your turn, followed by Stephanie Olson. Mr. Bonkowitz. Okay, we'll go to Stephanie Olson, followed by Angela Eikenberry.
Thank you. Stephanie Olson, 6505 North 159th Avenue Circle. And I am the CEO of the Set Me Free Project, and we do prevention education on the dangers of sex trafficking, social media, safety, and healthy relationships. And we began because there was a gap in services and counter-trafficking work in Nebraska. We filled that need and continue to fill that need. We do that by helping youth recognize their intrinsic value, and what sets us apart is we activate critical thinking skills in a bold, fun, and interactive way. We have a curriculum from 3rd grade through college for youth, and we go directly into the classroom, both in person and digitally, to address healthy relationships, social media safety, and beginning in middle school, we begin human trafficking education. We also educate the community as a whole because prevention has to be a community response. Our mission is to stop sex trafficking before it starts. Omaha is a hotspot. And yes, in places we think about, but also in places that we can't even imagine. And what may surprise you is that human trafficking is not like the movie Taken most often. It's not about kidnapping. It is about relationship building. And it is happening right here in Omaha. And it's relationship building and familial trafficking, so trafficking by mom and dad. And we know less than 2% of trafficking victims are recovered, which is why prevention is so critical. And if we can prevent our youth, your kids, your grandkids from being trafficked initially, we save a tremendous amount financially in medical, rescue, and restorative needs. The Homeless Youth Services Coordinator for the Department of Human Services in Minnesota said, "We find that prevention of adolescent sex trading is the best interest of taxpayers, the prevention, and it results in a return on an investment of approximately $34 for every $1 spent." We know the same is true for Omaha. And we know that there is a report showing a 40% increase in crisis response needs in human trafficking in a 30-day time period with COVID. And so When you help us, and we so appreciate your time here tonight, when you fund the Set Me Free project, that money will go directly to youth in the area of preventing trauma and pain and to stop trafficking before it starts. And I would ask you, what can you do to be part of this solution? Thank you so much for your time.
Thank you. Angela Eikenberry, followed by Amanda Humes, followed by Cole Christensen.
Hello, my name is Angela Eikenberry. My address is 5624 Leavenworth Street in Omaha. I want to express my concern with the overall budget and budget process, as well as the capital improvement program and the process. For both, there is little to no opportunity for citizens to be involved and engaged in determining the priorities expressed in the budget and the CIP beyond this forum, which is late in the process when apparently not much will be done to change things, though I hope that's not the case. Perhaps for this reason, the budget and CIP reflect a city going in what seems to be the wrong direction. The public works budget and CIP reflect a city living in the past, where we continue to pour money into widening roads, and so some people can drive quickly through the city in their cars rather than investing in more sustainable and inclusive modes of transportation, such as public transit. Our debt obligations continue to grow to subsidize the maintenance of sprawl. A significant percentage of people in our community cannot or do not want to drive, but would like to take transit or bike or walk, but we're investing almost nothing in these important modes of transportation. The police budget also reflects a city that cares more about surveilling and harassing its citizens than it does in investing in jobs, access to jobs, and other community betterment. A June 7th article in Washington Post showed that increasing the spending on police across the country over the past 60 years was not significantly correlated to less crime and was not correlated at all with less violent crime. Yet we continue to pour money into supporting the police. So I want to see a budget and a CIP that reflects the inclusive values of our community, that makes Omaha a great place to live, where we can shift funding to create a sustainable, safe, and welcoming place for everyone. And please, please change the process so that we are able to have more input. Thank you very much.
Thank you. Amanda Humes, followed by Cole Christensen, followed by Mary Elizabeth Lawson.
I'm Amanda Humes, 521 South 31st Avenue, and I'm here to urge the City Council to reject the mayor's budget unless the police department funds are diverted elsewhere, possibly to some of the community programs you've heard of already. The Omaha Police Department does not deserve a raise, in my opinion. Our police chief said that to the Omaha World Herald, that intervention and prevention efforts would be lost if we did not approve the nearly $2 million increase in police funding. His quote gave me great pause as someone who also manages a team within a large organization. Since 2005, OPD's general fund allocation has more than doubled, from about $80 million to about $160 million. But over the same period of time, most crime rates in Omaha have remained roughly the same. At my job, I and my department do not get praise from my leadership or more money from my employer if my performance remains the same. Has OPD lost essential funding from elsewhere that we have to support with the city budget? Or does it really cost double today what it did in 2005 for unchanged key performance indicators? I should also point out that my job's performance is also tied to measurably decreasing costs for my department year over year. The mayor claimed that OPD received just 5 citizen complaints last year, but let me ask the council this. Does anyone here know how to make a complaint? Do you think the average citizen even knows that they can? Or the most vulnerable of our citizens, the ones who are most likely to have a negative experience with the police? The act of making a complaint in Omaha is a privilege and a luxury. As I was one of the unfortunate innocent citizens arrested for peacefully assembling on the Farnham Street Bridge, I do know what that process looks like. Let me tell you that it's cumbersome, it's opaque, and that I was refused my request for officers' names and badge numbers every time I asked that night. I might also add that I haven't heard a word about that incident from anybody on the council, including the council president, who happens to be my representative, the one I voted for, and the representative of where this incident took place. So It doesn't sound like we have great performance review data from downstream, our citizens, or great oversight and feedback from upstream, the mayor, the police chief, or this council. We have stagnant key performance indicators, and an additional 120 people were just arrested because the police thought they leaned toward the potential for violence instead of actually committing violence. I would not give this department a raise if it were in my organization, if it were my department using this feedback. This is all just a long-winded way of my trying to express my dismay when I feel the appropriate action here is to, at minimum, freeze the police budget where it is. And yet I learned that they're receiving an additional $2 million from folks like me who were treated wrongly by them. City budget details like this do not usually get the kind of attention you see here or you see outside. I think this is a really rare opportunity to include folks like me, our opinion, and the folks who helped to elect you, in a new way to make Omaha a more inclusive city when it comes to things like
Thank
this,
you.
like
Your
the city
time has
budget.
expired.
Thank you.
Cole Christensen, followed by Manuel Cook, and then Mary Elizabeth Lawson.
Cole Christensen, 5906 South 140th Ave. The Washington Post analyzed 60 years of federal data on crime and police spending nationwide and found no correlation existed between increased spending on police and decreased crime rates. On the contrast, the analysis of numerous studies by the Booking Institute consistently found that the only proven effective measures for combating crime are the programs and initiatives that create economic security in a form of work support infrastructure and educational equity. By allocating more money for the police, as Stothert chooses to do in this city budget, we are divesting money from programs proven to lower the crime rate. Further, the actions taken by Stothert, Klein, and OPD continue to show a highly inconsistent application of justice based on race and wealth. The fact that as I speak right now, Jake Gardner walks a free man says volumes about the true purpose of the Omaha police force. Jake Gardner murdered a young black resident with an expired CCW permit, numerous violent prior charges, a documented history of bigamous behavior. His choice to illegally fire warning shots with his unlicensed weapon designated him, by definition, as an active shooter, and he has still not been charged. Those of us trying to draw attention to the miscarriage of justice here, quite ironically, have been subject to police force and arrest repeatedly. I myself have 5 outstanding charges against me. A few hours prior to Skurlock's murder, I was tear gassed, struck with a nightstick, and fired upon repeatedly with pepper pellets before being charged in jail. On Saturday, July 25th, I was once again fired upon with pepper pellets and arrested for non-violently demonstrating. At this time, I would like to remind the council that this nation was founded on protest and revolt. The Boston Tea Party was an intentionally destructive act of resistance in which the Americans destroyed the Crown's property in order to make a point. Unlike those involved in that protest, I have not once demonstrated in a destructive fashion. I'll ask you to consider that the police force this budget is allocating more funding to beat and arrested me most recently for leaning towards the potential of becoming violent. Not being violent, leaning towards the potential. Contrary to the blatant lie originally given by Omaha Police Department and then parroted by local media outlets claiming that a single pellet was fired, I was hit with 6 pellets before being tackled to the ground by multiple officers and being charged with 4 different things totaling more than $15,000 in bond. In closing, I want you to think about the fact that not all violence is instantaneous. Time is a factor that must be granted consideration. Violence is not always instantaneous as the swinging of a club, a fist, or the firing of an unlicensed firearm. It is an act of violence each time you, as a human being in a position of power, fund police force that disproportionately charges, surveils, and kills black and indigenous people. Instead of financially supporting and lets rich white murderers walk free while simultaneously charging young black teenagers for holding Black Lives Matter signs. It is an act of violence every single time you have the opportunity to oppose Stothart's complicit racist violence in the form of budgetary increase in spending on police, and you choose not to do so. Stop perpetrating acts of violence against your own citizens, and understand that should you still choose to allow this budget to pass, you will continue to meet heavy resistance.
Thank you. Your time's expired. Manuel Cook, followed by Mary Elizabeth Lawson, followed by Maritza Nadine Estrada.
Hey, Manuel Cook, 5607 North 37th Street. The police don't prevent crime, they only respond to it. The police respond to the symptoms of our community's problems. They do nothing to deal with the root causes.
We can start his time over. We need your address too.
I did. 5607 North 37th
Okay.
Street.
We'll start your time all over.
Fair enough.
Sorry for interrupting.
Like I was saying, the police respond to the symptoms of our community's problems. They do not deal with the root causes of our problems. Yet, our city has become addicted to giving the police inappropriate authority over issues which they are not capable of solving. Things like homelessness, mental health, drug abuse, and poor traffic design. In fact, the reckless use of police in these areas not only exacerbates existing problems, but creates new problems. Moreover, the police have functioned as a racist organization across the country and in this city. The police union and the police union president had a white supremacist rally in broad daylight just a few weeks ago. So the least you could do is redirect funds towards addressing the city's social disparities. So by adjusting the police budget to reflect the 2013 budget and adjusting for inflation, the city would save $26 million annually, which it could reallocate towards things like housing and public health to begin addressing the root causes of our problems. Thank you.
Thank you. Mary Elizabeth Lawson, Maritza Nadine Estrada, you're on deck, and Brenton Gomez will be third.
Hi, I'm Mary Elizabeth Lawson. I live at 3306 Cass Street. Over the weekend, while sitting in a virtual training on race and equity for work, I heard the words, "Wealth and poverty are not made in one generation." Sitting with this led me to think about how I've seen the roles of poverty and wealth show up in my community, and how both are intimately connected to the quality of life for Black and Brown people globally. We are the utmost culturally influential. We laid the bricks, we picked the cotton, we cook the food and care for your children. We wear the jerseys and play the sport. We sing the songs that touch your soul. Yet, we are still the most vulnerable communities to the many levels of cyclical, systematic harm, brutality, and violence. A system that is built for and supported by a white supremacist agenda and delusion. The synthesis of these oppressions creates the conditions of our lives. The history of American racism is embedded in the reality that we call life. The continued violence on Black and Brown lives can be drawn directly to how this country began. Still, at every historical crux that we are given an opportunity to change and reconcile, those in positions of power remain silent, complacent, and abusive. How do we shed light on the pervasiveness that is structural and environmental racism in our very city, Omaha? How do we collectively take a step forward rather than 10 steps back in making and preparing for a future that empowers Black and Brown people? This work requires us to think thoroughly, thoughtfully, intentionally about the ways in which we engage with one another. We must do this work with great care and detail. This is generations upon generations worth of anti-racism work that needs to be done. It is each one of our responsibilities to commit. The future that should be promised is one of change, one of our own making. What that looks like immediately is a redistribution of wealth, and specifically a reallocating of funding from our police department to efforts that support the people in our communities. I'm going to end with a quote by Toni Morrison, and just to be clear, I am an opponent of the proposed city budget made by Jean Stothert. And I quote by Black feminist revolutionary, our ancestor, Toni Morrison, the very serious function of racism is distraction. It keeps you from doing your work. It keeps you from explaining over and over again your reason for being. Somebody says you have to know language and you spend 20 years proving that you do. Somebody says your head isn't shaped properly, so you have scientists working on that fact that it is.
Thank you for your testimony. Your time's
Thank you.
expired, but your entire written remarks may be made
Yeah.
a part of the record. Maritza Nadine Estrada, followed by Brenton Gomez and Alexander Elliott.
I have copies, by the way. Maritza Nadine Estrada, 304 North 38th Street, 68131. Language as a spoken or written communication of an un or grammatical syntactical structure of a particular country, people, verbiage, estilo, manner. In whose language am I to speak to? Allow for this moment to be a reflective request to redirect police funds towards educational resources, housing, parks, libraries, and investment to our community, not to be in terror or police weapons, sirens, incarcerations. It is my highest duty today as a professor and student of language to advocate for those who have yet to name their language worth naming, who have yet to encounter how our segregated, gentrified city is either benefiting or erasing them. Was it ever a choice? Who have yet to have the proper educational resources to be in elevation from life circumstances. It is a goal of ours to live a life of autonomy, possibility, in no way prioritizing funding towards police. Above all, benefits no one but those who seek to remain empowered by name, race, title. In whose language am I to speak to? Do you hear me? It matters how we address the language of the people of Omaha, which is in fact changing, shaping this space right now. Moving forward, Black, Indigenous, people of color, trans, queer, youth groups are experiencing and witnessing these acts of violence on our communities. Bodies and language, we are so desiring to be met right now in this space right now. A life of wonder, I remain pensive where we may be in the next year or 5, amidst also under pandemic. How will those in power answer themselves the question, who have I harmed in this life with these hands? How are my actions harming or benefiting the people of Omaha? Let these words be a moment of reckoning with silence, with light, with grievances to what we have endured these past few months, weeks, and undeniably our entire lives. Please reconsider redirecting the funds to the most vulnerable communities. Now, do not run, do not run. I see you, I see you. As a city, make amends in meeting us with a resolution worth naming. Thank you.
Thank you. Brenton Gomez, followed by Alexander Elliott, and then Kelsey Lehman or Lyman. I'm sorry if I mispronounced your name, Kelsey.
Hello, my name is Brenton Gomez. I live at 619 South 37th Street, apartment 406, 68105. I'm not here to create greater division between the people and institutions which govern and police the people. I'm here to help heal the divisions that have existed between the people and these institutions for far too long. I'm here to help with the systemic changes that can allow words like accountability, transparency, and communication to feel tangible and just. The following are options where funding can be taken from the Omaha Police Department to assist our community's wants and needs. Earlier, Paul, I can't remember his last name, he mentioned the COOTS program in Eugene in Springfield, Oregon. I'm not gonna touch on a lot of it because you have the language. The COOTS program assists as a crisis response team, embodies de-escalation training, crisis training, knowledge of local resources, and how to apply them. The COOTS program in Eugene and Springfield, Oregon takes over 20% of the police calls, estimated to save the police department over $15 million a year. The CAHOOTS program annual budget is $2.1 million. That's crazy. To give you context to Eugene and Springfield's Oregon's police department's budget, Eugene's is 70 million, Springfield's is 20 million. We have plenty of organizations within our community that could assist with this already. The infrastructure just needs to be put in place to materialize such programs. Potential organizations in Omaha could help facilitate this are Emmanuel Mental Health Services, Lutheran Family Services, and that's just to name a couple. The time to be innovative is now. Money saved for the program like Cahoots could go to my next idea. This is the creation of the BIPOC Protection Advisory Board created within the city's boards and commissions built logistically with the same parameters of any other board or council. This would be a formal board made up of BIPOC community leaders from all over Omaha. It would also embody city officials, potentially city council members, the police department, chief and captain or detective. 3 components would meet formally to communicate monthly. Unlike the Human Rights and Relations Board and the Citizen Complaint Board, this formal advisory board could be the unit that holds integrity to words like accountability, transparency, and communication. All right, again, this is not about creating or solidifying polarities or Republicans or Democrats or even about economic growth. It's about economic development and human capital that comes from investing in our communities socially and economically. Thank you for your time.
Thank you. Alexander Elliott, followed by Kelsey Lyman, and then Cassandra Kernick.
Thank you for your time. Allow me to speak. My name is Alexander Wayne Elliott. I live at 8616 Pratt Street, Omaha, Nebraska. Been a resident of Omaha, for 31 years of my life. An outspoken activist for about 10 or 12. My first experience with racism was actually at Holy Name Catholic School in the cafeteria lunch line. Since then, I was very aware how I'd be treated, by my skin color or my race. Fast forward to experiencing racism in the judicial system, where I've been wrongfully accused, was told I matched a description, followed and harassed. This is an unfortunately familiar conversation for young black men, young brown people, people of color as well. My positive experiences have been with law enforcement have been sparse. I ask, what is so threatening about me? Why are we still hearing about police brutality and violence against people who look like me at an alarmingly higher rate? Because of my experience and my love for my community, Omaha, and the diverse folks that inhabit this city, all of you, I find a necessity to ensure the growth and well-being for everyone. In the last 6 months, the city witnessed and experienced a known white supremacist with some others, crazy background as well, shoot and kill an unarmed black man with an illegally concealed firearm, only to be allowed to escape prosecution by our own elected officials. We have seen hundreds of Omaha citizens tear gas, flashbang, and shot with pepper balls. Looking at 120 peaceful protesters, some of them are here tonight, arrested and detained, and I ask, does this look like growth? Does this look like community to you? Does this look like well-being? When you have thousands of concerned citizens emailing you, the city council members, in an effort to make them aware, act, or at least discuss these crucial and critical systemic and societal issues that are impacting our everyday lives, only to be met with anger, treated as its annoyance on the news. We saw some people do that. Please for it to stop, instead of addressing issues swiftly, head on, in other words, the job that y'all willingly chose. How will you be remembered? How do you want to be remembered? Can you say you did everything in your power to make your community better? Can you say you did everything to give every single individual in this city fair treatment, equal treatment, justice, and a better life? Right now is a pivotal moment in all of our lives. We have an amazing opportunity to turn the city into a beacon, a symbol of equality and justice for all. One thing we can do is invest in community infrastructure and incorporate compassion and empathy. What we've seen and experienced from law enforcement has been violent, tone-deaf, racist, and cruel. I'm asking that we as a city come together and ask ourselves, how can we enrich other aspects of our communities rather than continuously overfund and militarize our police? I'm requesting that the city reallocates funds from the 37.9% of the Omaha Police Department receives from Omaha General's budget fund to community infrastructure like social work, mental health, parks, human rights, public works, homelessness, and the arts. And I'm going to end, I believe it takes a village to raise a child. As a father, community member, I want our children's futures to be bright.
Thank you.
Thank you for your time.
Kelsey Lyman, Cassandra Kernick, and then David Dirk.
That's 3 times you got my name wrong. I'm not voting for you. No, I'm sorry.
Well,
My name
let's
is.
hear how to say it right.
So that'll be Kelsey Lehman.
Thank you, Kelsey.
Yes,
and your address?
sir. And I live at 1313 South 32nd Street in Omaha. I want to start by saying that I appreciate we're coming in on the tail end of something that's been in the works. So I appreciate you guys taking the time to hear from all of us. So I want to be clear that I personally am the rules followiest, least budget interested individual you're gonna meet. So I hope that you believe me when I say that I appreciate the need for laws and for order and for there to be someone responsible in place for when those things break down. I know that policing is not an easy job. I know that people can be awful. So, please know that I'm not saying any of this lightly. That said, these past months I've been shocked to see police officers in our city, pepper spray a crowd of people holding a vigil, shoot baton rounds at point blank range on sitting protesters. Like, shocked. On a street they'd already blocked off, and there's a million ways to avoid that intersection. That seems crazy. We saw them arrest an entire protest, which, it didn't have a parade permit, but it was pretty peaceful, and they justified the amount of force they used with at least one man shouted at them and one made rude gestures. And while that has to be really hard to sit through, I don't know about you, but I had grade school bullies who did worse on a daily basis, and dealing with that was just a part of being 12. And our police officers are adults. They're adults that we pay to be the most responsible adults, who we trust to carry guns and sometimes use them. So what galls me about the city response to these protests is that however unpleasant it is to be yelled at or have water bottles tossed at you or see graffiti, none of that is really that dangerous. The police then made it dangerous. From where I was sitting, they had a crowd of young people who have gone through so much. It's such an unsure time. And instead of doing the hard job of being, the bigger men, metaphorically, they're generally bigger, but because they took the opportunity to let off their own steam on unarmed young people. And I don't count water bottles as weapons, riot gear, no. So I'm not an expert, but when someone behaves unprofessionally at their job, you don't generally give them more funding to be irresponsible with. And that's my bottom line on this. Now, some of the folks behind me have done and are doing really great research on how we might move some of that near half of this budget toward the 0.3% that goes to human rights and relations, And I do implore you to work with them and consider funding some of those ideas. Thanks so much.
Thank you. Cassandra Kernick, David Dirk, and then Dave Sund.
My name is Cassandra Kernick. I live at 4020 Cass Street in Omaha. On the first night of protests in response to the murder of George Floyd by Minneapolis police, I had my first-hand encounter with police violence and brutality. It was certainly unexpected to me. I came with my sign wearing sandals. I realized as violence was started by the police, who arrived in riot gear and made no effort to tell peaceful protesters to disperse, that this was surprising to me because of my privilege. Police brutality is a daily lived experience for many in Omaha. Standing there gasping for air as we were tear-gassed and brutalized for exercising our First Amendment rights, my naivety and surprise started to fade away. This is what OPD does every day to Black, Brown, and Indigenous individuals and in low-income areas. Many of us and many of you are afforded the privilege of looking away based on our zip codes and skin color. After protests against police brutality were met with more police brutality and violence, the mayor has decided they deserve a raise to $162 million. But we, the people, and the data show that police do not reduce crime. Affordable housing and education, full bellies, livable wages, mental health care, and youth services prevent crime. And our mayor has decided that a mere fraction of what police get is enough for all of these categories. Over the 36 days, protesters lawfully called for justice for James Scurlock outside of Don Klein's gated community, I got to see repeatedly how OPD does not use our tax dollars well, as they serve property and not people. As the police sat inside the gate, it became crystal clear what OPD protects and serves. Thank God the gang unit was there the time some of us unknowingly started to sidewalk chalk on a private street, just in case our sidewalk chalk leaned toward the potential of getting violent. Did OPD do anything about the threats we received while standing there? Did they do anything about the cars that swerved and pretended to hit us, or the driver who even threw a full beer can at our heads? No, but they certainly let us know that our use of a blowhorn violated a city ordinance. If you are white and well off in Omaha, then you probably think that the system is working perfectly. If you care more about property than human life, then this budget is for you. But if you could step back for a moment and hear from me and those who have newly endured the horrors of OPD, or more importantly, those here who experience that every day because of their skin color, then you would know that they absolutely do not need more funding. I am here today begging you to listen to the people and support policies and budgets that benefit all residents, not just those that are white and wealthy. A vote in favor of this current budget is a vote in favor of upholding systemic racism and oppression in Omaha. Black Lives Matter, and I stand in solidarity with the pro-Black protesters outside. Invest in communities, not police. Thank you.
Thank you. David Dirk, followed by Dave Sund, and then Eric Oberg. Didn't he speak?
My name is David Dick, 4303 Parker Street.
Okay.
I would like to say that as many city departments were forced to make sacrifices, the city of Omaha has shown that they're willing to spend resources towards tear gas, towards military equipment. The city has shown that it's not interested in services that help people, but in services that put boots on our necks. The Omaha police budget is bloated. It is bigger than all the other parts of the budget, minus the fire department combined. And the police escalated violence at protest and started violence at protest and think they deserve a raise. This is unacceptable. We need to divert money from the police towards public transit, towards libraries, towards parks, towards mental health services. Thank you.
Thank you. Dave Sund, followed by Eric Oberg.
Members of the City Council, Dave Sund, 515 South 31st Street. 10 years ago, I worked as a policy analyst for former Mayor Jim Suttle. As part of my duties, I was an advisor to the mayor on the city budget. I want to be clear that tonight I speak only for myself, not Mayor Suttle or any candidate or elected official. I hope that my testimony can add some historical perspective to your consideration of this budget, which I regard as a work of complete fiction. 10 years ago, Omaha passed a budget which saved the police pension fund from bankruptcy. Some of the very same people who today tell you we have to support police and increase their budget were on the other side of that argument a decade ago when the general fund budget was $112 million. Now it's $162. We spent a great deal of energy and political capital to save the pensions of people who now clearly believe they are above the law and above accountability and regard calls for even the most modest reform as unacceptable. The conduct of the Omaha Police Department and the Omaha Police Union over the last 3 months in response to these protests has been appalling and indefensible. And if the police don't take the opportunity to change now, they will be forced to later. You work for the people of Omaha, don't forget it. The revenue assumptions underlying this budget are not based in reality. Projected 2021 sales tax revenue is 17.5% above projected 2020 revenue. The restaurant tax, which Mayor Stothert campaigned on repealing, is 24% above projected 2020 revenue. Every week we hear of an Omaha restaurant that's closing its doors permanently due to the pandemic. Even Mayor Stothert admits that without federal funding by the end of 2020, Omaha will have to make drastic cuts in city services. But what this budget proposes is it won't. Everything's going to be back to normal. It's a lie, and it's an easy lie to tell because you'll all believe it. It's an easy choice to make. And you can ignore me, but do not ignore the people calling for justice and accountability right now, because I promise you, in May, they'll vote you all out.
Eric Oberg, followed by Brendan Leahy.
Eric Oberg, 6319 North 36th Avenue here in Omaha. I'm a public servant at the Omaha Public Library. At OPL and indeed countless libraries around the country, we were given budgets that implicitly ask us to do more with less. We, like others who work in the fields of public education information, are uniquely adaptive and resourceful, so we don't mind a good challenge, even though it is often because we have little other choice, because we know public city budgets are often legitimately tight across all departments. In Omaha, however, it seems especially tight at the library and other unarmed departments. Even before the pandemic, we have been consistently understaffed with numerous positions needing filled, but denied the ability to fill them because the city keeps telling us we don't have the money. Now the libraries are closed to the public while many other places are opening. Naturally, the pandemic is cited with good reason for keeping the buildings closed, but what's not being mentioned as much is the other reason. The city finance director has stripped all part-time employees, not just from the library, of their hours with no return date, leaving most of us without our primary income, or some, like my wife, without any income at all, and the library further understaffed. He has a $160,000 salary, by the way, untouched by the austerity he's imposed on the rest of us. We've been bootstrapping it the last several months because the city supposedly has no money, while OPD has been doling out overtime and clamoring for ever-increased budgets for militarization equipment to be turned on us, the people of Omaha, all while we have no money. Did OPD not get the memo? If you want to back the blue, you might want to start by reducing their burden and funding the other departments and services that uplift our communities and provide positive alternative activities. The police recently threatened the city with reduced services if they don't get their way and we don't give them the proper monetary respect to which they feel entitled. If we have this kind of money, all underfunded departments should be getting a meaningful increase. If we can't afford such increases in other departments, then we can't afford it for the police either, so which is it? In addition to being a library professional, I'm also an Army combat veteran, so I know people in uniform are just as capable of doing more with less. But right now, my medical retirement pension is what's keeping me afloat, and most people don't have it, and they shouldn't need that to get by. I did not deploy to Afghanistan on the condition of anyone's thanks or support. I simply did my job, budget increase or not. Thank you.
Thank you. Brendan Leahy, followed by Neil Duffy, and then Annie Schenzel.
Hello, Brendan Leahy, 702 South 38th Street, Apartment 8. I'm here to express my frustration with the proposed city budget, frustration I've heard shared by working class mothers, public servants, small business owners, artists, musicians, students, and just about every other demographic across lines of race and gender, the very people who make Omaha a community worth living in. When somebody does something wrong, you do not reward them, as that only enforces negative behavior. Fortunately, the decision 2 weeks ago to give additional equipment to OPD following their immediate brutalization of peaceful protesters was exactly that. It sent a message that the Omaha Police Department can use any methods they choose to bludgeon those they disagree with, that they can tackle journalists and detain legal observers, keeping them on the bridge for hours, that they can make up any charges that they wish in order to silence discontent, and that some people in this body are more interested in gaslighting the victims of police violence and white supremacy than addressing the direct harm done to their constituents. Approving this budget would further drive that message home and exacerbate the very conditions that got us here in the first place. I'm having a hard time imagining what sort of appeals to empathy, ethics, science, or religion, Jesus was murdered by the state, could possibly motivate any of you to take the bold but necessary step of rejecting this budget. I am also not sure which avenue we could possibly turn to for justice, especially racial justice, or compassion should this body fail in its duty to meet the needs of the people of Omaha. Empathy should have come into play 2 weeks ago when multiple people spoke here who had visible wounds, and I watched, visible wounds from police violence. Empathy should have come to play even earlier when young people in Omaha showed their displeasure at white supremacy and police violence, only to be tear gassed and pepperballed, and that was before any property damage occurred. Given that it was a traumatic event, it probably is what caused that property damage to occur to begin with. Multiple scientific studies make it clear that reducing crime is best done by reducing policing while investing in communities. Rehabilitation and restorative justice lead to better outcomes than punitive and carceral justice. Increased access to art, education, and culture tends to reduce crime while increasing happiness, educational, and health outcomes. Where can we turn if you're not going to help us? The mayor and the governor do not show any concern for our health and well-being because they are choosing short-term profits over it. These are short-term profits because a 3-week lockdown, rent forgiveness, and consumer stimulus would be better for the economy. It's not worth it to have people eating inside restaurants. And we can't trust local media because their job is to hold y'all accountable, and they repeated police lies, even though, and I know you've seen the physical evidence that more than one pepper ball was shot. So where are we supposed to turn? Every single dollar going to the police would be better spent either directly investing in the citizens of Omaha, or our art, our education, our libraries, our healthcare, or our public green spaces. I beg you, I implore you to please have the courage to fight for your constituents and not against them. Thank you.
Thank you. Neil Duffy, followed by Annie Schenzel.
Neil Duffy, 5870 Bancroft Street, District 3. Thank you, Mr. Jerem, for your service. Sorry to hear you're not running. Appreciate your service to our community. This process is tiring and unacceptable. I commend and appreciate you guys for this task at hand. You've been here all day, and I understand you're having to vote on this tomorrow at 1 p.m. This is ridiculous. Hopefully it's informative and helpful to let you know what we really need for this community. Omaha could be so much better than this, so much more efficient, so much more sustainable, and more welcoming. Instead, we like to put Band-Aids over our problems. We fill holes in our roads with asphalt, and when we do it again next year, and we do it again after that, and then we do it again and again. Our public school system is failing our future leaders. Our healthcare systems are in desperate need of help. Our elected officials care more about facing a lawsuit than the health concerns in this very community. Our libraries are the first to face steep budget cuts at a time when fostering a child's love for reading is more important than ever. Our police department has an unfavorable reputation with many in this community. Continuing to increase its funding when we desperately need to transfer the funds to other resources is embarrassing. The evidence is well documented. When communities and cities start moving funding towards social programs, education, and healthcare, crime decreases. Since 2005, our police force has grown by almost 88%. Our city has grown by 8%. Omaha provides an astronomical amount of money to the police force in comparison to other major cities. I want Omaha to be known as a progressive city, a compassionate city, a city on the right side of history. How great would it be if Nebraska were on the forefront of discovering new technologies for improving the dilapidated road systems we have now? How great would it be if Omaha were the leading cities helping its homeless population? How great would it be if our teachers and educators were encouraged to create new and current curriculums to serve our future leaders? Instead, we have an elected leader who wants to increase the police fund. Instead, we have an elected leader who wants to revive Crossroads Mall. Instead, we have an elected leader who finds time to comment on social media, quote, "A troll that hides behind symbols and doesn't list their last name is a coward." No. A coward is someone afraid to understand and learn different cultures. A coward is someone afraid to understand different walks of life and different points of view. A coward is someone who does not apologize for their wrongful actions. We paid an out-of-state firm $500,000 to come up with Nebraska Nice, or Nebraska, honestly, it's not for everyone. Do you know how many individuals in this city?
Hold on, Mr. I'll give you more time. I have to remind everyone of the rules of decorum of the council. There's no applause and outbursts and things, or you'll be escorted from the chamber because you're detracting from the speaker's time. So please add 1 minute to his time.
I'm almost done. Thank you. Again, we paid $500,000 to an out-of-state firm to come up with that slogan. Do you know how many individuals in this city could have done a better job and would have loved to? How about we remember our state motto first? Equality before the law. Thank you for your time.
Thank you. Annie Schenzel. There's no applause either. Thank you. Followed by Shira Sterling, and then Nathaniel Rulo. Welcome.
Hi, I'm Annie Schenzel, and my address is 629 North 47th Street. Okay, as an elected official, I imagine many of you find yourselves daydreaming about all the people in the city you serve getting along, respecting one another, looking after their neighbor, acknowledging the good work each other does, and pushing each other to do better. Right? Like we probably all have these daydreams. As an educator, I too dream of and strive for these things when it comes to the students I serve in my classroom. When I look at a few select pages of the 475-page recommended budget, I notice the players at stake here: libraries, parks, human rights and relations, the fire department, etc. Through my experience at peaceful protests, having relationships with folks who have been brutalized by the law enforcement, especially Black and brown folks, disabled folks, LGBTQIA2S+ folks, disproportionately, and as a resident of the United States, I can see that the slice of the pie designated to the police force needs to be addressed. As a person who also chose a job that is in service of other people, I feel we can all agree that when anyone in our community or classroom is telling us they are hurting, we are failing at our job. If we not only ignore that hurt, but enable the harm that is imparted on those persons. The Omaha Police Force is not serving and protecting its residents. They are undoubtedly doing the opposite. And I would like to also say that there was an individual earlier who spoke, and they had worked for OPD, and they said that they argued that if you don't put money there, then you're not gonna have quality officers, right? Well, I can say that there's like no money, very little money for education. There's obviously money for it, but very little. And the teachers with master's degrees and who are going above and beyond to be better educators continues to happen because they care about their job and they want to serve people. So I totally disagree with that argument, respectfully. This is why I have come here to ask you to put the 2021 funds towards the departments to actually promote the quality of life for our residents that our residents deserve. Putting the money where the desired outcomes are, i.e. health, support systems, empathy, and equity in our communities, will pay off and probably result in us all sleeping better at night, knowing that we are not complicit in the abuse of our community members. Thank you.
Thank you. Is it Shira Sterling? Shira.
Very close. Thank you. All right. My name is Shira Sterling. My address is 8218 Seward Street, but I would like to note that that is my mom's address where I receive my mail. I actually live in Benson, and both of the addresses that I provided, 6782 Binney Street, are in Pete Festerson's district. Does everybody on the city council know what redlining is? Could I see a nod?
Council doesn't entertain questions during these forums.
Noted, thank you. The Article 8 of the Civil Rights Act defines redlining for us. It's the practice of denying a creditworthy applicant a loan for housing in a specific neighborhood, even though the applicant may otherwise be eligible for the loan. That is why North Omaha is predominantly Black citizens and why South Omaha is predominantly Hispanic citizens. It is a system of racial segregation. We are all experiencing this worldwide pandemic. I personally was without employment or income for 6 weeks. The lower and middle class people of Omaha need financial support to survive this disease. Omaha is an incredibly segregated city, and we need to invest in the communities that we have intentionally neglected. I'm saying this in solidarity with all the Black Lives Matter protesters. Now is not the time to have a militarized police presence in our city. The Omaha Police Department has waged war on our impoverished communities and has now declared war on civil rights protesters. Tear gas is a weapon of war. Mass incarceration is a weapon of war. Unchecked brutality is a weapon of war. Fighting a war is expensive. We're already fighting a pandemic. We do not need to fight against these civil rights protesters. We all pay taxes, and those taxes are being used to silence people who are exercising their First Amendment rights, and our taxes are being used to improve white neighborhoods specifically. Why aren't the new bus stations being built in North or South Omaha neighborhoods? Those communities rely on public transportation. This is just one example of city funds being used for white benefit. We do not need new police vehicles. We need community resources. We do not need a mobile command center. We need affordable housing. We do not need to buy tear gas, a weapon that is so unethical, that is not allowed in warfare. Geneva Convention, 1925. We need equality-minded city planning to undesign the red line. We need snowplows. We need funding for homeless shelters. We need funding for libraries and parks. We need more of the budget to go to the Human Rights and Relations Department. We need to de-escalate tensions by humanizing one another instead of criminalizing one another. Our mayor calls homeless people vagrants, and it's easy to use that word because homeless people just makes you feel so sad. This is the language of dehumanization. It is easier and less expensive to dehumanize and criminalize a person instead of helping them.
Your time's expired, but your entire written remarks may be made a part of the record.
Thank you.
Nathaniel Rulo, followed by Crystal Zamora. And Meredith Starr after that.
Nathaniel Rulo, 3935 Arbor Street, Omaha, Nebraska, 68105. This is the longest amount of time I've spent in another building that isn't my home in almost 6 months. That is how important adjusting this budget is to me, because Omaha already spends too much money on the police force. This budget clearly is wrong, damaging, and far off course from the direction our city needs to be heading to make it a better place for all who reside here. So I had to show up and make my voice heard. The OPD doesn't need more money for its arsenal. The chunk of the 2021 budget for police could do so much more to prevent crime, save lives, and strengthen our community if it were actually spread out to the people of Omaha who need it. Omaha needs money for human rights and relations, money for affordable housing, money for youth programs and community centers, money for libraries, money for the unemployed, the unhoused, the hungry. That money could be better spent anywhere than in the pockets of the OPD, an institution whose recent actions show it is built on hate, holding residents for hours in unsafe jail conditions after their bail was paid. It commits and condones unchecked violence, killing Zachary Bearheels. And it disregards the Constitution, arresting journalists, legal observers, and peaceful protesters trapped on the bridge in Midtown. One argument for the 2021 police budget increase is that the police will get more body cams, and I am not convinced that the funds for more body cams don't already exist. And I know that the OPD is comfortable committing abuses on camera. I've seen footage of OPD committing a war crime by attacking Omaha residents with tear gas at Dodge and 72nd Street. I've seen footage of peaceful protesters trapped and violently assaulted by the OPD on July 25th. None of that footage came from body cams. And in both instances, I saw the officers' faces because although we are in a global pandemic, the OPD is above protecting and serving our community with life-saving masks. The police have not been held accountable for these and other actions. As members of the City Council, you can begin to make things right and adjust the 2021 budget. As you can see, the people...
Hello, my name is Crystal Zamora, 6021 Oak Street, Omaha, Nebraska, 68106. Good evening, City Council members, specifically President Jerem, as you are my representative. I am speaking as an opponent to this budget. I have personally experienced police officers dispatched in unnecessary and higher numbers than needed in this city. As an Hispanic and Indigenous woman, I feel personally targeted more than protected by police officers. I have many stories that personally portray this, but I will present facts instead. The city continues to train and deploy officers to a disproportionate amount of arrests and searches of black and brown members of our community in increased numbers and with increased levels of aggression. 66% of this city, according to the census, is white, while they only account for 12% of the total traffic stops. 12% of this city is black, with 27% of total traffic stops being of black people. Of the 15,000 cars searched this past year by police in this city, almost 50% of those searches, about 7,000, were of black people's cars, while again being only 12% of the population. The numbers do not lie. There is a higher level of intensity, anxiety, distrust, and alert when Omaha officers are interacting with black and brown members of this community. I understand that while many white people may feel protected by the police, we need to listen to those of this community that do not feel that way. I implore you to hear the brown and indigenous and people of color's voices that the current trajectory of this police department that we are on is not effective. I would like for as much of the budget that is possible that is allocated to the police to be moved to human rights, public libraries, education, funding community programs and food to those in need, and to mental health education and awareness. Additionally, the Omaha budget projects an approximate 6% growth in 2021, which does not seem economically feasible in the aftermath of a pandemic. In discussion of Mayor Jean Stothart's response during the Black Lives Matter protests, the mayor chose to use police funds to request additional officers specifically to investigate the shutdown of a restaurant due to having a sandwich named after a Confederate general. During the protest, the mayor also, and Governor Ricketts for that matter, hired a private security firm in response to their white fragility. Their worry for their safety is another representative of how white people in power use others to keep themselves in white solidarity. And another increase to the police budget is another signal of that white solidarity, or wanting to protect that white solidarity. Thank you for your time. Please remove the additional funding to the police from this budget.
Thank you. Meredith Starr, followed by Tyler Swain, and then Aaron Porterfield.
Hello, my name is Meredith Starr. My address is 10668 Hamilton Plaza, number 602, Omaha. I'm an opponent to the budget proposal. The man who taught me about white privilege sits in this room, and I'm here to use it to support those who have been silenced. My suggestion, instead of increasing the budget for police, is to consider placing some of those funds on relieving the pressure that COVID has put on the schools of Omaha, specifically those who serve many families whose resources have been diminished in the crisis. The gap between those who have a lot and those who have always had a lot and those who have a little continues to widen right now. We need meals for students. We need a way for meals to get to their homes. We need childcare. We need mental health support for students and teachers who bend over backwards to support them and stay up worrying about them all night. After many donations from my family and friends and many purchases with my own money, I'm still in need of supplies for my students. I'm not here to bash my district. I'm here to ask for help. If my school had those funds, they would give them to me. That's the problem. We don't have what we need. I love my school. I love my students. I love my city. And I will keep fighting for what we need. Please consider moving some of the police funds to mental health and serving the needs of schools and families in need. Thank you.
Thank you. Tyler Swain, followed by Aaron Porterfield and Jacob Williams in the backup third.
Hello, my name is Tyler Swain, 2874 Newport Avenue, Omaha, Nebraska, 68112. I'm a proud resident of Miller Park, Minnelusa, District 2, under Councilman Ben Gray. I'm here today to express my concern with Mayor Stothart's proposed 2021 budget, and in particular what it and our past budgets say about the priorities of our city. Our city budget is a tool with which the government may be held accountable at the end of each budget cycle or political term. And I assure you, as the City Council, all of which who are up for re-election next year, we will be holding you accountable. The greatest expense to our city general fund is the Omaha Police Department. In this proposed budget, it makes up 36.7% of the general fund. We actually spend significantly more of our general fund on the police department than any of those other cities that were mentioned earlier today. Excluding Omaha Fire Department, OPD's proposed budget is roughly the same size as all other city services combined. It is proposed that we spend 5.2% on parks, 3.4% on libraries, 0.3% on human rights and relations. For those that don't know, human rights and relations includes things like workforce development, the housing authority, and emerging business programs, all services our city seriously lacks. If you examine OPD's budget from 2005 to this proposed budget, we see an overall increase of growth of over 100%. We must begin to hold them accountable. You tell us there is no money in the OPD budget that can be reallocated, and the OPA claims that any cuts in funding would have dramatic consequences. These threats seem idle and misguided at best, when in this 2021 budget, we see a significant reallocation of funds within the police department. The total increase for OPD in this budget is only 1.2%, yet examination of the OPD budget shows a nearly $18 million increase to the Office of the Police Chief, ballooning that budget from $3 million to over $21 million. What is that office responsible for? The police chief, who reports directly to the mayor, and we have seen how that has been abused these past 2 months. Internal affairs, which is a joke. And the public information office, which disseminates information to the news media and operates Crime Stoppers. How did this happen? By cutting $10 million from the Uniform Patrol. There's a $1 million cut to the Police Services Bureau, a $6 million cut from Criminal Investigations Bureau. What is this money for? Why are we proposing the Office of the Police Chief increase $18 million while the mayor, at her proposal, bragged about community programs sharing $20 million? The only transparency we get is that it's a personnel cost. And I have emailed Councilman Gray on this 3 times and have yet to receive a response on where this money is going. You cannot approve this. I asked the council to not approve this budget, at the very least to offer resolutions removing all additional funding increases from OPD, and to not increase the police spending from this point forward. Additionally, I want to see an overall decrease of 50% in the OPD budget over the next 5 years, and for this money to be reallocated to community services and programs, those that have been mentioned today, that actually keep us safe and prevent crime. I have faith that a good number of people...
Thank you. Your time has expired. But the rest of your remarks, if written, may be made a part of the record. Aaron Porterfield, followed by Jacob Williams, and then Willie Barney.
Hello. Aaron Porterfield, 5752 Ames Avenue. I serve as the Executive Director for Heartland Workforce Solutions. Thank you so much for your support and your commitment to workforce development in this metro area. Thank you, Councilman Jerem, for helping to start Heartland Workforce Solutions. You know, when we were thinking about the mayor's budget this round and what would be involved for seeing forward for workforce development, we didn't really estimate the effects of COVID. We had all of us, I think, in the community, a little different idea of how this would all play out. But what we know now is that it's here to stay for a while, and some of our techniques are going to need to change in order to help people. 39% of Nebraska's unemployment claimants are located in our metro area. That's a significant number. Those who are disproportionately affected are people with disabilities, people with other kinds of barriers, and most definitely are areas of higher poverty and higher unemployment. Disproportionate effect for people of color, people with dual language, people who are immigrants, etc. So what does this mean going forward? It means we need to change our ideas of how we match up people with opportunities. That means that our ways of connecting job seekers with potential opportunities have to change. It's not going to be pack people in a room for a job fair, is it? It's how do we get people who are unfamiliar with tech to use those for job interviews? How do we get businesses who are interested and actually urgently needing talent to connect with people that before they've depended on straightforward in a room? So this is what the money will be spent for going forward. It'll be for those techniques that are innovative, getting people connected with career. It's looking at the in-demand field with wages like this and more and quicker and quicker. We have a lot ahead of us to do, but I think that the American Job Center and the Collective Impact Network are there to help out and definitely meet the needs of people who need us to be there. So thank you for your support ongoing.
Thank you. Jacob Williams, followed by Willie Barney, then Linda Toomey.
Hello, my name is Jacob Williams. I live at 68116. I'll just give my zip code. I don't want to give
You
my
have
whole
to give your
address.
address.
Oh, I do?
Yeah.
2709 North 161st Street.
Thank you.
Cool. The Black Lives Matter movement we are witnessing across the country is in no way unprecedented. The movement to defund and eventually abolish the police has deep historical roots, just like the brutality we are witnessing in response to this movement. Black, Indigenous, and communities of color have been terrorized by the police since the formation of modern policing in America, formerly known as the Slave Patrol. Despite calls from many of their constituents to defund the police and the clear and present danger the OPD presents for Black, Indigenous, and communities of color, the mayor proposes that we should raise the police budget to $162 million. The mayor claims that we can fund communities and the police. Sure, but the budget for community services is 12.4% of that which is given to the police. I would like to propose that first we defund the police by 25% and move that money toward programs that tackle the roots of crime, rather than giving it to a state apparatus which criminalizes things like poverty and blackness. Secondly, we can talk about some common sense ways that we can defund the police. Police should not be the ones who respond to mental health crises. We should have trained professionals in mental health care available 24/7, because people with mental illnesses are 50 times more likely to be killed by police than those who don't. We do not need armed wannabe soldiers to enforce traffic tickets, as many traffic stops end in brutality or undue incarceration for Black, Indigenous, and people of color. We ought to demilitarize the police and ensure that they no longer commit war crimes against their communities like using tear gas. I implore you to vote against this grossly unjust budget and invest in your constituents. Invest in mental health and divest from violent, racist, untrustworthy organizations. Thank you.
Thank you. Willie Barney, followed by Linda Toomey, and then Doug Patterson.
Good evening, Willie Barney, 12333 Cummings Street, and also 2401 Lake Street. I want to first of all thank the council. I know you've had a long day. I appreciate the investments that you and the mayor have made. I've had the opportunity every year since 2009 to address the council. We put in front of this council back in 2009 some of the major needs that have been in this community, disparities when it comes to health, to unemployment, to entrepreneurship, and others. The city has made some investments. The city has invested in Heartland Workforce Solutions. You've invested in Step Up. Together, we have served 5,000 youth, connecting them with career exploration and jobs and internships. I've seen some strategic investments in streets and demolition. I think the list at one point was 800 homes that were on the demolition list, and it's down to about 150 or so. So there's been some work. What I want to stand before today, I really hope you hear the voices tonight. You have an opportunity. As I look at the budget and have studied every budget since 2008, it looks to me like a business as usual. It doesn't take into note that we just witnessed the loss of George Floyd that has had ripple effects across this country. I've been to just about every public hearing on the budget since that 2008-2009 period. To sit here for the last 2 hours and hear the outpouring of this community, that they want to see something different done. They want to see a sense of urgency. The work that we've all done together, that working together we saw a reduction in unemployment from 25% to 13%, almost cut it in half. We've seen before COVID, a 80% reduction in gun violence in North Omaha during the summer because we had jobs available, we had support services available. Heartland Workforce Solutions pays the programs that you have invested in. What I'm hearing from the community is there has to be a sense of urgency to accelerate the pace. It's not enough. I want to put a very specific proposal in front of you. I would like to see and recommend, based on a lot of research, that we match a 20% fund of what you spend in police, which would be $30 million, that you would put into a community investment fund to fund jobs, entrepreneurship, and housing. And if you can't do it in the first year, take a stair-step approach. Start at 5%, which would equate to $8 million in 2021. That is what the community is calling for. Put money, invest in the community, invest in the community, invest in the community. I'm hearing it over and over again. Take the first step, put $8 million in the community service fund, and invest in these programs that you know have proven that they work. That's really, I want to put that specific proposal. We look forward to working with this council and the mayor's office. We appreciate the support that you've given Heartland Workforce Solutions and some of the other programs in the community service program. And what you have done is proven that we can move the dial.
Thank you for your testimony.
Thank you for your time.
Linda Toomey, followed by Doug Patterson, and then Bree Full.
Hello, Linda Toomey, 1702 Nicholas Street. Good evening, everyone. I'm the executive director of the Sienna Francis House, and I actually am very optimistic after listening to the testimony by many people tonight advocating on the behalf of our homeless residents, those needing mental health services, and the unemployed. I'm here to support the proposed community services budget. The Sienna Francis House provides emergency, mental health, and housing services to individuals experiencing homelessness and those who have experienced homelessness. I appreciate the council and the mayor's allocation of funds to address these complex social issues. We know you have many needs and complex priorities in front of you, but doing this is critical in changing the lives of many of our residents. Cities who are effectively reducing homelessness are investing funds outside of state and federal dollars for this. Your leadership here is extremely important as the funds that you have allocated are making changes in the lives of individuals in our community. The Sienna Francis House serves 3,000 individuals annually. The support to our programs from this budget is very important to continuing those services. We provide those services 24 hours a day, 365 days of the year. Like many nonprofits, many who have testified here tonight, COVID has been particularly challenging for us. And I know it's challenging for you and the budget needs also. It is encouraging, and we very much support your efforts to keep the community service funding in place, as we need that as a critical point of keeping these services in place through the pandemic and after the pandemic. Many people have noted we don't know how long this is going to go on for, and this is extremely important to those critical emergency services. Emergency services are an issue of humanity. We need them. We need the basic shelter services. And I'm out of time. So thank you so much. Okay, sorry. Thank you so much for the community services allocation, and we would like to express our support of it.
Thank you. Doug Patterson, followed by Bree Full, and then Beth Doyle. Or Dogel, I'm sorry. Or Daigle.
Good evening. My name is Doug Patterson. I live at 2502 North 51st Avenue in Omaha, Nebraska. There's been a lot of talk recently about police and structural change necessary. I'd like to review that structure. Did you know that in 1781, when the Constitution was finally approved, people who could vote were white men who owned property, 6% of the population. That was structural. Enslavement was structural, making white men rich. When we get to the slave catchers, that was structural. It was the beginning of policing. By 1890, we're with Pinkertons, private police, and they eventually turned into strike breakers, stopping the union movement, making white men very rich. And here we are now. We have 3 white men owning more than the bottom half of the United States. This is the intrinsic structural problem that we face. Here in Omaha, we can see it. When you're shoveling that much money into a very, very small part of the population, you're going to leave a lot of people behind. And in the wake, 20, 30, 40% of people are going to be poor, like in North Omaha. And when that happens, there is frustration and rage and defiance and wanting to fight back by being an unallowed people. So you need a police force to tamp it down. That's what they're for. They may do arrests on vehicles. They may do visits. I've had some visits to my home, some very good police people. They were taking care of a domestic problem. The main task is to protect the property of rich white men. That's what it's for. I've been to North Omaha quite a bit. I spent a lot of time there. There are police there all the time. All the time. They're tamping it down. I go to West Omaha, I don't see police. I'm not sure police ever go there unless they're called. So all of this is a way of being able structurally to maintain white supremacy, and that's why there's no such thing as a good policeman. Because the job is oppressive. It's marginalizing. It's undemocratic and it's cruel. To tamp down the lives of the poor so that white privilege can reign. My sadness here is there's not much I don't think you can do about it. I don't expect much change in this budget. I expect everything to flow right through. But eventually there's going to be changes. And it's going to be titanic. And I'd like to be part of it. Thank you.
Thank you. Bree Full, followed by Beth Daigle, and then Morgan Freeman.
Hi, my name is Bree Full, Brifull, and my address is 9405 Birch Street. I'm a community organizer and I am standing in solidarity with the protesters outside because the proposed increase to the Omaha Police Department's budget is highly concerning. You may all think I'm going to talk about the recent civil unrest, but I want to touch on something that stems much deeper into Omaha's history with OPD. In the year 2000, Omaha's very own city council established the Public Safety Auditor's Office. In 2001, Tristan Bond was instated as the Public Safety Auditor and worked in that position until 2006 when she released a report called The Anatomy of Traffic Stops. In this 88-page report, Bond spoke extensively about her 4-year study into the way OPD manages their traffic stops. She outlined the obvious patterns of complaints from Omaha's primarily minority citizens about OPD's discriminatory conduct of traffic stops. She cited legally questionable conduct, inadequate policies and training, rudeness, and patterns of racial discrimination. It's difficult to summarize the entire report, but here are some highlights. An error in OPD's standard operating procedures, or SOPs, where it confused probable cause and reasonable articulable suspicion in the instances of traffic stops. This is important because police officers were using insufficient probable cause for initial contact of a traffic stop. This was discovered in Bond's first month on the job, and in discussions with the lieutenant, learned this error had been in the books for the last 20 years. Even though the error in the SOP was corrected, Bond explains that there was no additional training or discussion to explain why this distinction was so important, or to discuss what changes needed to be made to the department's traffic patrol practices. I believe, based on the hundreds of traffic stop complaints that I have received, that this practice of stopping vehicles too soon without sufficient probable cause continues today, particularly in the minority communities where this ratio of traffic stops is much greater. Bond also illustrated the conflict of SOP and officers' conduct in the field when it comes to handcuffing citizens for simple citations. The SOP on handcuffing and restraints exclude citizens who are merely detained for the issuance of a traffic citation. However, in practice, the department routinely handcuffs citizens based on their arrest for minor misdemeanors, even if they are cited and released. Far too much emphasis is placed on command and control style of policing. Officers are trained to control the situation no matter what. Less time is spent on learning the law that underpins police action, and even less on negotiating skills. Tristan Bond was fired 1 week after putting out this report. The current mayor, Mike Fahey, called this report a public tantrum. Another auditor was never hired. According to Omaha's current Code of Ordinances, Chapter 25, Police, Article 1, Section 25-9, there should still be funding allocated for a public safety auditor and 2 assistants. Reinstating another independent public safety auditor is our next avenue of advocacy, and we will not stop
Thank
until it
you.
is so. OPD should
Your
not be
time's
given this amount of
expired.
financial power when they cannot be held accountable. Thank you.
Beth Daigle, Morgan Freeman, Megan Joyce.
My name's Beth Daigle. My address is 8132 Miami Street, Omaha, Nebraska 68134. Thanks for today. I know it's been a very long day for all of you. I'll be brief. The police have a very difficult job and provide important services, but they aren't the answer to all our community problems or to all the ones that they're used for. Recently in Omaha, they have used tear gas against unarmed citizens and shot pepper balls at and arrested citizens for walking in the street. This isn't the right response. We spend an inordinate amount of our city budget on the police department. It continues to increase while crime doesn't. And while we criminalize citizens for minor nonviolent infractions or for being poor, this isn't the right response. School resource officers who were spoken about earlier today are notorious in education circles for getting kids expelled from school based on encounters with law enforcement that they have outside of school. It has nothing to do with school or their education or their actions at school. That isn't the right response. One speaker earlier said that if she has a problem at her home, she wants 2 police officers to show up. Whether or not it's fair, many citizens feel exactly the opposite. They would be terrified. They avoid police interaction at all costs because they don't feel that they can expect fair treatment. I'm asking that we reallocate parts of the police budget to other solutions that are geared to meeting the needs of the community. Many solutions have already been proposed in these comments and in the comments submitted by the public earlier today, so I won't spend time reiterating them. Cities all over the country are taking similar actions. We ask the police to wear too many hats. We should ask them to focus on fighting significant crimes. It wouldn't be reasonable to cut their budget and expect them to provide the same services. I'm suggesting we identify the services that can be better performed by other support networks and work towards reallocating the budget to do that. Thank you.
Thank you. Morgan Freeman, followed by Megan Joyce and Leah Batano. And Luis Jimenez after that.
Thank you.
Good evening. My name is Morgan Freeman of 42nd and Leavenworth. First, I must confess.
Morgan, you have to provide your address.
Okay. 827 South 42nd Street.
Thank you.
Though I'm sure the police already know that. First, I must confess that over the last few years, I have been gravely disappointed with the white moderate. I have almost reached the regrettable conclusion that the Black community's greatest stumbling block in the stride towards freedom is not the Proud Boys or the Ku Klux Klanners, but the white moderate who is more devoted to order than to justice, who prefers a negative peace, which is the absence of tension, to a positive peace, which is the presence of justice, who constantly say, I agree with you in the goal that you seek, but I can't agree with your methods of direct action, who paternalistically feels that he can set the timetable for another man's freedom, who lives by the myth of time, and who constantly advises the Black community to wait until a more convenient season. Shallow understanding from people of goodwill is more frustrating than absolute misunderstanding from people of ill will. Lukewarm acceptance is much more bewildering than outright rejection. Martin Luther King Jr. wrote these words in a letter after being brutally arrested and assaulted by police in a pursuit of a more equitable world. He was targeted by law enforcement and eventually assassinated by a white radical. Some of you were alive during that time, but here we are generations later in the midst of a pandemic and an economic crisis in the same cycle. Some of you grew up in the ashes from those moments, and all of you were alive during the Rodney King riots when our community had the opportunity to do better and did not. All of you were alive when Michael Brown was murdered. And every single one of you were in office when James Scurlock was murdered by white supremacists just blocks from here. All of you were in office when my fiance and I were brutally assaulted by police. We could not identify because they did not display their information, their names, or their badge numbers as they shot us, gassed us, threw flashbang canisters at us for exercising our First Amendment rights. I stand in complete agreement with my fellow advocate, Tyler Swain, and I'll finish his comments with his permission. I ask that the council not approve this budget, at the very least to offer resolutions removing all additional funding increases from OPD and to vow to not increase police spending from this point on. Additionally, I want to see an overall decrease of 50% of the OPD's budget over the next 5 years, and for this money to be reallocated to community services and programs that actually keep us safe and prevent crime. Right now, I want you to reallocate at least $2.5 million from the police budget to the Human Rights and Relations Committee to create a task force to begin the community conversations on participatory budgeting. This is only the beginning. If we don't get it, shut it down. Thank you.
Thank you. Megan Joyce, followed by Leah Batano, and then Luis Jimenez.
Hi, my name is Megan Joyce, and my address is 14142 Carlos Street. I am speaking today to ask my city council members to decrease funding to the police and reallocate it towards social services. I want to start by acknowledging that Omaha has a long history of redlining and segregation that has been used to intentionally deprive resources to Black and brown neighborhoods, to perpetuate institutional racism, and trap these people from marginalized communities in a cycle of poverty and violence. And as a result of this violent legacy, Black and brown people are continually denied jobs, education, healthcare, affordable housing, social services, and basic human rights. This has led to higher rates of poverty, crime, homelessness, and mental illness. And in response to these problems, Omaha has increased policing in these areas, continuing to criminalize and incarcerate the people that are most in need of institutional support and reparations. It's undeniable that racial disparities in education, healthcare, socioeconomic status, and incarceration are attributable to Omaha's racist history. To say otherwise would be racist in itself and simply untrue. The solution to this problem is not more policing, and it never was. The police are not here to serve and protect the people. They're here to trap marginalized people in a cycle of poverty and violence and to protect the power structures that have created these problems. $80 million, almost half of the budget, is an egregious amount of money for a police department that is unjust and abusive and is not being held accountable. These incarceration rates are leading to these problems getting worse and it being blamed on racist reasons. The solution instead is increasing funding to social services, homeless shelters, and education. The fact that there continues to be economic inequalities that are based on property taxes, where people live, other injustices, it just shows that this legacy of racism has continued today, and that in order to stop it, we need to decrease funding to the police and increase it to social services that will help uphold these communities. For some of us that are non-Black, non-Indigenous, and middle class, it's hard to let go of the idea that the police are necessary because we feel like they're just one phone call away if we need help. But for people that are from these neighborhoods, the police are not like some comforting presence. It's something that is constantly patrolling their communities, waiting to pull people over for nonviolent crimes, just for looking suspicious, and for doing literally nothing wrong. It's a constant threat that shows that our government continues not to trust Black and brown people and is continuing not to prioritize their voices. If you want to show that you are representing the people, then you need to vote to defund the police. Thank you.
Thank you. Leah Batano, Luis Jimenez, and Jennifer Carney.
Good evening. My name is Leah Pafano. I'm also a resident of the Minnelusa neighborhood. My address is 3015 Huntington Avenue, Omaha, Nebraska 68111. I will begin by pointing out that the lack of transparency from our representatives concerning how our money has been spent is disheartening. 38% of Omaha's general budget is being spent on the police force. While the budget details are available as public information, the numbers do not make sense to the average citizen. The explanation behind the disproportionate increase in funds allocated to the police are not actively discussed, and the concerns of the various demographics within the Omaha community are being neglected. Moreover, cities in the U.S. which are much larger than Omaha are spending much less. Take New York, for example, who spent only 7.7% of their budget on their police department. It does not make sense that we are investing so much more money on our police department in comparison to a considerably larger and population-dense city such as New York. Furthermore, we know that cities across the nation have defunded police departments. For example, New York City, as I've mentioned, defunded $1 billion of their budget and reinvested that money toward facilities aiding in mental health, homelessness, and education services. Los Angeles defunded $150 million out of their police department budget, reinvesting that money into their healthcare system, creating more jobs, and building more peace centers. Washington, D.C. reallocated $15 million of their police department funds toward alternative violence reduction programs. We use the previous point as a segue in mentioning that defunding the police does not mean that the younger generation aims to entirely do away with the police force and induce complete anarchy. Rather, we as fellow taxpayers are trying to convey that we wish to reinvest our money in programs that tackle the root of the problem that is actually fostering poverty and violence. This includes the improvement in the availability of resources for educational facilities and school districts, mental health services, rehab centers, violence reduction programs, and so forth. Programs such as these address the basic needs of the people as a whole while also providing the ongoing needed support for those who are underrepresented. Investing more funds into the Omaha Police Department is, at best, only a bandage temporarily covering the problem. However, it is more likely an excessive waste of money that will only result in more long-term consequences. The data shows that as crime rates have continuously decreased, the funds have, by contrast, increased exponentially by a gross proportionate. If the crime rates have gone down, why do we feel the need to continue to increase funding? Rather than follow the lead of the cities which have demonstrated progress in their strategies, we continue to move backwards. In 2021, the budget proposes an increase in police department funds from approximately $159 million to approximately $161 million. The explanations of this increase coming from our leaders have been scarce. Reinvesting the funds of the police department not only serve as a benefit to us, but as a benefit to our council representatives. By investing in a long-term strategy to improve community needs and outreach, this will inherently nurture peace within our community, which in turn will lessen the load on those who are serving in the police force.
Thank you. Your time has expired, but your entire written remarks may be made a part of the record, and if you don't have them with you tonight, you can always email them to the city clerk.
Thank you.
Luis Jimenez, Jennifer Carney, Terrell McKinney.
Luis Jimenez, 3306 Birch Street. Council members, lend me your ear. I come here as the civic director for Noise. We're a journalistic project based in North Omaha. It's something interesting that happened when the social unrest came into Omaha. Noise covering these events, we've got a following that translate into 1 year's worth. We got a following in like 3 weeks that would have taken us a whole year to accomplish. People are very concerned about social justice and injustice. Nobody denies that our neighbors need to be protected. That's not what people are arguing about, reallocating money, that the police don't have a role to play. However, the police creature is relatively new to society, and it's becoming more, it's feeling like there's the point of no return. And maybe it's here. Last year during North Omaha Community Festival, there was about 15 police officers lined up on 24th Street, and I had a parking issue with another resident And I told them about it, and they didn't say they couldn't do anything because they had to stand there and wait for a shooting, which occurred a few hours later down Grant Street. And after that shooting, 15 police officers, probably more, were standing there in front of the Fair Deal Market, detaining one person. 15 officers had only detained one person. That's what the money's doing right now. And the mayor said, we will continue to appropriately fund our police department to provide community policing, training, and emergency response services. Defunding the Omaha Police Department would be irresponsible and reckless, and I won't do it. Now more than ever, we need a well-funded, well-paid, well-trained, professional police department. Well, what I think would be irresponsible is that we keep treating the police as a community and not the department that it is. It's time to treat the police as a department. I mean, what else can we say to convince you? I'll just also end with this, that last year I asked you guys to fund firearm violence research. And what that would tell you is what's going on with guns that is making it lethal. Is it the caliber? Is it the size of the slug? Is it getting bigger over time? You know, James Squirrelot got shot in the collarbone.
Thank
If
you
it was
for
a
your
smaller slug,
testimony. Your
he could have
time's
survived maybe.
expired. Jennifer Carney, Terrell McKinney, Cecilia Saltana.
Hi, my name is Jennifer Carney, and I reside at 5813 Lafayette Ave. I'm here today to express my concerns over the proposed budget for 2021. I'm here to call for a reduction specifically in the police budget and reallocation of these funds to social programs that increase the quality of life in Omaha. A lot of what I wanted to say was already said. In consideration for your time, I am going to make some alterations to my speech. I think that the city relies too heavily on the 902 police officers. We ask them to help out with a whole range of miscellaneous responsibilities. I would like to see Omaha create separate response groups to problems rather than everything falling under the police's jurisdiction, which other people have spoken to as well tonight. I want to direct you specifically to page 266 of the budget. This is specifically the performance measures for the police department. Now, there is an increase in crime in 2021 that is expected, no more than 5% in any one category. If crime reduction is seriously a priority, we need to fund social programs. Taking care of everyone's basic needs has proven to reduce crime. I also want to point out the goal they've listed here for 2021 for forcible rape is to reduce it by 2%. That's 4 individuals. That's their goal. So if we want to start taking measures to reduce crime, how does law enforcement stop a rape? It doesn't. We've all heard that we need to invest at the root of the cause. I want, rather than investing to our police department, I want to invest in affordable housing, school resources, public education, food assistance, rent assistance, mental health assistance. I would also like to propose to have free mental health here for all of Omaha, but if we're prioritizing, let's give it to the children who are dealing with the stress of COVID and anyone suffering from mental health issues due to the result of police brutality. There's also a ride-along program, and from my understanding, a trained mental health professional is able to go on calls for mental health crises. I propose that we expand this so much into a separate response group for mental health crises. Trained, unarmed professionals are the best for the majority of these cases. Libraries. I noticed in the budget that the overall budget increased. Awesome. Several branches, 5 specifically, saw a budget reduction. I would like this funding to go back up. The Library Community Engagement Organization provides library materials to nursing homes, hospitals, senior citizens, and residents, but they've only been allotted $910. This was previously $6,500 roughly. You cannot get library materials for a whole community for $910. Public Works, major street resurfacing is down. Snow and ice control is being drastically cut.
For parks, there's more money going to the financial management activity than going to actual park planning and construction, so that seems like an oversight.
Thank
and they
you.
budgeted for 50 trees. Thank you.
Terrell McKinney, Cecilia Salpana, followed by Jamie Glassman, or Jaime Glassman.
How you doing, Council? My name's Terrell McKinney. I reside at 5319 North 30th Street. Like many, I come here today to speak against the current budget proposal from our mayor. I reside in the most over-policed area in our city, yet we continue to have complaints about crime. How is that possible if our city has invested millions into our police budget and so-called community programs? The fact is, you can invest billions into the police, and the societal ills that have haunted North Omaha will still persist. It is also true that if your community programs are failing to reach those most in need, then maybe you need to rethink your strategy. The city has no commitment to poverty, economic equity, mental health, and anti-racism initiatives. We currently have no community centers in North Omaha that are not a library or the YMCA that are free to our youth. Here's the solution. Build a community center or centers in North Omaha that are free to the public, geared towards engaging our youth, primarily the ones that the police like to arrest and harass every day. Like many, I have lost friends and family to violence and seen some things that those in West Omaha fantasize about while watching Netflix, but I'm not alone, which is why we need a commitment to mental health and trauma in my community. That's another solution. Also, Dundee looks much improved, Midtown looks much improved, Crossroads will be improved, downtown too. Still, North Omaha gets worse year after year. Here's a solution. Invest in economic equity to empower our small businesses and entrepreneurs so residents in North Omaha can live, work, and play instead of driving outside of our community to do those activities. We need initiatives that are led by the community, not predatory philanthropic foundations and developers. In my opinion, defunding the police simply means to reallocate city resources to those most in need and those that are disproportionately affected by the criminal justice system. Last two solutions I would suggest is to first push the mayor to empower the Citizens Review Board with full subpoena power to call in law enforcement when needed or hire another independent auditor. Also, open up the police contract negotiations to the public. Since Omaha is perfect, these solutions should only improve our city's perfection. 2020 has shown us all that anything is possible, so you guys need to get to work. In conclusion, America has never been great. It's always been oppressive and racist since it was established. Thank you. All power to the people.
Thank you. Cecilia Salpana, Jamie Glassman, Jason Husky.
Hello, my name is Cecilia Saldana. I live in 1312 South 32nd Street here in Omaha. So I am talking about today, or I want to share my experience when I was put under arrest for peacefully protesting on July 25th. I'm going to go on a specific incident that kind of makes my stomach turn. When I was arrested, I was put into a cell with 50 other females, and when I was getting my bags checked, they take you out and then you go check in with the officers. While I was there was a gentleman that was being carried by a gang of officers, where he looked like he was struggling to even walk, and then within seconds they slammed him on the ground, where they then repeatedly punched him in the head and continued to punch him as they were carrying him into the cell. Shortly then after that, I was then rushed by two officers that towered over me and then expected me to calm down after witnessing that. And then they said that I needed to eat in order to, because they thought I would pass out or have a seizure. But then I expressed how I was fasting for religious purposes, where then I was then strongly enforced to eat or be forced to eat. I don't think anyone should have to go through that to where they have to then where they have to give away just their freedom of religion and how they choose to practice it. I am here to speak because of the things that I've seen. There are no proper advocates for any of the inmates that are in there, and there are no proper advocates for the people. We defend the police and because they keep the wealthy wealthy, and they keep white people wealthy, and they want to go ahead and continue to put people of color, indigenous, and black people, they want to keep them under, sorry. I feel disgusted for the behavior I witnessed from the police and experienced. We need to reallocate the money because if the police department isn't going to do their jobs, we need to make a change because the police aren't for the people. They're for white people. They're for wealthy people. They are not for people that look like me or many of the other people that are minorities and not white, sorry. Thank you.
Thank you. Jaime Gassman, Jason Husky, Gabrielle Rima, or Gabrielle.
Jamie Gassman, 9615 South 171st, Omaha. Despite my appearance, I have never asked to see the manager, but here I am at the city council meeting because I am furious that this city would propose an increased police budget when very clearly the voice of the people is asking for the opposite. So I've come to add my voice. Like I said, I'm Dr. Jamie Gassman. I'm a military spouse, a full-time worker, a mother of two, and a homeowner. But I should not have to tell you any of that for my opinion to have weight. I would prefer to defer to the Black voices in the community, but hopefully my privilege helps this message be heard. The proposal to increase the police budget is just as offensive to me as it is to everyone outside on the streets protesting right now. And I hope I am wrong on this, but I'm willing to bet that some of you think the only people who want to defund the police are other people. People who don't look like you, people who live in neighborhoods where the police are the only social services, and people who have not had access to the social services your families and the families in my neighborhood pay for out of pocket. But it is your responsibility to not discount those voices. I'm here to remind you that you represent all of the people who disagree with an increase in police funding, including the Black and Indigenous and Brown voices outside. It's worth condensing all of that down to one sentence. You represent every vehement voice in this city demanding that you slash the police budget in order to reallocate those funds to social services and community programs. So let's take a breath and take a moment in this long day to be hopeful. This could be an incredible moment for Omaha. You can change the course of this city's history by halting this budget and asking for that reallocation of funds. Your actions can reduce crime immediately simply by spending that money in ways that care for the folks of Omaha. Please reallocate those tax dollars in ways that elevate this city, rather than in ways that continue a downward spiral of violence and poverty. Please make the choice your fellow taxpayers are asking you to make.
Thank you. Jason Husky, Gabrielle Rima after that, and then Catherine Nixon.
Hi, I am Jason Husky, 6910 Binney Street. So I am here today to voice my opposition for the increase of the police budget. I think we've heard a lot of compelling arguments today. You know, taking money away from the police budget and putting it somewhere else where they can prevent other issues. One thing that I did read in the budget that I feel personally about is that it is being considered to just stop doing recycling, which I disagree with because the environment is very important. So, if there's not money to fund the recycling programs or, to fix potholes that are still in the road now, even, from last winter, just take some of that from the police budget and, put it to better use. I'm a homeowner and I'm a military veteran, and I'm not happy with the way my tax money is being spent, especially when it comes to the fact that the police budget includes military style gear for them and tear gas, and being a veteran, I know that tear gas is banned internationally by the Geneva Convention. It's considered a war crime and a human rights violation, and I wholeheartedly disagree with my tax money being spent like that. And honestly, it's upsetting to me to the point where I am considering selling my home and moving to a different city or a different state because I disagree with how much and with the ways that the money is being spent to fund the police. So, you hear the phrase defund the police. It doesn't mean take away all the money. It doesn't mean no police. Obviously, we need police, right? But I think that, you can take, someone mentioned 50%. Maybe that's too much, but at least 25% sounds reasonable to me, and allocate that to different city services, different infrastructure programs, or maybe even have some kind of emergency cash fund because COVID's not going anywhere anytime soon. So yeah, less money for the police, more money for the other parts of the budget. That's pretty much what it comes down to. Thank you.
Thank you. Gabrielle? Followed by Catherine Nixon, and then Emma Garcia.
Good evening. My name is Gabrielle Rima. I reside at 2808 North 68th Street here in Omaha. The conversation today is overwhelmingly about police, a continuation of the discussion that's been occurring across this city and this nation for months now. As a member of the LGBTQ Advisory Board to the Omaha Mayor, a board on which I serve but do not represent, I was able to attend a meeting between this board and the mayor on the subject of policing. In said meeting, one of my fellow board members asked the mayor this simple question: where do you think violence comes from? The mayor's response was to tell us that she believed crime came from lack of education, lack of opportunity, poverty, and single-parent households. Imagine my surprise when her proposed city budget seemed to value police above these issues. Would this response not imply that it is her belief that the way we stop crime, the way we push forward as a city, is by investing in community care and education, not in police? This is not the only time the mayor has valued police over community. On July 31st, Mayor Stothert testified against LB 1222, a police oversight bill that would allow cities to better investigate police misconduct. Earlier this July, the mayor terminated a member of the all-volunteer board on which I serve because of perceived anti-police sentiments expressed on his Twitter without a discussion or communication with the board. All of this to say that the mayor clearly has a strong bias towards the police, to the point where she is willing to put her working relationship with the OPD above the well-being of her citizens. The budget was not written with the best interests of the city or its people in mind. Increasing spending to the police does not protect our city's residents or make their lives better. If we want to better our community and better the life of every Omaha resident, we must invest in community, not in policing. By the mayor's own words, the way to lower crime rates and protect our residents is through funding education, reducing poverty by way of social programs, and affordable or guaranteed housing for every Omaha resident by providing people with opportunity. We should be using the city's general fund for libraries, parks, public health, human rights efforts, housing, social programs, public transit, the arts, projects that make material changes in the lives of Omaha residents. You are all honorable public servants. Do your duty to the people you work for and invest in our communities. Thank you.
Thank you. Catherine Nixon, Emma Garcia, Talia Smith.
Hi, I'm Catherine Nixon, and I'm at 5006 California Street. First of all, I stand here today in solidarity with the protesters outside. I work for a nonprofit that services the elementary schools in the Omaha Public School District. We work to remedy the fact that many students in the OPS school system do not have books at home, which directly affects their reading habits and subsequently their lifelong academic and personal success. I am also a master's candidate studying epidemiology. My career and my education both tell me that the city of Omaha is severely misusing its money and funding frivolous shows of power as opposed to the people that actually make our city powerful. It's no question that the Omaha Police Department has been deliberately and aggressively misusing its state-protected power. I could give many firsthand accounts from the past few months of inhumane, disgusting treatment that the officers appear to find entertaining or even enjoyable. I would also like to state that this treatment is not anything new. It has been happening to the Black and brown communities in Omaha for decades. I had a lot more prepared, but I stand with everyone here saying that we need to defund the police and fund more community projects. And I'd also like to say that the people here aren't going away. This isn't going to end, and we're not going to give up. We're not going to stop. So we're going to keep coming back until we get what we need. Thank you.
Thank you. Emma Garcia, then Talia Smith, followed by Clarice Dombeck.
Hello. Emma Garcia, I'd say my address, right? 2464 Harney Street. I was one of the protesters who was kettled and unconstitutionally arrested on the bridge on August 25th. And I would like to say that I stand in solidarity with the protesters outside today. I stand in solidarity with those heavily policed, those lynched by officers of the supposed peace, a position and institution which we know is predicated on the supremacy of white folks over the most oppressed and marginalized people within our community. I wholly reject a system of institutionalized oppression that murders, subjugates, and degrades Black, brown, and indigenous people. I wholly reject a system that protects private property and, by extension, known white supremacist landowners over equitable justice for victims of white supremacy. I stand in solidarity with James Scurlock, Zachary Bareheels, and their families. I am here today to talk about the efficacy of using armed uniform patrol as a first response for those experiencing mental health struggles. Though it is just one way in which we can divest from a system that no longer serves us and invest and reallocate in departments, programs, and services that actually promote safety and prevent crime. On June 5th, 2017, Zachary Bareheels, a young Indigenous man, walked several miles to the Buc-ee's gas station on 60th Street. I am haunted and disturbed by the details of the story, as I'm sure many of your constituents are. Obviously, we saw that today. And disgusted that he has not seen proper justice, as 3 of the officers have gotten their jobs back, and none of them were criminally charged. A lot of these things that we see in the budget allocated to police are for wages and positions, right? For uniformed patrol. Those are 3 people that maybe shouldn't have those positions. Anyway, but the one thing that I haven't heard anyone mention is that on 60th Street, South 60th Street, only a short walk away, there's a Community Alliance transitional housing called Arbor House. To be clear, a group home where folks who have recently experienced a mental health crisis can get back on their feet. My mother lived there for almost a year. That is a short walk. Many folks who live at Arbor House walk to this very Buc-ee's on a daily basis, and the officers first responding should have been skilled in de-escalation. That is what community safety means to me, as my mother is a member of our community, just as much as anybody else. I would like to see a qualified first response to her crisis from clinical social workers, not from armed police. I'm aware that the mayor and city council are considering throwing some money at grant-funded programs doing this, such as Lutheran Family Services, but that is not enough. I would like to see a participatory, people-centered budget that invests in initiatives that actually prevent crime by meeting the most basic needs of the community, like housing and education. I also think it's interesting that Mayor Stuther would call unhoused people vagrants, especially because that's something she has to confront on a daily basis, and all of you do because they have eviction court downstairs. Thank you.
Talia Smith, followed by Clarice Dombeck, and then Chris Hasselbrook.
Is it good? Great. Talia Smith, 2565 Marcy Street. Obviously, many of you know me as I sat right there for 2 years, and so I'm hoping that my story today you'll take into consideration as one that you care about, as the police brutality has specifically affected me as well. But I also want to highlight that the story that I'm going to tell is not at all an isolated incident, and is not something that's just happened to me, and is an example of how Omaha is not so different than all of those other cities that we like to talk about how, because we have this one accreditation, we're not like those. So I was at the protests on 72nd and Dodge.
On top, there you go. There you go.
Didn't have to used to do that. I was at the protests on 72nd and Dodge, and this is what the money in the budget is being spent on. It's being spent on batons and tear gas to terrorize residents of Omaha. I was actually beaten by a police officer because I stepped off of the curb to help a friend. They took their baton, pushed me back, pushed me down, and I fell into the tear gas. I have really serious asthma, and I immediately went into an asthma attack where I couldn't speak and couldn't breathe. And so who actually helped me in that moment were the protesters who pulled me back and got me medical care. If I had been arrested and tackled like this person here, I don't think I'd be alive today, because I would have had no way of telling them that I couldn't breathe. So when we look at how the police is using their budget and on the weapons that they're buying, I'd like to ask who exactly is being protected and who exactly is being served. We showed up with water bottles and signs, and they showed up in riot gear and batons and tear gas. I've sat here and watched all of you approve purchases for departments, and I know that you approve the budgets and that you approve the purchases over a certain amount. They're going to continuously tell you, like they did with the night vision goggles, that this equipment is being used to save and rescue people. This is an image of a vehicle that says Rescue 1 on the side with a sniper pointed at protesters coming out the top. When it comes to the protest on the bridge, I too am appalled that we haven't heard anything from any of you. And again, we like to say how different we are from other cities. This is a picture of Bloody Sunday in Selma, Alabama in 1965. So please tell me exactly how different we are from those police forces. They kettled them on a bridge, tear gassed, and beat them. In Mississippi in 1964, Mayor Thompson bought guns and a tank that's now known as Thompson's Tank in order to address these protests. Do you want to be remembered like him, or like George Wallace? Or do you want to be remembered like John Lewis, who was on that bridge?
Thank you. Clarice Dombeck, Chris Hasselbrook, and Matt Johnson. Clarice? Chris Hasselbrook? I would remind people in attendance that applause is not allowed as part of the rules, and snapping your fingers is a form of applause and could get you removed from the chamber.
Chris Hasbrook, 242 North 248th Circle. We have seen calls to defund the police from members in our community. I'd like to remind everyone what happens when the police stand down. On June 1st of this year, after multiple consecutive days of riots, the Seattle Police Department was ordered to relinquish its police station in the Capitol Hill District in what would later be known as the 7-block Capitol Hill Autonomous Zone, or CHAZ. The CHAZ quickly established its own borders, laws, and a de facto armed security force. It did not take long for the CHAZ to devolve into lawlessness. From the start, robbery, extortion, assault, and rape were reported daily. The first shooting took place on June 7th. The second and third shooting on June 20th, and one of those was a fatality. The fourth shooting on June 21st. The fifth shooting took place on June 23rd, and the last shooting, which led to the dissolution of the CHAZ, took place on June 29th. On that night, two teenagers, a 14-year-old and a 16-year-old, stole a Jeep Grand Cherokee and went for a joyride around the Chaz. The 16-year-old was executed by the Chaz security force. And yes, he was executed. This is what happens when the police stand down and American citizens without training fill in the vacant space. Omaha Police Academy exists to provide that training. Specifically, 459 hours is mandated by the state of Nebraska, and in addition to that requirement, OPD provides an additional 301 hours to each officer to further needs. This training is necessary to avoid situations that occurred in the Chaz. We need smart officers who can maintain control in intense situations. To do that, they need to be funded. Thank you.
Thank you. Matt Johnson, followed by Haley Taylor and James Henricks. Matt?
First of all, thank you, council members, for sitting here. I know it's probably been a very exhausting day for you. My name is Matt Johnson, and I live at 7307 Parker Street. Plenty of people here have talked about facts and figures, and I'm sure you'll hear more before we're done. I'm here to speak to the moral and practical applications of this budget, in particular the budget for the Omaha Police Department. A quick background about myself. I moved to Omaha in 2012 after living in Nebraska since I was 14 years old. I love this city. I've made a home here, friends. I work proudly for a prominent Omaha company. I'm an active performer in the performing arts community, and I hope to start a family with my girlfriend in the next couple of years, though I am now starting to question if this is the city that I should do it in. I am a law-abiding citizen, and I have never been arrested or in trouble with the law. That is, until I dared walk down the street with a sign. I didn't deal drugs. I didn't cause property damage. I didn't hurt someone. I walked with a sign, and because of that, the Omaha Police Department saw fit to throw me to the ground, put me in cuffs so tight my fingers went numb, and then keep me in jail for nearly 24 hours, where they crammed myself and over 40 other men into a sweltering hot cell meant for only 14. The police met me with violence because I, and over 100 other people arrested with me, protested police violence. I think you instinctually recognize that this is wrong. The police are public servants, employees of the taxpayers of Omaha, and yet they saw fit to traumatize others and myself for attempting to hold them accountable. Mayor Stothert proposed an increase to the OPD budget, which is patently absurd. The OPD budget already takes over $151 of this city, which is over a third of our general funds. It is easily the most well-funded department. If you run a company and you have an employee that is not conducting themselves in a professional manner and actively harms your customers, you wouldn't give them a raise. You would certainly question why you're even paying their salary in the first place. The proposed OPD budget is $160,161. Think about what that money could be spent on. Think about the roads or public goods. You could fund better snow removal, maybe, perhaps. Don't reward violent or abusive behavior. Do the right thing and oppose this budget. Better yet, listen to Morgan Freeman and cut their budget by half. Thank you.
Thanks. Haley Taylor, James Henricks, Jasmine Harris.
Hi, hello, good evening. I'm Hallie Taylor. I live at 1416 South 16th Street. I'm going to be completely honest with you. I have been sitting here all night alongside the speakers and our community and deleted my speech. So I am speaking completely from who I am and where I am in the community. When I say to you, I am demanding that you listen to our fellow Omahans and understand how much pain there is in our community, how much sickness there is that we can help, how many problems there are that we can solve. And I really want you to sit with that and understand why we are asking for the Omaha Police Department to be defunded. It does not mean that there is not going to be violence. It does not mean that there is not going to be, a need for the police. But we are asking that in our Omaha, we are standing up. We are asking you to stand up. We are asking you to stand in your power. And we're asking you to work alongside of your community to make it happier, healthier, and safer for all of Omaha. I live, as you know, on 16th Street. I teach in a school in South Omaha, and it's important to me that I am in my community because seeing a student at the grocery store matters to them, and it matters to me. And through those small relationships, we are making positively all of the time. It's a lot easier to ask them to do something brave, like stand up and speak in front of their classmates. I want that same accountability for our city council. I want that same accountability for our police department. One of my friends has done wonderful research and has shared with us that over 40% of the Omaha Police Department budget is spent on uniformed beat cops, making twice, if not 3 times more than I am in my classroom every day working to make Omaha a better city. And if Omaha Police Department can tell us they're working every day to make Omaha the best it can possibly be, you would not hear this pain from our city. You would not hear the suffering. You would not see a complete division of white Omaha versus everyone else who is telling you to stand up and please, with integrity and intention and focus, do the right thing, right? I say that to my dance team always. Integrity is what happens behind closed doors when people aren't watching, right? When you don't have the cameras and you don't have the performance, it's a dance team. When you don't have the performance, who are you then? I don't want to know who your friends are. I don't want to know who you're in a country club with. I want to know who you are for our city, because I will come here as often as I can. 2 o'clock's really hard for a teacher to get here.
Thank you.
But I will come here as often as I can to ask you to stand with integrity and stand with our community, please. Thank you.
James Henricks, Jasmine Harris, and then Allison Peeler Kavanaugh.
My name is James Henricks. I live at 136 North 34th Street, 68131. Thank you for the opportunity to speak. I've come to address the City Council as an opponent of the proposed budget, specifically the increase in funding allocated to Omaha's Police Department. You are one of our last chances to be heard. Our community leaders do not acknowledge or comprehend the urgency of need in our communities. Now we sit in the repercussions of that neglect. There are countless deserving recipients of funding within our budget, and it is unacceptable that today representatives of OPD chose to imply that our mere survival depends on their sustained and continued increase in funding, despite the fact that our city as a whole has unprecedented needs. We do not need to demonize the police department to understand that an increase in budget is appalling. Our dismissal of the needs of our Black, Brown, and Indigenous communities has been a practice as long as the existence of this city. Now, in facing a global pandemic, we have a city and its communities moving through personal economic struggles. Don't you know that people want to thrive? We see you and the need for new processes and structure clearly, and we're ready to do this work with or without you. Although I don't understand the challenges you now face, you have a gift and an opportunity. So many of us are grateful for the clarity that we have gained collectively. We envy your power to influence these decisions. We can no longer live with the expectation that everyone can do it alone. We all require access to support every day. You know, this pandemic has allowed privilege some perspective. I wonder, do you believe that our community should pull themselves up by their bootstraps? We do not have access to the same lives. We do not have access to medication, childcare, and transportation, access to opportunities in work and education, and our most basic needs. Most basic needs. What about access to joy, access to health, and basic access to survival? Our city is equipped to be an example. We can prove we are capable of identifying the needs within our communities. We are capable of understanding the magnitude of problems a pandemic would bring our Black and brown communities, and we are capable of attempting intuitive and compassionate support to facilitate sustainable change. We have multiple emergent needs. Reallocating funds from our police department is left as the only logical source or solution. The only option we have, regardless of the implication that the police department is the only thing keeping us safe.
Thank you. Your time's expired.
I conclude by expressing my solidarity with the protesters outside.
Jasmine Harris, Allison Peeler Kavanaugh, and then Jessica McCallie.
Good evening, council members. My name is Jasmine Harris, 5014 Pratt Street. Everybody has said everything already. I think my paper got lost in the shuffle. So we've heard the calls for defunding the police, the calls for investing in our communities. And I stand here to say we must listen to our community members and ensure that we are taking their voices not only into consideration, but putting their recommendations on the table and including them in those processes to ensure that we do what the community wants. A lot of people here are not saying that they're anti-police, but they are pro-community. And we have to ensure that our community is being built. When Mayor Stothard proposed this budget, she said that I will absolutely not defund the police. It's a both for community service projects. So when I look at the budget for the police department, and then I look at the budget for community service programs, there is a big deficit in that. Chief Schmatter also told you all that if the budget was cut, prevention efforts would be damaged. I know Councilman Gray knows what I've been doing in the community. Over the past decade, I've worked in public health prevention models. I've worked to prevent people going back into incarceration after coming out of correctional facilities. When the police show up to a situation, that is not prevention, that is treatment. We're too late. So we need to make sure that we are funding the community programs that the people here are talking about. One of the other testifiers talked about CAHOOTS, which is in Eugene, Oregon, which is crisis assistance, helping out on the streets. There's another model called LEAD, where it's law enforcement assisted diversion. We have to begin diverting our people from the criminal justice system. We've heard over and over that community programs is best for prevention. And I can tell you that that is true. We have to start looking at those social determinants, affordable and safe housing, employment, transportation. What better way to do that than to have a community participatory budgeting process? Because as we've been told, we're already too late talking to you all about this budget right now. It's 10 o'clock at night. So let's come up with a way. How about we all pay into a restaurant tax, give the community that access to decide what happens with that restaurant tax and that money so that we can fund the programs that we know are going to work. One of the things I would like to see, more buy-in from the grass tops, from the elected officials, because the grassroots are doing this work. Thank you.
Thank you. Allison Peeler Kavanaugh, then Jessica McCallie, followed by Taylor Thornburg.
Hello, everyone. I'm Allie Peeler Kavanaugh. My address is 724 North 48th Street. I live in Dundee. Pete, you are my representative. I appreciate you all listening to everyone. There's a lot of concern we have, rightfully so. I stand in solidarity with the protesters outside. I also am here I have emailed and sent a lot of my concerns, so I just want to speak from my heart right now. What a lot of us are talking about was the shock, although not surprised when we saw the proposed budget by Gene Stothert for 2021. We are in an extraordinary time right now. While I'm a musician and performer, I run a lot of different shows. Our venues are, I'm a mother, I have 2 kids. Just the idea of schooling, there's a lot going on with our community, as you know, as you've gotten messages, emails, phone calls, as you've heard today. Outraged. This is an opportunity with our budget to actually say that Omaha cares about our community, cares about what is going on with our small businesses. Instead, Gene insulted everyone, and the entire call from our community members, our leaders, the leaders who are emerging in our community that actually want to give back to our hurting and disadvantaged, vulnerable communities right now. You're not listening to them. Which is why we're here, but again, too late, perhaps, because you guys have to vote on this here soon. But it's your responsibility, and it is your opportunity to not approve the increase in budget for OPD. We need to be giving it to, as we're already saying, preventative measures. Pumping money into police does not prevent crime. Helping homelessness, helping food insecurity, helping education, helping mental health. We've all talked about this. I'm just repeating everything. So. I know you've been here all day. I've been waiting to. It's been a hard one, but really, this is your responsibility to do it right. 2021. This is and it's an incredible year that what we're facing, and so the budget should reflect that, and it doesn't right now. In fact, it's tone deaf. It's rude. It's insulting to everyone, as you've heard. And so what we're saying is, please reflect and listen to what everyone's saying. I could go on about how disappointed I am about the bias that Gene and Don Klein have expressed and shown. I knew Jake Gardner. I worked with him for years. He's a white supremacist. He's a known drug user. They didn't drug test him. There's bias in how they handled Jake, and I'm upset by that. That's why I'm here today. That's why I'm still here. You need to know that there's reason why people are upset, how this has been handled by the police department, how the protesters have been handled. And we're not going anywhere. And all of you, we need more representatives. I'm a renter. There are none of you guys are renters. None of you are industry workers. We need a more diverse group up here. And so many of you, I hope you don't run again, to be honest. I hope we get a lot more leaders popping up and running. And I know some of you have already said you're not, and I appreciate you, Pete. But if this budget passes, I will be running for city council. And I hope many more people do. And you're gonna see us, and we're not going anywhere, because we need a way bigger, diverse group up here. Thank you so much.
Jessica McCallie, Taylor Thornburg, and Leah Vinton.
My name is Jessica McCallie, and my address is 1114 Jones Street. I'm here in solidarity with the protesters outside, demanding a no vote for any proposed budget that does not decrease spending on our police. We know that the police do not keep us safe. They do not prevent crime. They pick and choose who they serve, meaning they do not equally enforce the law. This disproportionately harms our Black, Brown, and Indigenous community members. They often escalate situations that desperately need de-escalation. They perpetuate a punitive justice system that does not seek community restoration. In fact, it often seeks profit, where the police function as the heavy, going around extracting money from people for small offenses. They also murder people, and they are empowered by impunity. It is worth noting that the majority white communities who rally behind increased police spending often do not come in contact with the police. This is not because they aren't abusing their spouses or abusing substances, shoplifting, driving drunk, or with expired plates. Because we do not fund human services, this happens in all communities in our city. It is because they are not being over-policed. Their children are given second chances. They often don't experience navigating the so-called justice system, so they don't even know what they are propping up. They are saying this isn't a problem for me, so it's not a real problem. They are conflating policing Black people with patriotism, and because of this, you must take their words with a grain of salt. If we look at some of the ways our city is failing our people, policing is not a solution for any of them. Drunk driving, substance abuse, lack of mental health resources, domestic abuse, sexual assault, unhoused people, poverty, you've been hearing all of this. The police are not equipped to handle these issues, nor should they have to. I also question why they would want to. And when we continue to overfund the police and underfund everything else, we are left with a major problem. We have to call on them to solve everything, which is a false inflation of need. We need social workers, affordable housing, reliable 24/7 public transportation that serves every part of the city. We need community centers and food sovereignty, health services and childcare. We need to empower and invest in our marginalized communities and look at ways to help provide healing and reparations for the numerous racist atrocities that have plagued North Omaha for decades. Currently, we rely a lot on nonprofits to provide these services, and they do not have the infrastructure necessary to serve everyone, nor are they run by democratically elected officials. They are often in the hands of a few wealthy families. With the power of more city funding, we could provide so much more for so many more. Council members, you have an opportunity to help the people you are meant to uplift. Take a stand against increased police funding, push for allocation towards human services, and urge your fellow members to do the same. Police currently get nearly 40% of funding, so there is plenty to reallocate. Let's actually protect and serve by funding the people instead. Thank you.
Thank you. Taylor Thornburg, Leah Vinton, Jennifer Penton.
Hello. Oh. Hey. Before I begin, I'd like to thank the council for sitting here with us tonight. It's been a very long night. My name is Taylor Thornburg. I live at 5004 Davenport Street, Omaha, Nebraska 68132. Councilman Festerson, this puts me in your district. I thank you especially for your time and for hearing my testimony this evening. Next time we vote for city council, it is tonight that I will be thinking about. This testimony is in solidarity with the protesters outside. I will be short and succinct, not only because brevity is the soul of wits, but because what must be said is simple and straightforward. On Tuesday, July 21st, Mayor Gene Stothert proposed increasing the Omaha Police Department's budget to $162 million. Frankly, this is an irresponsible and dangerous use of the people's resources. The Omaha Police Department does not deserve $1, let alone $162 million. Now, I know it's been a long night and we are tired. I'm tired, and if I'm tired, you are tired, and people have been beating around the bush all night. I refuse to do so when I say very straightforwardly, Omaha Police Department is an inhumane pack of racist oppressor dogs. If they deserve $1 million of anything, they deserve $1 million muzzles. OPD is responsible for almost executing an innocent man on Thursday, July 30th. OPD is responsible for violating the human rights of more than 100 people on July 25th. OPD is responsible for overwhelming Douglas County Corrections, where they crammed 40 to 50 people in cells built for no more than 15. OPD is responsible for withholding food and water from these people in petty retaliation to their criticisms. OPD is responsible for beating, choking, terrorizing these people, nearly tearing hair from scalp and forcing some to piss on themselves and their neighbors while they laughed and they watched. God damn, they turned 17th and Jones into a Guantanamo Bay and Omaha into a war zone. The pigs against the people. Recently, OPD Chief Schmaderer went on record to say he's fine with this. In fact, days after Chief Schmaderer expressed his smug satisfaction with his Guantanamo and his war zone, he threatened to remove community protection if the police department didn't receive an increase in funding. If anyone else leveraged their job against a pay raise, they would be fired. We the people suggest we do the same. Instead of increasing police funding, the people demand we feed our children. Between 2018 and 2019, 75% of Omaha public school students were so starved they received free or reduced lunch at school. The people demand we house our neighbors. The last time the metro area continuum of care for the homeless counted, people on the public housing unit waiting list were waiting for about 11 and a half years. With an exploding COVID-19 positive population, our city is sick. The people demand funding for health care. We the people cannot afford to hand over millions of dollars to the rabid pack of racist oppressor dogs holding our city hostage. Doing so is a declaration of total war. The pigs against the people. For the sake of avoiding a war and meeting the demands of the people, we humbly ask, defang the beasts, defund the police. Thank you.
Leah Vinton, Jennifer Penton, Lionel Quinn.
Hi, I'm Leah Vinton. I live at 325 South 69th Street, Omaha, Nebraska 68132. Dear council members, and I'm also addressing the mayor, I appreciate the personal time and effort you all give to ensure the governance of the city of Omaha. I am here as a private citizen and support the brave work of local organizations and movements like Pro-Black, Omaha Abolition Research, and Educators for Black Lives. Thank you to my councilman and President Jerem for publicly on social media supporting Black Lives Matter and the protest movement in Omaha. It has been said that we are living through two pandemics, COVID-19 and systemic racism. I am sorry to say that the performance of the mayor and this body has not yet risen to the challenge. Tonight, you have an opportunity to show your community and the nation that we understand the seriousness of COVID-19 and systemic racism. We understand that these are truly life and death decisions for people of color right here in Omaha. This is the moment to show your moral courage. You have the power to truly make a difference in our community, which ranks in the top 20% most segregated communities in the US. At a moment when COVID-19 is only exacerbating the disparities in wealth and health, why are you choosing to increase the general fund spending for the Omaha Police Department to almost 40% of the general fund? Why? Why are you utilizing CARES Act funding to support the OPD when we have record rates of hunger and unemployment in our city? And I have met these families. People are starving. If there is ever a time to invest more in North and South Omaha to ensure we have a more robust transportation system to offer supplemental support to struggling families, it is now. Why are we instead choosing to continue inflating the OPD's budget at a time when they have made national news for their mishandling of racial justice protests and the investigation of the unjust death of James Scurlock? We do know the root causes of violence, crime, and poverty. Why do we continue to ignore volumes of rigorous studies and evidence that increasing policing does not decrease crime rates? We need to invest in more creative solutions, more innovative solutions, more humane solutions that will make Omaha a better place to live for all of us. And I'm sorry, but the new diversity and inclusion position that you've included isn't going to cut it. It's not enough to reverse the centuries of racism, discrimination, and underinvestment in the communities of color in Omaha. I urge you to be bold, to be brave, and help us build a more resilient and just Omaha. We will be vigilant in holding you to account. Elections are coming, and we will organize and support candidates that share our vision for reconciliation and justice in Omaha. Thank you for your time.
Thank you. Jennifer Penton, Lionel Quinn, Jackie Kappas.
Hello, Jennifer Penton. My address is 2712 North 48th Avenue. Before I begin what I have prepared, I would just like to point out that I've noticed that a lot of you have been nodding off and falling asleep, kind of. I understand that you're very tired, as we all are. You've been here all day. We've been here all night. I would ask you to wake up. There are still people in this room that have a lot of important things to say. I would also like you to wake up because there are people that do work these hours all day, 6 days a week, 7 days a week, and that is because they do not have job opportunities, because they are put into systems because of unnecessary police brutality. So while I'm asking you to wake up in this moment, I'm saying it as a much more general statement, and I'm telling you to wake up because you have a moment to change history right now. On that note, I do have a video to play for you. I'm just going to play the sound.
Sir, excuse me. Excuse me.
As you can hear in that troubling video, children are crying. The people of Omaha are screaming because the police are violating their rights. That is at the protest of July 25th of this year. We are here today to call on you as our elected representatives to hear our demands of defunding the police. We want to remind you that you work for the people of Omaha, not Mayor Gene Stothard and not Governor Pete Ricketts. Our community has a long list of issues with the Omaha Police Department. There are decades of misconduct, and we are here to discuss their funding. Their practices have proven time and time again to be racist, aggressive, and unnecessary. Omaha is one of the most segregated communities in this nation. We are one of the most dangerous cities in our country for Black, brown, indigenous, queer, and trans youth. The issue of over-policing becomes compounded. Police officers are making hundreds of thousands of dollars to brutalize Omaha. By only investing in police, we deny opportunities to the people of Omaha and continue cycles of oppression. In the past 14 years, the police budget has increased 85%. In the same 14 years, the city of Omaha's population has grown by a mere 8%. This is a disproportionate use of our money and has resulted in gutted communities and local leadership at the mercy of the police. Who are you beholden to? Are you beholden to the community members who you were elected to represent, or the cops? Where are our priorities? The proposed budget for our city is only looking to allocate 0.3% for human rights and relations work.
Your time's expired. Thank you. Lionel Quinn, Jackie Kappas, then Lucas Perez Leahy.
Linnell Quinn, 1441 Giles Street. Okay. To just start off, I just want to appreciate each and every one of you for being here. That includes City Council and all of those that came up before. I'm pretty certain that this bill will pass and Gene Starther's bill will definitely go into law. Because, I mean, out of all of you that have heard the concerns, the real concerns of our citizens, it's still going to happen. And that's just because that's just how politics play. They pretend like they hear you and they listen. They probably do, but they're going to go with the agenda they already pre-chose. Pre-biasness. It's already in there. Now, because that's already going to pass, let's just try to, I guess, focus on what we can do. Today, I'm going to stand up for the victims, those that have been affected by the police. And let me just be clear, there are some great people that serve our community and that serve our departments. But it's those that are silent that makes it hard for us to be able to pick out who those people are, because they don't get an opportunity to speak. And when they speak, they're told to be silent. Now, I say this out of a little bit of experience when I worked at the County Department of Corrections. It was sad because when they called for officer assistance, it was kind of like, all right, let's get ready to go. Let's go and handle this one person. About 6 to 8 officers responding to one person, causing great damage to that person. They screaming and yelling for help. But right afterwards, we were talking about and bragging about how wonderful it felt to have to put somebody's face to the ground. So don't pretend like that doesn't happen, because it does. So again, I'm not here to focus on the defunding of the police or the speech, because I already know it's going to pass. It's going to pass. And oh, and hello, Gene. If you're watching, hello, Gene. Anyway, back at the task at hand, because I know I only got a few minutes left. I'm here to stand for Tim Harding and Ernest Jackson. People that have encountered with police, like, again, Tim Harding, the gentleman that was handcuffed already on the ground because he just so happened to fit the description. That he was handcuffed and his face had to hit the ground with his hands behind his back cuffed, and 8 other officers responded. Overuse of force, overuse of contact. So if we're going to do anything with the budget, I'm just going to ask the police, because like I said, you're going to have your way anyway. Please take in consideration that what if it were you that was the ones that were people that were looking at you like you were guilty just because of you fitting the description, or that you just so happen to be in the area at the wrong time. Remember, we have to look at both sides. There are both sides and truth to the story. We can't be biased to what that one officer or officers say. We have to look at the people and realize that they deserve a chance.
Thank you.
In conclusion, please start offering money to those that have been traumatized by police contact, because his children and his family will be traumatized for this for life. They need some help, and we need to be able to get that money to them. Thank you.
Jackie Kappas, Lucas Perez Leahy, Maria Corpus.
Jackie Kappas, 5007 Western Ave, Omaha, Nebraska, 68132. Thank you for your time. As we have seen tonight, there are many concerned citizens of Omaha who want to and deserve to have their say about the city's budget. This seems difficult when we are just being invited at the end of the process. I, with many of my fellow citizens, stand to say that I find it abhorrent and disappointing that despite numerous calls to begin defunding the police and reinvesting in communities, and despite piles upon piles of research that shows increased police budget does not equal increased community safety, the budget for the police has increased. There are so many points to make here, and I hope you have listened closely to those who have graciously shared their human experience, their research, and their dreams for an Omaha where we use the exorbitant funds dumped into policing and into policing, over-policing certain communities, largely Black and brown communities, into programs that nurture, support, and lift up the citizens that Omaha needs for a more just and vital future. With that said, I want to come back to the concerned citizens in this room who have been heard too little and invited in too late in regards to how our city is spending our money. I call for Omaha to begin moving towards a participatory budgeting process. The people of Omaha care where our money goes and want more transparency as to the process and priorities of those making decisions for us. In fact, don't make decisions for us. Make them with us in a participatory budgeting process that gives community members say over how funds are spent, what programs we want to fund for our communities, and insight into how these decisions are made. In Seattle, over 3,000 young people in a program called Youth Voice and Youth Choice program decided how to spend over $700,000 in funding for services for youth and for people experiencing houselessness. In Durham, North Carolina, community stakeholders and nonprofits were enlisted to help spread the word to schools, churches, and communities that participatory budgeting was being used to determine how over $2.4 million would be spent in their community. This process has been successful in numerous other cities, including St. Louis, Missouri, Louisville, Kentucky, Charlottesville, Virginia, Atlanta, Georgia, San Antonio, Texas, Phoenix, Arizona, Bloomington, Indiana, and many other places. And participatory budgeting is shown to increase participation in democracy and community organization, increase understanding of the government process, and increase citizens' perception of their government as effective, along with reports of communities feeling increased feelings of health and well-being due to the programs they choose to fund and support. Don't give us a budget. Let us and our priorities shape the budget that we give you. There are many ways to do this that involve more people, show you who is talking, what they are talking about, and how to make changes that are citizen-centered. Furthermore, many of the participatory budgets start with young people, and as an educator and a licensed marriage and family therapist working with children, I can tell you that they want to be heard, and they are here, and they deserve to be heard. Thank you for your time.
Thank you. Lucas Perez Leahy, Maria Corpus, followed by Amy Carey.
Lucas Perez Leahy, 4544 North 16th Street, Omaha, Nebraska 68110. I'm here to speak in opposition not only to the 1% increase in OPD's funding proposed by our mayor, but also, and more importantly, to the fact that nearly 40% of the general fund within the proposed budget is allocated to policing. Excluding the fire department, the OPD budget exceeds that of every other part of the budget combined. We've heard this evening that OPD is an exemplar for the nation, that OPD is truly a cut above the police departments of Minneapolis, of Seattle, Louisville, Atlanta. This thanks to the work of the chief of police, to the mayor, to the city council. Respectfully, if such a list exists, I don't know that Omaha Police Officers Association and its president, Anthony Connor, belong on that list, seeing as how they got the officers who murdered Zachary Bearhills their jobs back. And Mr. Connor frequently shares social media content from an individual that provides kill lists to Atomwaffen, a neo-Nazi terrorist network. As a side note, it should be no surprise, therefore, that the Back the Blue rally did have numerous white supremacists, including the Proud Boys present, though Connor had never heard of the Proud Boys. Another unknown white supremacist, Jake Gardner, was illegally carrying a firearm inside of a bar with an expired concealed carry permit, using racial slurs, illegally fired off warning shots, and then murdered James Scurlock, who heroically charged at an active shooter with no way of knowing that the racist shots were fired in warning. Now, James Scurlock wasn't a cop, right? But what did OPD do? So obviously they're not the city, they're not the DA, they're not the prosecutors. But what they did do was take selfies in front of the bar where the murder took place. Probably not the best move for police community relations. In addition to firing tear gas in the middle of a pandemic and quote unquote less lethal rounds and projectiles aiming for the head. I'm not satisfied with better than Minneapolis. I'm not satisfied with better than other cities when, for men of all races, aged 25 to 29, police are the 6th leading cause of death. We can do better than better. And there are folks who tell us that if we talk about this, we're going to throw away all the progress that we've made in terms of community police relations. I understand those concerns, and I'm grateful for that progress, but to those who have these concerns, I would echo the words of someone that spoke earlier in quoting from a letter from a Birmingham jail by Dr. King. I have almost reached the regrettable conclusion that the great stumbling block to freedom is not the Ku Klux Klan member, but is the moderate who is more devoted to order than to justice, who prefers a negative peace, which is the absence of tension, to a positive peace, which is the presence of justice.
Thank you.
Thank you.
Maria Corpus, Amy Carey, then John Pappin.
Good evening. My name is Maria Corpus, and I live at 13341 Woolworth Ave, 68144. First of all, thank you for finally invoking a mask mandate for our city of Omaha. It calms my anxiety to be able to go out to the store, to not have to be worried about bringing home COVID-19 during this time. I want to share with you a compilation of notes from a walk, some of my tweets, some therapy, and ultimately research and conversations I have had at a community talk show that I host called Nightcaps. Councilmember Ben Gray has been a guest on the show. Good to see you. At Nightcaps, we engage in open and understanding conversation for and with the people. I started it because I realized that I needed to become better equipped to have conversations about where taxes should go, who has power and to do what, or even my rights as a citizen. Who better to learn from than our community right here? Omaha exists in the heart of America, and we have the opportunity to lead change with humility, accountability, and creativity. I ask you to soften your hearts. Take a deep breath. Look around. We're all living in anger, and at the root of that anger is fear. I feel angry when there is violence on our streets, and what I need is accountability. I feel scared when an increase in funding is going to terrorizing institutions, and what I need are more resources going to the Human Rights and Relations departments, to libraries, to parks, to schools in North and South Omaha. I want to believe that all cops aren't bad. I want to believe that all politicians aren't liars, but recently you have not been holding each other accountable. You may be afraid of losing your privilege, or maybe your power, while others in the community are afraid of losing their loved ones in the midst of a pandemic, losing their housing, not having access to health care, or even greater, their lives. I do not want to live in fear or anger, and I don't think that you do either. Can we create a world of healing together? We can't fully help our others without first helping ourselves. So I ask you to think about the last time you sat and reflected on what exactly drives that fear burning inside of you. What mind structures have you been living in that need to be torn down to make way for something better? I'm here to tell you that it's okay to be wrong, but now is the time to change. This is your second chance, after giving the goggles some money, at getting this right. It is a great challenge to admit that you are wrong, but each and every one of us has been there. The reward of growth outweighs the fear of shame. To quote Brené Brown, feeling shame when being held accountable is not the same thing as being shamed. But the people here will continue to hold you accountable.
Thank you.
Thank you.
Amy Carey, followed by John Pappin, and then Fallon Strong.
Hi again. Amy Carey, 2129 Ridgewood Avenue. First off, thank you for your unanimous vote to pass the mask ordinance today. Last night I attended an informational meeting pertaining to this budget, and besides the excellent research provided by Omaha Abolition Research, which I hope you're familiarizing yourself with, my two takeaways from the representative presenting from the mayor's office were this. 1, the annual budget process needs more transparency that requires realistic timelines. The time lapse between its initial submission by the mayor and then subsequent review and vote doesn't fully allow the constituents and council members to take an adequate review and consideration for response. And 2, there was also an urging to understand the amount of time put into this process goes back much further in the year than its submission. And if anyone speaking today really wanted to make change, we needed to be here a long time ago. Fair enough. But we're here now. And given the environment of our national and local civil unrest and global health crisis, we've all had to pivot. We've all had to rethink the work and plans that we put into countless hours of time and energy into. We've all had to rethink our finances and what deserves our attention. This year doesn't look as any of us imagined it. We've all had to do redundant work to be productive. So I ask, what exempts this council from doing the same? What makes Omaha unique? Nothing. This budget needs re-examining since the days it was prepared. There are several examples of cities, most specifically Raleigh-Durham, who are comparable to Omaha in population, crime, and resources, and have successfully reappropriated funds, most specifically police funds, in the last 60 days. This is the role you've chosen, and now it's going to require redundant work, and we're asking you to do it. We're asking you to get this right and dismantle archaic, crumbling systems built on white privilege and supremacy. I know you've all had your meetings before the meeting to form conclusions, but I truly hope you're listening. Old protocols and systems are just that, old. Please make this budget a rejection of it with a goal to reappropriate funding, part of a new Omaha that actually serves all. Thank you.
Thank you. John Pappin. Okay. John's not here. Fallon Strong or Karen Dolan, followed by Amanda Huckins, and then Craig Baumgart.
Okay, I'm Karen Dolan. I live at 131 North 34th Street. Okay, so violence isn't always in brutalized arrests or in blatant murder on the streets that you drive on to work every single day. Violence is the prioritization of capital and tradition over human life and sustainability, especially for Black, Brown, and Indigenous lives. Heavy policing does not equal safety. The white suburbs that people hide in to avoid the hard facts and systemic violence aren't safer because they are policed appropriately. Crime prevention starts with opportunity, funding social programming that fosters a community, all the while valuing human life over wealth. When will you believe, and who will you believe? Who are the police protecting and serving? Because the people in here are spilling their hearts and minds, begging you to listen to them, that they're telling the truth. Communities rely on one another for strength, support, and consolence with each other. I'm privileged, I'm white, I'm from the suburbs, just like some of the other pro-police people in here. Yet I know that our Black, Brown, and Indigenous brothers and sisters are not only telling you the truth of our current situation, but dropping a metaphorical piano onto your head of information and experiences from the last 100+ years. When I was arrested and put into the holding cell with 50 other people, the officers and correctional officers took joy in our cell flooding and denying phone calls and in making us angry. And again, what Taylor mentioned as petty retaliation. I don't want money going to that kind of injustice. Where was it? Oh, crime isn't random. Crime doesn't happen in a vacuum. Open your eyes and ears to the people outside of your privileged bubble. Cops lie to protect themselves. And we're not going to stop, so start getting comfortable with being uncomfortable.
Thank you. Karen, followed by Amanda Huckins, and then Craig Baumgart.
My name's Amanda Huckins.
Oh, that was
Yep,
just
Karen just went.
Okay. I'm a little tired.
That's okay. I am too. I came here from work and I started work at 8 like a lot of people. So I'm here as a volunteer and I'm going to say this little piece. So many people have been talking about things I agree with. So I want to state first that, okay, Amanda Huckins from 521 North 33rd Street. And I oppose the recommended allocation of over 37% of the general fund city budget to the Omaha Police Department. I'm here in solidarity with the pro-black protesters outside and with the people of our city who have been or will be brutalized, surveilled, detained, and incarcerated because of uneven and racist enforcement of laws by the Omaha Police Department, as has been mentioned multiple times tonight. I'm going to use my time to remind everybody of a couple examples of police brutality that have occurred recently. One that Linnell brought up, and I wanted to read specifically because I was really infuriated when I heard about this incident that happened at the end of July. Okay, so this is from the news article. In a statement sent to KETV, Omaha police said that they were in the area near 48th and Northwest Radial Highway looking for an armed suspect that ran from a traffic stop. The suspect was described as a black male, dreadlocks, gray tank top, dark shorts, armed with a handgun. A command officer observed Timothy Hardy and asked for a repeat of the description, and then asked if the suspect was heavy-set, and was told yes over the radio. The command officer then indicated that he had a party fitting the description but wearing white shorts, which means he didn't fit the description, and he was thrown on the ground with a gun to his head in front of his children. As Linnell said, people who are brutalized by the police, even mistakenly, need to have mental health supports and need to be given something for what was taken from them in those moments. That's horrifying. Imagine if you had to watch your kids with a gun to their head on the ground for no reason other than he was walking his neighbor home because he heard the sirens. He wanted to make sure someone else was safe and he put himself in danger. And he said that the thing that went through his mind is that his children would have to watch him murdered. He wasn't thinking of himself. He was thinking of that horrible trauma. And our police officers put them all through that trauma and walked away. They didn't say anything to him. They walked away. This is horrifying. I cannot stand to see this happening in my city, and you shouldn't be able to either. I'm not probably going to have time to talk more about Octavius Johnson. I don't think enough people know about how he was brutalized and how his family members were brutalized in 2013. I was going to read a whole thing, but I know most of the facts of it. The police officers showed up because the tow truck driver was going to take away a car that was registered to him, and he was then put in a chokehold. Over 20 officers, including a command officer, were called to the house. They took the cell phones of Octavius's two brothers. They charged into his house and knocked his aunt out of a wheelchair, left her on the ground, and then handcuffed her. They beat him, Octavius Johnson, in the street. The video shows the officer looking up to make sure no one was watching and then continuing to hit him in the head. Okay, the only reason that anything happened to these officers is because a neighbor was hiding, filming. That's the only evidence we have because they never got their cell phones and cameras back. Okay, if police are doing this and they're only getting caught because someone's secretly filming them, I have to assume that it's happening more often than we know about. And I need that to stop.
Thank you. Craig Baumgart?
Hi, my name is Dr. Craig Baumgart. I reside at 87 42nd Street in Omaha here. I'm a clinician and associate professor of internal medicine in your district, President Jerem. I speak today as a concerned citizen taxpayer, though, and my views do not reflect those of my workplace. Since March, I have been on the front line. I've been a frontline healthcare worker who's taken care of well over 150 hospitalized COVID patients, and I listened to the testimony earlier and thanked the Douglas County Board of Health and the City Council for their actions and considerations. I rise today to ask for your consideration on another issue. At the protests on Saturday, May 30th, I volunteered as a medic after having taken care of several eye lacerations, minor burns, and trauma the night before. What I witnessed and personally endured at the hands of the police cannot be summarized in a short statement. Upon my arrival, I was directed to a line of police officers in a parking lot, identified myself as a doctor, and was pointed to the end of the line. I put away my cell phone, and immediately 3 cans of tear gas were at my feet. Geneva Convention outlaws both the use of CS gas in warfare and violence against medics. Make that a note. That night, my fiance and I saved the life of a white supremacist who was yelling racial slurs and was ultimately attacked downtown. We reached him unconscious and agonal breathing in critical condition with a cranial injury and scalp laceration. We, not the police, removed the crowd and provided aid until EMTs arrived. Moments after cleaning his blood from the street, the same police that stood by and watched me care for the man shot me with pepper balls. I could speak to the many aspects of this today. I think we are all aware of the idea of divesting funds away from an exceptionally funded law enforcement agencies and towards community resources. In medicine, when a mistake is made, we do a thing called root cause analysis. The purpose of this exercise is to evaluate a situation and determine what the root cause was. When doing a proper RCA, you don't stop with simple answers, you deeply examine the problem. The problem of police brutality runs deeper than good and bad apples, deeper than racist individuals within the department. It relates back to the institution itself, founded as a replacement for slavery, and it relates to years and years of systemic problems exacerbated by police. Today, the problem is a problem of over-policing. We focus on crime and fail to recognize the failure of police. The idea of meeting the problem of crime at its root cause is essential to our ability to unite and unify as a nation. Furthermore, this is a public health issue at its core. The social determinants of health, please look them up, are vital to crime prevention. Over-policing does not prevent crime, and we can do better if we embrace new approaches to crime instead of the same approaches that decimate our communities. Preventative medicine saves the system money by preventing illnesses, much in the same way that we could divest and invest in preventative care for our high crime communities. Doctors have failed people of color in substandard care, racist practices, and using them for our experimentation in the past. We have a history of racism in medicine, but in medicine, we acknowledge these problems, study them, and work to fix them. We don't silence those that bring up our concerns. The police, and specifically OPD and the chiefs of police, do. They've made it clear that they're in their actions over the past 3 months. If I make a mistake in my job, I don't get bigger grants, more funds, and a raise. And the fact that the city proposes during a budget shortfall to do this and in this climate is a slap in the face and incredibly tone deaf to both the frontline healthcare workers working in this pandemic, who aren't receiving funds because of it, and the people of color who stand up and protest in the streets.
Thank you. This concludes the public hearing on the mayor's proposed 2021 budget. The vote on the budget and any possible proposed amendments is next Tuesday, August 18th at 2 p.m. in this chamber. We thank everyone for coming and sharing their views on the budget for 2021. Is there a motion? Roll call.
Palermo. Festerson. Gray. Harding. Melton. Pauls. Mr. President.
Yes.
Motion passed 7-0. Meeting is adjourned at 10:22. Okay.